Hello, ma'am. Good morning.
Good morning. Are you able to hear me?
Yes, you are audible.
Okay, you are loud and clear too. Yeah.
Myself, Dr. Hema, Registrar, and I extendedly welcome you on this virtual platform.
Thank
I think
you.
आहूजा जी, अंकित जी, आहूजा जी, बोलिए उनको आ जाए. I think guest आ गए सारे.
Good morning.
Namaste, ma'am. Dr. Sneha, ma'am.
Namaste.
Namaste.
Namaste, ma'am.
Namaste. Good morning.
We are waiting for the chief guest also. Our advisor sir and our chief guest will join us in few minutes. So we are waiting for them.
Namaste, ma'am. Namaste to all the invited speakers.
Namaste, Pramenda.
Namaste,
Yeah,
sir. Namaste,
actually
Prof.
we are in means all the guests are just connecting, so we are just in that time lag phase of 5 minutes, and then we will officially start this program. Honorable respected registrar ma'am has already joined, and Honorable Advisor Sir is about to join, and Chairman of Education Regulation Committee, Pharmacy Council of India, Dr. Deependra Singh Sir is also about to join within 5 minutes. So then we will officially start the proceedings of the conference. And of course, it's a matter of great pleasure for us that learned faculties and other experts from more than 11 countries are joining with us. So it's just a 5 minutes lag. We are just connecting.
Welcome,
I, I just communicated with the experts. Just in 2 minutes lag, they are just joining. Then we will officially start the proceedings. And meanwhile,
welcome, Dr. Vikram.
Good morning, everyone.
yeah, Dr. Vikram has also joined RRPA Uttar Pradesh. So,
Good morning, everyone.
yeah, good morning, sir.
Good morning. Good morning,
Good
sir.
morning, sir.
Nice
Dr.
to see you
Nurullah
all of
sir
you
has
this
also
platform.
joined from Ethiopia. Dr. Bama ma'am has joined from Malaysia. Other dignitaries from more countries are joining, and of course, PCI president or PCI chairman of committee is also joining. So it's just a 2 minutes lag. Then it will be a really brainstorming session for all of us. And meanwhile, uh, honorable advisor sir will also be joining us soon. So, namaste, all respected guests. Our torch bearer, respected Mithilesh Garg ma'am, who is the chairperson of the university. Respected advisor sir, Dr. Vedant Garg sir, Mr. Vedant Garg sir, who has bear torch from many years for the university. Respected registrar ma'am, who is the real executing body, who is really putting 24 hours effort for this university, and so that only university is growing like anything at this stage. My co-convener, Dr. Ankit Bhargav sir, and invited guests, Dr. Sneha Ambavani ma'am. She is ma'am is professor and head Department of Pharmacology, All India Institute of Medical Science, Jaipur. Bama V Menon ma'am. Ma'am is Deputy Dean in KPJ Healthcare University, Malaysia. Dr. Nurullah sir. Nurullah sir is a professor in pharmacy, is connecting from Ethiopia. In addition, in the coming days, the speakers from Belgium, USA, UK, and many more countries are about to connect with us. Of course, the chairman of Education Regulation Committee, Pharmacy Council of India, is just trying to connect with us. So, sir has joined. So, namaste, respected Deependra sir. Sir is we can say at present, the Pharmacy Council of India is being executed by Dr. Deependra Singh sir a lot. As here, Dr. Hema Bafila ma'am is executive body. Similarly, Dr. Deependra Singh sir is the chairman of Education Regulation Committee, and we know in India, basically pharmacy, the purpose of Pharmacy Council of India is to regulate education, and sir is the chairman of that Education Regulation Committee, Pharmacy Council of India. In fact, sir is in a program at present with a, I will not, I mean, sir is at present in a program, and sir told that he will try to join, and sir has spared the time. So I am really thankful that sir has accepted our request. Sir is my, you can say, super duper senior of my institution, from where I have done my PG in pharmacy. So that's why only sir has accepted our request. As a elder brother, sir has accepted my warm request, and sir has joined. Now we will proceed for the starting of the program. So I'll request for the Deep Prajwalan. Honorable advisor sir, who is torch bearer for the university, is in front of us.
Jai Mataji, Jai Nari Shakti, and Jai Hind.
Jai Mataji, sir. So thanks a lot for blessing us with your valuable presence, Honorable sir. Thank you so much for blessing us. Now, proceeding further, I will request respected Registrar ma'am to brief about the conference. I'll request Registrar Ma'am to officially, ma'am, kindly unmute.
Namaste. Honorable Advisor and CEO Sir, Vedanta Sir, Jyoti Vidyapeeth Women's University. Our Honorable Chief Guest, Dr. Dipendra Singh Sir, Chairman, Education Regulation Committee, Pharmacy Council of India. Our invited guest, Madam Bana V.V. Menon, Deputy Dean, KPJ Healthcare University College, Malaysia. Our Dr. Sneha Ambani, Professor and Head, Department of Pharmacology, All India Institute of Medical Science, Jaipur. Our eminent speaker, Dr. K.M. Narullah, Faculty of Pharmacy, College of Health Science, Ethiopia, and all the other invited guests. Our President, Dr. Pramod K. Raghav, all Dean, Dr. Dharmendra Ahuja, Dr. Ankit Bhargav, Faculty of Physiotherapy and Diagnostic, all the members of organizing committee members, faculty members, delegates, students, and all the participants. It's my great pleasure and honor to welcome you all this to this prestigious international conference, which is being organized in the joint venture of our two prominent faculties, Faculty of Physiotherapy and Diagnostics and Faculty of Pharmaceutical Science, in association with Indian Pharmaceutical Associations, New Delhi. So today we gather here to engage the meaningful discussions, exchange knowledge, and foster our future collaborations with each other. And on this great occasion, I just would like to introduce ourselves as a Center of Excellence for Women Education. Jyoti Vidyapeeth Women's University, Jaipur, has been established in 2008, and with its commitment for providing professional, technical, medical education to the women, we have completed our 15 years journey in 2023. Recently, we have completed our 15 years of academic journey. And over the past 15 years, the university has taken many initiatives in the direction of quality and innovation in the education stream by following its mission, education for community development leading to women empowerment. This conference serves as a platform for intellectual exploration and innovation, and these are our continuous efforts to bring the more innovation, more research culture within the campus. And the theme of this conference underscores the importance of collaborations and cooperation of a rapidly changing world. Moreover, this conference is a unique opportunity for networking and building fruitful relationships. The emerging trends in healthcare technologies are reshaping the healthcare landscape, empowering our patients, empowering our lives, and transforming the way healthcare is delivered. So artificial intelligence, there are so many new technologies, wearable devices are just few of the remarkable, I think, advancements which are transforming healthcare. And let us resize the opportunities presented by these emerging trends, and we hope we will work together to create a future where technology empowers us to lead healthier and happier lives. So this theme of the conference is to just deliver the knowledge and enhancing the knowledge of our students so that they can focus on these trending technologies and they can adopt these technologies in their practice. And on behalf of this organizing committee and entire JVW committee, I would like to express my sincere gratitude to all of you for joining today, and especially our chief guest for sparing some time with us. We hope that you will find these conferences very informative, engaging, and fruitful, and I think you leave here with a new insight and connection that will help you in the future careers. So once again, a warm welcome to everyone present here, and thank you so much for joining us. And I extend my best wishes to all of you. Thank you so much.
Ahuja sir, unmute करिए please. Unmute.
Thank you. Thanks a lot, respected Registrar Ma'am, for blessing us with your valuable words. Now I'll request Honorable Advisor Sir to bless us with, to shower us with his blessings. Meanwhile, I would like to add from Mauritius, Dr. Ashish Wadhwani has also just connected with us. Sir is also head in pharmacology. So, Namaskar, sir. We have just means, as you know, this is an online conference, so 4-5 minute time lag gets affected. So,
Yeah,
I'll
I
request
do
Honorable.
completely understand. Namaste,
Yeah.
namaste to everyone.
I'll request Honorable Advisor, sir, to please bless with his words. Thank you.
नमस्ते सभी अतिथिगण. Very good morning to all. I welcome our honorable chief guest, Honorable Dr. Dipendra Singh sir, Chairman Education Regulation Committee, PCI, New Delhi, all our keynote speakers, students, teachers, and of course our research scholars for this 2-day virtual international conference, which is being organized under the Faculty of Pharmaceutical Science and the Faculty of Physiotherapy and Diagnostics on the emerging trends in pharmacotherapy and health technology with the support and representation of 11 different countries. Today, on this virtual platform, we got this opportunity to discuss on the captivating topic of emerging trends in the health technology. The field of healthcare has always been driven by
I think some connectivity issue is taking place. Just wait for 2 minutes, Honorable panelist. Uh, Honorable Advisor, sir. Yes, please.
I think I got disconnected from the conference due to some
Yes, sir.
technical error. So sorry for the inconvenience caused. I will repeat myself again. Again, I would like to welcome our honorable chief guest, Honorable Dr. Dipendra Singh sir, Chairman Education Regulation Committee, PCI New Delhi, all our keynote speakers, students, teachers, scholars for this 2-day international conference being organized on the emerging trends in pharmacotherapy and health technology with the support of representation of 11 different countries. Today on this virtual platform, we have an opportunity to discuss on the captivating topic of emerging trends in health technology. The field of healthcare has always been driven by innovation, and in recent years, we have witnessed a remarkable surge in the development of groundbreaking health technologies that are transforming our lives. And these emerging technologies are empowering the healthcare providers. There are many trending technologies and devices ranging from smartwatches to fitness trackers, which have become very important part in our daily lives. They not only track our physical activities but also monitor vital signs, the sleeping patterns, and even detect the potential health issues that may arrive in the future. The COVID 19 pandemic accelerated its adoption, bringing healthcare to the doorstep of patients. So I think all the students, teachers, scholars have a great platform for sharing deep knowledge and research and the innovations in health sector. Over the next 2 days, we all have the privilege to hear from some of the eminent personalities of their respective fields. They will share their insights and experiences through keynote speeches, the panel discussions, and presentations for understanding of the issues and trends shaping healthcare fields. I extend my best wishes to all of you and a very successful conference. Thanking our chief guest for joining us and also our eminent speakers. Jai Hind, Jai Nari Shakti. Thank you so much.
Thank you, sir. Thank you, Honorable Advisor, sir, for giving your blessings. And now I'll request our chief guest, Dr. Deependra Singh, sir, Chairman, Education Regulation Committee, Pharmacy Council of India, to bless with his valuable words. Sir.
So very warm good morning to all of you. Indeed, a pleasure for me to be part of this function, and I'm very thankful to Dr. Ahuja that he has continuously insisted me to present in this function. Though I'm sharing with you, I'm in between of my convocation program. In our university. But as I have committed to him, so I said, I'll come for this
Thanks.
Your inaugural function. So I'm very thankful to the management of Jyoti Vidyapith Women's University that you have just invited me, and you have taken a step or you have taken an effort to organize such an international conference on such a relevant topic, which is discussed everywhere. Because if you'll see after COVID, the healthcare sector has one of the very potential sector in terms of business and in terms of scope and in terms of services. In every time, if you'll see, there is a lot of scope in this sector, and we are continuously discussing. One more relevant thing is that why we are talking about the current things, current trends. That if you want to become relevant, if you want to become practically active in this field, then according to the changing needs and demands, we have to change. So if you'll see, a lot of things now we are talking about chat gpt, we are talking about internet of things, you are talking about smart delivery system, we are talking about use of artificial intelligence, though we are using since so long we are using, but now they are demanded like that they should be part of your curriculum, they should be part of your studies. So just I am sharing with you ki we are working with the new syllabus, and we are trying to just incorporate all the relevant futuristic things which is going to come or which will be influencing the healthcare sector in the coming future. So we are just trying to incorporate in that. So Dharmen, I know this is long awaited conference, but due to the my conditions, I'm very much stuck in this event, and Mahamahim and Mr. are also about to come to my place. So, in very short, I am very thankful to all the delegates who have joined from the different corners of the world. And from on behalf of this university and on my own behalf, I am welcoming you all in this conference, and hope this conference will give platform to the young budding pharmacists and other professionals to discuss on such relevant topic. And I'm very sure that you will come out with very concrete some resolutions after that, or recommendations which you will forward to me, so that I'll work on it and I'll try to get incorporated in my syllabus of pharmacy. So thank you so much for inviting me in this conference. And if I'll get time again, I'll join this conference. So please be and just excuse me for
Yeah, sir. We can understand. We once again thank a lot that from so much busy schedule which was happened, but you have spared your valuable time, sir. Thank you. And means it's more than enough for us that you have given a valuable speech and you have connected for it suitable time. Thanks a lot, sir. Thank you.
Thank you, Dharmen. I'll just when I'll get time, I'll connect and I'll join this.
Sure, sir. Sure.
Thank you so
sir.
much.
Thank you, sir. Thanks a lot. Namaskar, sir. As sir has told, he was in a convocation program. So, as the honorable advisor sir is with us, and as you know, the conference is on international level, and the purpose is to highlight the emerging trends in pharmacotherapy and health technology, and different subdomains will be discussed here, mainly the core pharmacotherapy, then formulation development, then pharmacognostic parameter, ancient Indian literature correlation will also be considered. In case of pharma, today's scenario means it is a 2 days conference. So tomorrow is also tomorrow the sessions will be related to physiotherapy, whereas today it's mainly concentrated on pharmacotherapy part. So different themes will be there, and the first theme for today's session is core pharmacotherapy. And in the core pharmacotherapy sessions, we have two eminent speakers. One is Dr. Sneha Ambwani ma'am. She is a renowned pharmacologist in all over India. And to be very frank, one interesting thing I would like to share, that I am Dr. Dharmendra Ahuja, Dr. Sneha Ambwani ma'am, and Dr. Ashish Wadhwani. We all belong to a Sindhi community. So means this is also an interesting fact that means Sindhis are coming together, and means I am also a pharmacologist, ma'am is pharmacologist, and sir is also pharmacologist in Mauritius, and all are on heading positions. So just on a lighter note, I was sharing the things. So coming to the things, I'll request Sneha Ambwani ma'am to highlight about the core pharmacotherapy part, and over to you, respected Sneha Ambwani ma'am.
Good morning, all. And am I audible?
Yes, ma'am, you are audible.
Good morning, all the dignitary which are present, all the corners of the world, as Dr. Dharmendra says, and Registrar Ma'am, Dr. Akema, Chief Guest, and all that. At the outset, I first of all thanks Dr. Dharmendra Ahuja, who gave me the opportunity to present this presentation on this very precious international conference on recent trends in the pharmacotherapy. And I wish all the best. I know that is a virtual and we might get some technical issues while presenting, but I really appreciate the efforts of Dr. Dharmendra, who make us all these eminent personalities from all corners of the world get together to this virtual conference. So all the best to the Dr. Dharmendra for this coming conference. Thank you. Thank you very much.
Thank you, ma'am. Thanks a lot.
Wish you all the best.
Yeah, thank you, ma'am. Thanks a lot for your valuable presence. Now, moving forward, I'll request Dr. Bama V. Menon, ma'am. She is also torchbearer for us in many instances, because ma'am has connected with us on various brainstorming sessions, and ma'am is at present, ma'am is Deputy Dean in KPJ Healthcare University, Malaysia. And ma'am has a good insight in yoga as well. And ma'am has enlightened us with her yoga knowledge in earlier discussions. And today, as we are on core pharmacotherapy, so I'll request Bama V. Menon ma'am to present her views. Before that, I would like to thank once again Dr. Ashish Wadhwani sir, who has connected from Mauritius, from JSS Mauritius, and sir is also a torchbearer in many instances for us. And as we know, sir's session is scheduled at around 11:45 something. So sir will also be highlighting various important pharmacotherapy trends. But as per the schedule at present, I will request Dr. Bama V. Menon ma'am to please share her views. Ma'am.
Okay, a very good morning to my Indian counterparts. My warm wishes to the Honorable Chairperson and Chief Patron Mrs. Mithilesh Garg, the advisor Mr. Vedant, the Registrar Dr. Hema, the conveners Professor Dharmendra Ahuja and Professor Dr. Ankit Bhargava and all the organizing committee. Also, I did not get the chance to wish to Dr. Dipendra, our chief guest earlier. In fact, I was very intrigued by the fact that they are also, India is also looking at the change in curriculum. In a while, I'll also tell you all that Malaysia is basically also looking at a curriculum change,
Yeah,
right?
I would like to interrupt here, ma'am. In fact, this Pharmacy Council of India, as you know, is the main regulatory body, and means just now Dr. Deependra Singh sir was connected with us. He is the chairperson of the committee, which is reorganizing complete syllabus as new education policy has came in India, and this 4 year duration B Farm is going to change drastically. So means major changes are going to take place, like 1 year certificate, then 2 year diploma, everything is happening. So means in India also we are quite dynamic enough to update the things. Yeah, please, ma'am.
Yeah, exactly. That's what I could appreciate, because as we speak now, even all the universities in Malaysia has been asked to look back into the curriculum and to also review what can be put into the curriculum to suit the current changes. So that's why I was actually quite excited when Dr. Dipendra said that India is looking at this curriculum change as well. So that means we are all globally together adopting the changes and adapting well. So that's a very good news to our future pharmacy students, right? And congratulations. I would like to say congratulations to the Faculty of Pharmaceutical Sciences and Faculty of Physiotherapy Diagnostics for putting together this international conference on emerging trends in pharmacotherapy and health technology. And a warm thank you from from sincerely from me for being called to be part of this very auspicious and grand event of Jayoti Vidyapith. So, Professor Ahuja, can I proceed or should
Yeah,
I?
yeah, ma'am.
Can I
You can
proceed?
proceed with your presentation, ma'am. Yeah, yeah,
Okay.
yeah.
So I will share my slides right now. Yeah.
Yes. Yes.
Okay. Oh, okay. I have to. My slides are in Canva basically. Let me download my slides first, yeah?
Ma'am, am I audible?
Yes, sir. Yes, sir. Just give me a
Yeah,
minute. I'm
means
opening my slides right now.
yeah. I was just saying that means uh, as Honorable Sneha Ambwani ma'am, HOD Pharmacology is associated. So means we have two presentation in this session. So
Yes, yes, sir.
ma'am's presentation is there and yours is there. So we will just proceed with the presentations, and means actually this slot was for blessings. Now this next slot is for presentations. There was little confusion. So
Oh,
now,
okay.
yeah,
So should I
yeah, yeah.
present or not? I should stop
Yeah,
first.
yeah, means just ma'am's presentation is there and yours is there. These two core
Yeah.
presentations are there today.
Okay, okay. Let me
So
stop.
means
Let me
in
stop
first
my sharing.
slots. So if ma'am Sneha Amwani can present, then also it's fine. Yeah, yeah. Please, ma'am. Yeah.
Okay, sir, I'll present them.
Let me stop. Let me stop sharing this. Yeah.
Okay.
Yeah, means actually
Please
we were
proceed,
getting
ma'am.
some blessing messages from you. Then now we will proceed for second section, the presentation. Yeah.
Okay, shall I share my screen?
Yeah, you can share this.
Are you all able to see my slides? I've removed it from the stream though.
Visible.
Yeah, ma'am, your slides are visible.
Yeah.
But I
This
can't
honorable,
share.
Honorable Bama, ma'am, your slides are visible at present.
I know I'm trying to remove it from the stream, but I don't know. Maybe when Madam Sneha is sharing, it's actually showing my slides.
Yeah.
Exactly.
I'll just ask the technical team,
Yeah.
please resolve the issue.
Yeah.
I'll request technical team to resolve it.
Dr. Sneha, you try sharing again, please.
I can't because it's not accepting. No, I think it's there now. My slides are there if I'm not wrong.
Yes, ma'am. I think now we can see your slides.
Let me stop this. Stop. Let me- Hello, is it visible now? Dr. Ahuja?
Dr. Sneha, I'm able to see your slides.
You are not able to see my slides?
I'm able to see, can see,
Yeah,
can see.
we are able to see. We can see.
Can you hear me now?
Yeah, we can hear you, ma'am.
But it is not converted into slideshow. I think now it is converted, right? It's not moving, then slides are not moving from my side.
Technical team, can you help ma'am in moving the slides?
Smart slideshow starts.
Uh, I'm just calling to technical team. Just wait. Yeah,
Okay.
just resolve. हाँ सर, वो मैम की स्लाइड आगे नहीं बढ़ रही. Ma'am, they are saying that you can put the
Right
arrow
now,
next
I can
bottom
this
bottom arrow button.
this is moving now.
No, it's not moving here. The first slide is coming here. Antimicrobial resistance program strategies, like that.
Right, but I can't see then what to do.
Yeah, now it's moving, ma'am. Yeah.
Now it's
Now,
moving.
yeah, it has came to the last slide. Now it's moving, properly moving.
Okay,
Yes,
right. Can I start now?
yes, ma'am, please.
So, good morning
We are
all.
eager, our students are eagerly waiting for the sessions mainly, ma'am.
Okay. I'm sorry for this interruption because of some technical issues. I was not able to connect well. So, good morning again to all the dignitaries and all the participants, delegates, participants who are connected to us around the world virtually and physically also. So, as the this theme of this conference is recent trends in pharmacotherapy, and as you know, this antibiotic resistance or antimicrobial resistance is a very important issue, especially when COVID occurs. We see that there are so many antibiotics are used, that repurposed, and they were used OTC also, and with prescription, without prescriptions, and that merely increases the resistance. So currently this antimicrobial resistance is a very important aspect. So I'm going to discuss some factors, mechanisms, some factors, and how we can prevent this antimicrobial resistance to make all these antimicrobial agents which are present can be used properly in all types of infections. So my title of my presentation is Antimicrobial Stewardship Program, that is strategy to prevent emergence of antimicrobial resistance. So this is the disclaimer. All these views which we are going to present are mine, nothing related with my organization. So at the end of the session, we'll able to know what are the what is antimicrobial resistance, what are the different mechanism of antimicrobial resistance, what are different factors which contribute to AMR, antimicrobial stewardship, prevention, how we can prevent this resistance. So as well said by Herophilus in long ago before Christ, medicines are nothing in themselves but are the every hands of God if employed with reason and prudence. So all these medicines, not only antibiotics, all these medicines, they are very helpful, very good to treat the disease, but if we'll use it prejudiciously. So when we say antimicrobial resistance is defined as the resistance by the microorganisms to an antimicrobial agents to which initially they are sensitive. Now we are well known that there are certain antimicrobial agents or antimicrobes which are resistant naturally. We'll discuss it later on. So when a particular drug which is sensitive against this antimicrobia earlier, but as time passes, it becomes resistant to that antimicrobial agents. We will say that there's antimicrobial resistance. So the resistance adapted by microorganisms to an antimicrobial agent, which are initially sensitive, is labeled as antimicrobial resistance. Now, various misuse and, as I mentioned, misuse and overuse of antimicrobial agents is the main reason for this antimicrobial agents, so that there is a development of drug-resistant pathogens. And this is a global problem. So WHO has declared that AMR is one of the top 10 global public health threats facing humanity. Now, why we say this antimicrobial resistance is a global concern? We can see that this antimicrobial resistance causes 1.27 million deaths per year as compared to all other diseases, includes tetanus, road traffic accidents, measles, diarrhea, diabetes, cholera, cancers. And it is predicted that at the end of the 2050, more than 100 million death will be expected if this resistance continue. So why this global concern? Because as I mentioned, it's killing at least 1.27 million people over worldwide, and new resistance mechanisms are emerging and spreading. So with globally resulting prolonged illness, disability, and death. Now, as you can say, these antimicrobial agents, they are not only used for infections, but they are also used in certain procedures like renal transplantation, cancer chemotherapy, diabetic management. And if that particular antimicrobial agent develops resistance against certain antimicrobes, which are or more important to prevent infection in these patients, that treatment of these patients or of major surgeries, that become very high risk, because we will not have any antimicrobial agents which will be effective in all these patients. So simultaneously, apart from this resistance and this high risk, antimicrobial resistance also increases the cost of the healthcare. So earlier, the simple or must say cheaper antimicrobial agents, they were effective, but as resistance increases against various microorganisms, now higher antibiotics are used, and that further increases not only the hospital stay of the patient, and also increases the cost of the treatment. So ultimately it affects the financial, it increases the financial burden. So this is a graph showing the important microorganisms which increases or resistance to which increases the mortality. And amongst this, the most important one is E. coli. Then comes Staphylococcus aureus, Klebsiella, Streptococcus pneumoniae, Acinetobacter baumannii, and Pseudomonas. Now, all these were earlier, they were sensitive to available antimicrobial agents. Now you can see that this E. coli and Acinetobacter baumannii, they are now become the resistant strains, and even the higher antibiotic, vancomycin, carbapenem, they are not effective in all these infections. So ultimately, they will increase the death or mortality when patient is suffering with these infections. Before so what to do to prevent this antimicrobial resistance? Now, as we can see that there is a certain therapy or antimicrobial therapy as well as disease progression timeline. There are certain stages related to infection. As you can see on this slide, there will be no infection, infections, there will be symptoms, there are certain pathogens are isolated, and then resolutions. These are the stages of the disease progression. And this upper line, green line, shows the categories of antimicrobial therapy. Now, if there is no infections, there are certain conditions where we use antimicrobial agent for prophylaxis purposes. For example, a child of a newborn child or children which are from the mother which are having tuberculosis or HIV, then we use the prophylactic treatment, though there is no apparent infection in these children. Second is preemptive. When the infection is about to occur, as we see that during COVID period, before the actual symptoms, actual seriousness start, we started the preemptive therapy, right, in these patients. Then comes when symptoms appear related with, and if we don't have any idea which type of infection or which pathogen is causing this disease, in cases of emergency, we start the empiric therapy, which cover all the organisms which are possible pathogens for that particular disease. Especially in severe emergency surgeries, accidents, we use empirical antimicrobial agents. Now, this definitive therapy is very helpful and effective when pathogens are identified by this culture sensitivity. So we identify the organisms and we identify the drug which is effective in that particular infection. And then once that infection is over, then resolution occur and suppressive therapy can be given. So that is the timeline of use of various antimicrobial agents in all types of diseases. Now, as I say that antimicrobial resistance, there are two types. One is innate or natural, another is acquired. When we say natural antimicrobial resistance, that means there are certain microorganisms which are resistant to certain this antimicrobial agents. For example, gram-negative organisms, they are resistant to penicillins, right? So that is they are in all types of gram-negative organism, penicillins cannot be used. So that is the innate or natural resistance. When we say acquired or certain anaerobes, they are also not effective, or anaerobes are not responding to all those antimicrobial agents like penicillins, and they are not effective. So that is natural resistance to all these organisms. Acquired resistance, we can say that can be achieved when earlier the antimicrobial agent is effective for a particular microorganism and then becomes resistance. And that can be mediated through two major mechanisms, that is genetic or biochemical. When we say genetic, it is more or less through chromosomes. And we must have read in pharmacology that there are different mechanisms by which these organisms shared or causes resistance through by sharing the genetic mutation. So here we can see that just by chromosomal mutation, resistance develop. By through plasmid containing resistant gene that is transferred, then comes the plasmid which is through conjugation they share the resistance. Then through this bacteriophage, the resistance is developed, and lastly that is transduction. So three major mechanisms are there to transfer the this resistance by conjugation, transduction, and this transformation, right? So transfer and replication of transposome carrying R genes, that is responsible for resistance through genetic mechanism. Another important is this biochemical mechanism. Now this biomechanical mechanism is well known to so many drugs. The most common and most important is when a drug is given, that is enzymatic inactivation is there, and that is responsible for development of resistance. Another important is preventing influx. We know that if you remember that penicillin has to enter through the porins, right? So if there is no influx through these channels, penicillin will be inactive. So if there is changes in the influx of the drug or excessive exflux of the drug, that means drug is getting out of the cell, more drug is getting out of the cell, so that will not is effective in these against microorganisms. So that is also responsible for the development of resistance. Excessive influx, this prevention of influx and excessive efflux, that leads to bacterial resistance. Now this is the example when the modification of the target site, you can see there is structural changes in the target, that also that the drug is not able to bind with that target. That again this I will give the example, protein binding sites are there. If they are modified, then penicillin will not bind that protein binding sites, and that penicillin will be ineffective. So that is alteration in the binding site. And then as you know that the sulfur drugs, when you use sulfur drugs, their main mechanism is they inhibit the synthesis of folic acid, right, through by this dihydrofolate and tetrahydrofolate. Folic acid is not synthesized, but when these bacteria or microorganisms find the alternative pathway to synthesize this folic acid, and then this presence of pus that is affect the synthesis of folic acid, that bacteria will be resistant to sulfur drugs. So by using the alternative pathway of metabolic requirement, development of resistance occurs. So these are the some examples of biochemical mechanisms for development of resistance. Am I audible? Hello?
Yes, doctor, you are.
Uh-huh. Right. So these are the mechanism how this resistance against antimicrobial drug is developed. Now we'll discuss the various factors which contribute to AMR. Now, there are various factors related with environment, drug related, patient related, physician related, and evolutionary related factors are there. We'll discuss one by one all these factors. When we say environmental factor, the major issue is the burst in the population. So, huge population and overcrowding, that is the important factor in development of environmental factor for drug resistance. Apart from that, we can see here moving around from one place to other place. So rapid spread is there through traveling, national and international, and that shares or transfer the resistant strains from one place to other place. Another important is the poor sanitization, and that is that is one of the major important environmental factor, and widespread use of various antibiotics in animals, not in animals, when to improve their husbandry and agriculture. That also is the major environmental factor for the development of resistance. Another is drug related factor. That means we are well aware there are so many spurious and fake drugs are available, and when they are taken, they not only are ineffective, but they are the one of the factor which develop the resistance against various microorganisms. So quality of drugs, overuse of antibiotics, availability of over-the-counter drugs, irrational fixed dose combinations, counterfeit and substantial drug causing suboptimal blood concentration. That is drug-related factor which are important in developing AMR or antimicrobial resistance. Patient related factors, poor adherence, when especially in the diseases which require very long therapy, especially for tuberculosis and HIV infections, have to be given for a prolonged period. And once the patient becomes symptom free, patient himself or herself stop taking all these drugs, and that is the major reason for development of resistance for in the all the drugs which are used in tuberculosis. And it's a fact that earlier we were at the verge of eliminating tuberculosis in 2015-20, but because again this emergency of these development of resistance against rifampicin and INH, now we have should go back again in the era where this tuberculosis become again this dreadful disease which cannot be cured. So now we have to increase the duration, as well as we have to add on certain drugs which are effective. So for probably we will help to eliminate the TB by 2025. But due to emergency of this resistance, let's cross the finger, that will able to eliminate tuberculosis in 2025. So that is the poor adherence of doses regime is one of the reason for resistance. Poverty, lack of sanitation concept, lack of education, self-medication, and misconception. That is a patient-related factor which are related with AMR. Another important factor is physician or health worker related. Inappropriate use of drugs, injudicious use of the drugs, over prescribing, inadequate dosing, lack of current knowledge and training, that all this we can see that quacks are available in the peripheral area, rural area, which they are using antimicrobial agents like I must say this paracetamol and crocin like that. So just in every symptoms they give the higher antibiotics. So those higher antibiotics which are supposed to be used in the hospital acquired infection or serious infection, they are using just for small tribal infections which might be controlled even without any therapy. So that is lack of current knowledge and training that leads to antimicrobial resistance. So this slide shows that this is the vicious cycle that leads to overuse of medicine. Is a patient and doctor. I take so many medicine because my doctor prescribe, and doctor says I prescribe the drugs because of patient expect them. So that is there. So now we can see that this various factors which are responsible for this antibiotic resistance. Just to summarize: overprescribing, patient not finishing their treatment, overuse of antibiotics in livestock and animals, poor infection control, lack of hygiene or sanitation, and lack of new antibiotics developed, that are all are responsible for antibiotic resistance. So, how to prevent this antibiotic resistance? Now, there is a global action plan, as I mentioned, that this microbial resistance is a global program. So, that global action plan was laid down in 2015 with the objective to improve the awareness and understanding of antimicrobial resistance, to strengthen the knowledge, to reduce the incidence of infection, to optimize the use of antimicrobial medicines, to develop the economic case for sustainable investment, and to increase the investment in new medicine. So, so that is what this measures taken by India also. They start with lay down that this in 2010 they formed the National Task Force, National Policy for AMR, the National Program on AMR, and in April 2017 they prepared the National Action Plan on AMR. Now this national program is address the prevention of the infection, development of new antimicrobial agents, use of advanced therapy, and optimization use of these pre-existing drugs. So this is they are the six agenda national action plan, which is focus on these six agendas. First is awareness, understanding, knowledge and evidence, infection prevention and control, and optimal use, and innovation, research and development, and leadership. Now, when we say awareness of understanding, this is, as I mentioned, proper knowledge and training is required through various workshops, trainings, conferences to use regarding the use of these antimicrobial agents. Proper utilization of lab services to get the evidence-based the efficacy of these antimicrobial against these various drugs, culture and sensitivity. Infection control by using this to improve the environmental factors which I discussed. We can improve that is the preventive measure to improve the resistance or to control the infection. Optimal use can be as one of the major aspect regarding this optimal use is antimicrobial stewardship, which I'm going to discuss later. So that is the major aspect. As far as innovation and research is concerned, various research, medicine, diagnosis, vaccines, all tools, they can be innovated, and this diagnostic various aspect can be innovated so that prophylactically they can be used to prevent the occurrence of the infection rather than treating the infections. And as far as for that purpose, we require all the collaboration through state, national, and international level. So these are the 6-point agenda of the National Action Plan, that by that we can improve or we can prevent antimicrobial agents. So that are the various component. There are various factors by which we can prevent and control antimicrobial resistance. That can be done at the individual level, healthcare professional, various policymakers, agriculture sectors, and healthcare industries. At the individual level, stop using or overusing of these antibiotics. Leftover antibiotics should not be used and shared as the regular practice, especially at the peripheral areas. And another is at the level of health professional, they should not use these antimicrobial agents injudiciously, and they should talk to the patient. Many times the patient asks for rapid recovery, but he should spare some time to discuss with the patient that sometimes no drug is or no antibiotics is required for certain infections. So talking to patients how to antibiotic correctly taken, or how this dangerous when it is misused. On the level of policymaker, it's a joint effort. So all these the strengthening policies program and infection prevention control measures through various regulatory authorities, they should be prepared for. And not only this agenda should be prepared, they should be monitored properly, so that regulation and promoting appropriate use of medicine can be done. At the level of agriculture and healthcare industries, as I mentioned, that we should invest, healthcare industry should invest the procure some budget or finance for development of new antibiotics, vaccines, and diagnostic tools. And as far as agriculture aspect is concerned, we should stop using these antimicrobial agents judicially in veterinary practice, and if at all that is required, should be under veterinary supervisions. Vaccination to animals to reduce the need for antibiotics, and promoting and applying good practices to all steps, especially from food from animals and plant sources. So special good sanitary or good hygiene is required to prevent the occurrence of infections. There are three terms when we are talking about this use and misuse of the drugs. There are three terms: drug use, drug misuse, and drug abuse. So when we are talking about the prevention part, or that we should use the drug for certain treatment or prophylaxis with the advice of medical practitioners. So that is the rational use. Drug misuse is associated with prescription medicines, but these substances are taken for a purpose that is not consistent with medical guidelines. So, for example, incorrect dose, taking drug at wrong time, stopping use of drug too early, taking drug for no reasons. So that is the drug misuse. That is should be prevented, or that is the important aspect to prevent the antimicrobial resistance. Another term which is commonly used is drug abuse, and that happens with the other drugs, that is alcohol, illicit drugs, or psychoactive drugs. That is, so there are three terms which are used for this. As I mentioned, for prevention of this antimicrobial resistance, antimicrobial stewardship is an answer, and this antimicrobial stewardship is to prevent or delay the emergency of antimicrobial resistance. The objective is to optimizing the selection of right antimicrobial drug for therapy and prophylaxis, optimal dosing, optimal duration of antimicrobial therapy, both as empirical as well as targeted. So that is objectives of antimicrobial stewardship, and the purpose of this antimicrobial stewardship is to promote safe and appropriate use of antibiotics, reduce unintended consequences of antimicrobial use, that is the various side effects and toxicity due to development of resistance. Now you can see that this microbial stewardship is not a one person. It's a teamwork, and the various members of this team is some infectious disease clinicians, infectious disease pharmacist, clinical microbiologist, infective prevention control committee, and information system specialist. Now when we say this infectious disease clinician, they promote the responsible rational use of antimicrobials, and when we say clinical microbiologist, they optimize the selection of right antimicrobial drug for therapy and prophylaxis by doing the culture sensitivity test. By regular testing, they can say that which antimicrobial is properly used, so that they can make a policy that should be done at the all levels of especially in various hospitals, so that there should be an antibiotic policy that should be there for to start with. So in collaboration with the clinician, infectious clinicians and microbiologists, hospital antibiotic policy should be prepared to prevent the resistance. And third one is at the level of community, and that is to prevent and control committees there, so that reduce the incidence of infection through effective sanitation, hygiene, and infection. So that is the preventive measure, and in these community people or community health professional, they play a very important role by giving our sensitization program regarding this sanitation, hygiene, and prevention measures. They can be at community level, at social level, so that the prevention, the occurrence of infection, and so that all leads to team work will lead to prevention of antimicrobial resistance, and that collectively known as antimicrobial stewardship. So at the end, when we say this proper use of antimicrobial agents, it's not only antimicrobial agents, it is true for all the drugs to be used in medicine. So that is known as rational use of drugs. So that, as I mentioned, in antibiotic stewardship, rational use of the drugs or antimicrobial should be there. That means 5R is there: prescribing right drug in right dose, right duration, and right clinical needs at the lowest cost. So right drug, adequate doses, sufficient duration, appropriate to the clinical needs of the patient. That is rational prescribing. That is the rational prescribing. Criteria is there are 6 A's for the rational use of these drugs. Appropriate evaluation. First, we have to evaluate by proper diagnostics, lab diagnostics, that which antibiotic is preferably to be used and effective in particular infection. Appropriate indications of use of antimicrobial agent in viral infections. As the motion says, this viral infection will be cured when antibiotic is used in a week, and in a 7 days when antibiotics are not used. So that is many viral infections, they doesn't require any antimicrobial agents. So avoid using these antimicrobial agents in these infections. Various non-specific diarrhea, especially in children, they are self-limiting, so no need of antibiotics. Third is appropriate drug, doses, forms, route of administration, duration, that is related with drug. Appropriate drug, if it is to be prescribed at once in a day, should be taken once in a day, and should be taken for appropriate route. There are certain drugs which are not effective when taken orally, so have to be given parenterally. So that is that knowledge a health professional should have to prescribe these drugs. Appropriate patient and dose assessment is also needed in various patients with the hepatorenal function. So we have to be careful. Appropriate cost. There are so many cheaper drugs if available, then better you don't go for higher antibiotics which are expensive. This infection can be controlled by the low cost drugs. Adherence to the treatment by patient, that is again a very important aspect. So as I mentioned in my earlier slide, health professionals should spare some time to discuss the patient, how to take the drug, when to take the drug, and for how many days it should be continued. So adherence to the treatment is again an important aspect for rational use of drugs. So this is the slide showing whenever we are using some antimicrobial agents, as I mentioned earlier, there are certain microorganisms which are resistant, so we have to take the alternative one. So this microorganisms, methicillin resistant Streptococcus aureus, they are resistant to beta-lactam antibiotics. So if microbiologists say these are MRSA infection, don't use beta-lactam, then go for all these vancomycin and linezolide antibiotics. This vancomycin resistance enterococcus are also there, so vancomycin will not be effective. So these are the options we can use. In XDR-TB, extended drug-resistant tuberculosis, so see that there are so many antibiotics which are isoniazid and rifampicin, which are the, as I mentioned, that's they are now resistant becomes to these drugs. So new antibiotics, they are available, should be taken, bedaquiline and certain fluoroquinolones to be added to the treatment. This carbapenem resistance enterococci, they are also there. Pseudomonas, which are this resistant to aminoglycosides. Now these aminoglycosides earlier, they were the drug of choice in the cases of Pseudomonas infection. Now this Pseudomonas developed resistance to all these drugs which were very effective, aminoglycosides and cephalosporins. They were very sensitive to these antibiotics. Now that resistance becomes to all these drugs. So this polymyxin and carbapenems, they are now drug of choice for Pseudomonas aeruginosa. This extended spectrum beta-lactamase that is there, that's they are resistant to penicillin and all the second and third line generation cephalosporin. Earlier they were sensitive, but now they become the resistance, and carbapenem is drug of choice in these. So now, as you can see from this slide, there are so many antibiotics which were effective against these infections now becomes ineffective. So we have very less choice to use the antibiotics in such type of infections. So to conclude, this antimicrobial resistance is a global health security threat and requires concentrate this cross-sectional action by government as well as society. Surveillance generation, this reliable, we have to generate the reliable data for the to kind of, and prepare the strategy to prevent this antimicrobial resistance. We use rational use of existing antimicrobial agent and it should be there, and joint efforts from patients, prescriber, and individuals to international regulators to fight against this globally spreading antimicrobial resistance. So my take-home message is ensuring hand, instrument, and environmental hygiene should be there. Keep patient vaccinated. If a patient need antibiotic, just to confirm which antibiotic will be suitable. Only prescribe or dispense antibiotics when they are truly needed, and prescribe the right antibiotic, right dose for right duration. So it's a government health program. One health approach is there, and that is the collaborative work by communication, collaboration, coordination, and capacity building. We can achieve this one health program that make this our healthy environment, healthy ecosystem, healthy animals, and healthy humans. So let us work together to this prevent or to overcome this global disease or global problem. Thank you very much. Hello.
Yeah, thank you. Thanks a lot, ma'am, for your valuable presentation. And we are really privileged to have a eminent speaker like you. And thanks a lot for enlightening our students. Basically, all female pharmacists were listening your presentation, all budding female pharmacists. I hope you will also become one day a female pharmacology head of any any good organization like you, ma'am, and like Bama, ma'am. They will also grow to international level and they will become some internationally renowned person. So thank you, thanks a lot. Now I'll request respected Bama V Menon, ma'am, to share her views and then present. There was some communication gap, so sorry for that. Yeah, tell me, ma'am, Sneha, ma'am.
If you permit me, can I leave because I have some work to.
Yeah, ma'am. Thank you.
So
Thanks a lot for connecting with me.
thank you very much. Thanks to all.
Yeah,
Thank you,
thank
Dr.
you.
Ramesh. Okay, thank you.
Thank you. So, respected Bama V Menon, ma'am, now I'll request you to please uh, share your valuable PPT. Please, thank you.
Okay, I'm already trying to share it. Yes, okay. Can I continue?
Yes, ma'am, please.
All right, so very warm wishes from me all the way from Malaysia. My name is Bama Menon. I'm the Deputy Dean for the School of Pharmacy in KPJ Healthcare University. Very soon to be, upgraded to university status. Well, today I would love to address all the budding pharmacists from ICETPHT-2023 Women's University with my title, The Future Skill Sets of Pharmacists. Okay. Now, the thing is, you may have heard a lot about what you should be today from the past. Basically, our curriculum is not new. It's quite an old curriculum. So as we speak now, even in Malaysia, just yesterday, we were actually requested to give ideas about how the curriculum should be designed moving forward. So we are in the midst of trying to see what are the skills that our future pharmacists would need to have. All right. And that has got a lot to do with the advent of new technology, changes in terms of pharmacology, in terms of medications, and also change in terms of disease spectrums and pandemics, right? So we just learned our lesson from the previous pandemic, and we advanced so fast that some of us actually had to change overnight and grasp a lot of new knowledge. All right. So, dear students, a little bit about me before we proceed. Okay, I'm a pharmacist, a registered pharmacist in Malaysia. My areas of interest is clinical pharmacy, pharmacy practice. I also specialize in weight loss, intermittent fasting, healthy living, customized weight loss programs. I am a yoga master as well as a health coach in the making. I'm about to complete my health coach program. So that was about me. And now let's look back in time. Before we move forward, let's look at the past. All right. Now, about 30 to 50 years ago, how was the pharmacy realm or the field? How was life like as a pharmacist? Now, in this one picture, you can see that things were very personal back then, right? You actually walk into a physical premise, you meet a real pharmacist, you speak to the person, you make a rapport. Now, talking from the point of view of a pharmacist, I've done this too. I've actually spoken to patients, I've actually counseled clients. So, when we make that kind of rapport, communication skills and trust building happens, and it doesn't happen overnight. It takes time. And some patients, they come back. When they like you and they like the way you care for them, they come back. So this was one particular particular point back in those days, in the past. Education or even information searching was not as easy as today. You practically had to walk into a physical library, right? You have to actually open a hard copy book. All right. So imagine if a clinician calls up the pharmacy department and asks you an important clinical question and you have no answer to it, and you want to search for the answer. You basically have to do some research physically, right? You'll have to go and open up a lot of journal articles that are physical in nature. So this took time. It was time consuming, yes, but that was in the past. Medications were limited too. That was because of very tight regulatory controls, as well as some patents were lifelong patents. So generic companies were really suffering. They could not come up with newer versions of the patented drugs. And accessibility was an issue because everything was sent physically. So you had to wait. If you wanted a drug and that drug was available in Africa, for example, to get it into the country is going to take time. So everything was slower, more difficult, right? What about research? Back then, PhD holders and researchers were also limited. Not many pharmacists actually wanted to further their study, right? They wanted, not many actually wanted to go into research even. So what we had was limited researchers, and limited technology made researchers take a lot of time, right? That's why one particular drug, to make it into the market, to make it to the patient, may take decades, yeah? And what about us, the pharmacists who do counseling and consultation? Number one, there were not many innovative devices to start with. Second, we did not have much materials to share with the patient. Materials were all paper, hard copies, leaflets, very limited resources to actually give to the patient. And the clarity in the delivery of your counseling depended so much on your communication skills. Yeah, so dear students, back then, a pharmacist needed to do a lot more hard work. needed to be a lot more vocal, a lot more communication skills were required to actually deliver good patient care. And not to mention, the places or the healthcare providers were also limited. There were not that many medical centers or hospitals that provided care for patients. Limited staffs, limited nursing staffs, pharmacists. In fact, I still remember I was not so sure what a pharmacist would be doing when I got, when I got into university. I was not so sure. I was wondering, what am I going to be when I graduate? Okay, today you are so much more well informed. Back then, there were not many in this profession. All right. So lack of institutions, organizations, as well as lack of manpower. This was observed in the past. All right. Now, all this also had one particular feature, which is the therapy given was all medication centric or healthcare provider centric. Basically, we were more worried about what is the drug, which institution, and what we were doing rather than who's the patient. Okay, so basically, all patients were expected to react similarly to drugs, to all types of drugs. That was the past. Now, what about the future? Your future. Basically, when you walk out of your institution with your scrolls as registered pharmacists, as graduates, what are you to expect? Today, as we speak, medicine is becoming very personalized. When I say personalized, meaning today you can identify a patient and you can also identify a suitable drug for that particular patient. Isn't that amazing? Isn't that something so wonderful? All right, it's already being done now. But what I'm talking about is it's going to be extensive in future. Meaning, when you personalize a therapy for a patient, basically you are getting their genetic test done and then choosing the therapy that suits the patient to minimize adverse drug reactions as well as to maximize therapeutic effect. So basically, we are improving patients' quality of life. We're trying to cure the condition. We're trying to actually provide immense efficacy to the patient. All right. So when we do this, today, as we speak now, to do a pharmacogenomic test, right? Pharmacogenomics means to get a genetic test done on patients and then match the drug to that particular genetic makeup. So pharmacogenomic testing today can cost anything easily between 5 to 6,000 ringgit Malaysian currency. But this might change in future. In future, it could be as cheap as anything. That's how everything evolved, isn't it? First, you start with very expensive and then it becomes accessible to everybody. So imagine when you graduate and go out and serve the community and people come in with this kind of personalized medicine request or consultation. So are you prepared? So this is one thing we are looking and moving towards. All right. Digital healthcare. As we speak, we are digital, right? In fact, what we're doing now is also digital. Thank you to the COVID-19 pandemic. It just rushed all of us. Okay. Many of us were reluctant to become modernized and digitalized, but the pandemic just pushed us across, you know. So when you graduate, what you will be having is a lot of appliances being connected digitally. You can have a patient wearing a smartwatch, monitoring their glucose, their blood pressure, their heartbeats all the time, around the clock. And where does this data go? It goes into an app in your maybe in your mobile phone. That app can be shared with your healthcare provider somewhere else who can actually at a fingertip open your case and just look at your data. So we are feeding immense digital healthcare data into an unknown platform, a cloud perhaps, right? So, and everybody is connected here through the Internet of Things, right? So it's that beautiful. So if you're going to walk into healthcare world that looks like this, are you prepared, my dear students? Are you prepared? All right. When I talk about digital knowledge, it's not just about operating a phone. or an app. It has to go beyond. You have to start thinking whether are you able to develop a simple app, maybe make a simple program. So these are things that you have to start contemplating. These are knowledge that you need to start exposing yourself to, right? This is what I meant earlier when I talked about connectivity. So nowadays, patients may not even need to get out of the house. They can feed their data through their monitoring devices from the house, share it with their healthcare providers, and also sought advice and consultation through virtual realms as well. So we can have remote patient monitoring going on. We can have virtual visits, telepharmacy. You can have the drugs transported to them. You practically do not need to leave your house, right? So that is an idea. In fact, it's happening in a lot of places, but we are talking about an extensive event, all right? Telemedicine. We have this today, though. We have this today, but in future, it may be the only thing available. We may not need to even see a pharmacist. But the beauty about telemedicine is it crosses all borders and boundaries. Don't you agree? You can actually sought advice from someone right across the globe. You don't need to travel there. All right. So what's important is you can still see the person. You can have the interface without transmitting any pandemic or any infection whatsoever. Not putting yourself at any risk at all, but still being able to provide good healthcare for patients. All right. So this is also something very interesting and very, very revolutionary. In this telemedicine portal, you can see that patients are all connected to the internet. Healthcare providers and professionals are all connected to the internet as well. And through various devices, a lot of softwares and apps are available for both these parties to actually connect through a portal just like this, right? So it makes life very easy. It makes your life very easy as compared to 50 years ago. What about automation, robotic process automation, and artificial intelligence? I mean, Professor Ahuja did mention about ChatGPT, and it is in the lips of every student today because I know many students use ChatGPT to actually make their life easier. Actually, artificial intelligence has got our backs covered. A lot of data out there that we want to tap into, we can actually use AI to do it. All right. And not to mention, in terms of microsurgeries, in terms of diagnostics, doing lab studies, even decipheration of lab data can be done through automation. So this interface between today and the future is actually very, very important. Very, very important. And this is where you are going towards, right? You are going towards this. In manufacturing, earlier when I talked about personalized medicine, we're talking about precise medication, right? Precision. Now, precision comes with high technology and efficacy, right? Efficiency even. So for this, we need automated means of manufacturing in the pharmaceuticals, right? If you're going to manufacture vaccines, you're going to manufacture monoclonal antibodies, you're going to manufacture many biomolecular structures, you need automation. Manpower is going to be very limiting. All right. So you are actually moving into a futuristic world where you're going to be producing a lot of medications, vaccines, products through automation. Biopharmaceuticals and biotechnology. This is what I said earlier when I mentioned about monoclonal antibodies, vaccines. These are all the mid, or would I say the central part of precision medicine, correct? So when we talk about this, knowledge about biopharmaceuticals and biotechnology are just growing. It's just booming, all right? And global networking. Well, students, please bear in mind, today the world is smaller than before. We can actually connect. Even now, you're listening to a person all the way from Malaysia through global networking, through Jyoti's what it would call as effort to bridge 11 different countries in one conference, right? So these are all global networking. So you'll be possibly learning from different counterparts, right? So this is available today and will be available more extensively in future. So this is the future you are looking at. So you have to be prepared to communicate with various people out there. All right, you have to be prepared to be able to bring across your ideas effectively. All right, so now students, you may be wondering, oh my god, how do I fit in? Okay, there's a big gap between the past and the future, right? And you are going into the future, so how do you fit in? What skill sets do you need as students? All right, specialization. This is something the US has been doing for quite some time, but a lot of other countries have not embarked yet. That includes Malaysia. So I think in future, we should be targeting towards becoming cardiology pharmacists, oncology pharmacists, immunology pharmacists maybe. So we have to look at specialization as our next step, not just graduating as a pharmacist, but becoming specialized in a particular field. All right. So this is one newer trend that we should actually look into. Digitalization and cybersecurity. Well, I keep saying you need to have digital knowledge. Yes, most of us have it today, but it should not be limited to operating a smartwatch, operating a mobile phone, or an app. It should extend further into programming of an app. How do you create a healthcare friendly app, a diabetic friendly app? You are the expert in the subject matter. So if you had that digital knowledge, can you imagine what you could do for the patients out there, right? And knowing all this digitalization happening extensively, you need to also have some cybersecurity knowledge. You need to protect your data, right? Because cyber crimes are actually on the rise as well. So if you do not know what's happening and you keep uploading data, and then one fine day you might find that people are hacking into your database, right? Data analyst. So analytical skills, how to analyze data. You don't have to do this manually anymore. Artificial intelligence does it for you. They have something called a sentiment analyzer even these days, where based on the recordings that the app listens to or the AI listens to, it can actually predict how the patient's going to react to a certain remark or a certain request. So that is how extensive AI is today, and it will be even more um, advanced in future, right? So for you have to just gather the skills of how to use AI, how to use machine learning to your advantage, to the patient's advantage. All right. Research skills. I can't deny that today we have a lot of very skillful researchers, but are these researchers ready for tomorrow? So, in order for you to perform better in the upcoming future, you have to be able to connect globally. When you want to connect globally, you must have collaborative ideas. You must be able to bring up collaborative ideas. It's not just streamlined to your institution anymore. So, in order to think out of the box, think widely, think globally, it is important for us to actually improve our research skills. It is important for us to start using the technologies available, using AI in the research that we are developing and doing currently, right? Pharmacogenomics. This is something that I think must be added into your curriculum, right? Now, pharmacogenomics is very unique. And it's not new. Trust me, it's not new. Even in the 500 plus before Christ, BC, when people developed hemolysis anemia due to fava beans, that was the first time pharmacogenomics actually came to light. Did you know that? That was because patients suffered from a G6PD deficiency. And this can be found out through pharmacogenomics. Not only that, you can also look at the metabolism enzymes available in certain patients, while some other patients may not have it. So when you have this pharmacogenomics test results, you can actually tailor the therapy towards the patient, right? For the benefit of the patient. Now, you as the pharmacist must know the basis of pharmacogenomics. You must have the skill to read the test report and be able to give counseling. It's no longer drug knowledge. Now it's pharmacogenomic test knowledge, and then tailor it to the right drug. All right. So this is a skill you have to be ready to pick up. Not to mention robotic pharmacy. Well, some countries already have started this. They have got robotic dispensing, robotic labeling, right? So this is actually not to do away with your career. It's basically to give you more time with the patient. Imagine if your robots are basically dispensing or packing and whatnot, you have more time to counsel a patient. You have more time to take into account what your patient really wants to talk about, right? So, robotic pharmacy is another area that is going to be extensive in future, all right? And lastly, but not least, wellness and preventive medicine. Do you realize that today many people actually want to prevent diseases? They don't want to fall sick. Why? Because falling sick is expensive, isn't it? Socio-economic burden to the country, especially countries where the governments actually bear the healthcare cost. So all of us definitely do not want to fall sick. All of us want to live a healthy life, correct? So awareness about wellness, healthy living, how to prevent illness, how nutrition plays a role in healthy living, a pharmacist should know all this, because then you can advise on supplements, what herbal preparations that be suitable for the patient, what kind of diet should they go on an intermittent fasting, what type of exercises can be tailored to their comorbidities maybe. So this knowledge must be also picked up by you in future. So dear students, now that you know that there are so many new skill sets for you to pick up, how do we do this, right? Now, in order to do this, there's a few steps that we have to take. I would talk about the institution, basically, the curriculum. So what Jayoti Vidyapith, KPJ Healthcare University, and many other pharmacy curriculum providers should do is to actually scrutinize the curriculum, get feedback from our industrial partners, and tweak the curriculum in a suitable way so that it can provide those skill sets to our future graduates. Now, that is not going to happen overnight, dear students. It will take years, maybe 1, 2, 3, maybe a maximum of 5 years. But what about you? What can you do as students? Now, number one, there are a lot of continuous professional development courses available on these skill sets that I mentioned earlier. You can actually sit for these courses. You can even sign up for webinars. There are a lot of webinars organized by different institutions to cater for these skill sets. So go for it. That's what I would say. Yeah, go for it. Learn. And also, whenever there's a collaboration like what your institution is doing currently, engaging with a lot of other researchers from other institutions, get involved. Get involved and learn, right? Pick up whatever you can so that your future as a pharmacist will be more secured. You will be more meaningful in future, right? Okay, dear students and ladies and gentlemen, I think I'm done with my talk for today. I hope I have given you some insight of what are the relevant skill sets moving forward. All the best in living in the future, basically. And thank you very much from Malaysia. Thank you from the bottom of my heart. Prof. Dharmendra, I think I'm done for today. Prof. Dharmendra?
Thank you,
Yeah.
ma'am. Thanks a lot
Welcome, sir.
for your valuable words. And means I hope student must have really got a very good information, because you have shared the things so much relevant to latest health technologies, and this was the need of the students, like on the on the zeal of the students and on the demand of the students also we have finalized the topic. And as this is the need of in today's scenario, as you have told that post COVID the things has changed a lot, and now we are very much dependent on the technology. And thanks to COVID only, that's why we are connected. Because earlier you have to call someone from all over Malaysia to India, then only a renowned person like you can connect with us. But due to digital technology, we are getting connected, and same things have been applicable now in healthcare sector also. So thanks a lot, ma'am. Thank you for blessing us with your valuable words. And it's a really matter of pleasure for us that a renowned speaker like you is in between us and guiding our students. So thank you, ma'am. Now we are just proceeding further, and now we have some means first after the first session we have some presentations from research scholars and students of Faculty of Pharmaceutical Science. So I'll ask the coordinator, JVN Shilpa Thakur ma'am, uh, to proceed further with the presentations. Shilpa ma'am.
Namaste, sir. Myself, Jaipur Shilpa Thakur. I'm the coordinator of Faculty of Pharmaceutical Science, ICETPHT-2023 Women's University. Now, let us move ahead with the presentations part, starting with the research scholars. I myself, being a research scholar of the ICETPHT-2023 Women's University, will start my presentation. Uh, Namaste. Is it visible, sir?
Yes, it's visible.
Okay, thank you, sir. Namaste. Myself, JVN Shilpa Thakur, research scholar in the Faculty of Pharmaceutical Science, Jayati Vidyapit Women's University. Uh, Today, on the occasion of International Conference on Emerging Trends in Pharmacotherapy and Health Technology, my topic is personalized medicine, a new normal to medicinal success. Firstly, I'll start with the introduction of personalized medicine. Personalized medicine proposes the customization of healthcare instead of the model that was already used, that is, one drug fits all. We always use the model one drug fits all the persons, but now with the advent of personalized medicine, which is also referred as an precision medicine, it holds a great promise to improve the healthcare. In precision or personalized medicine, it is defined as a medical treatment which helps to treat individual characteristics of each patient, and it also helps to improve our ability to diagnose and treat the diseases. Personalized medicine, it refers to the tailoring of medical treatment of an individual person, but it doesn't mean that we tailor the drugs as per the individual person. Personalized medicine means that the group of patients are divided into subpopulations based on their genetics, based on their genes, and therefore it is helpful to design the medication for a particular disease. Here it is an example that when we talk about a single drug that is correlated with the genetics of group of patients, the group of patients will be divided into different subpopulations. Here we have four subpopulations for a single drug. First is a subpopulation that responds to a normal dose of drug. The genetics study will explain the dosing and the prevention of the disease. So, first is a subpopulation that responds to the normal dose. Second, we have a subpopulation that will respond to a lower dose compared to the normal dose. So here the genetics of the patients can be identified and the dose can be decided as per that. Third subpopulation is a population which responds to the higher dose of the same drug, and the last subpopulation is that responds to an alternate medication, which doesn't respond to a normal medication but an alternate medication. So this is an example by which a personalized medication can be explained. Next, how does the personalized medication works? Firstly, it depends on the identification of the biomarkers. With the help of the biomarkers, we can identify how the patient's body will react to the drug, and as per that, the drugs will be prescribed to the patient. Next, for this, we have to study the variations of DNA and RNA which are related to the drug response. It is also based on the patient's unique genetical profile, as each and every individual patient will have a genetic profile, a particular one. Next, it is participatory, engaging patients in lifestyle choices and even health maintenance, as the lifestyle changes can be undergone as per their genetic profile. Next, we'll see for the need for the personalized medicine. What is the need for personalized medication? Firstly, when we talk about different illnesses which have similar symptoms, we have seen many symptoms which are similar in all the illnesses or many diseases. Here, when we talk about different illnesses having similar symptoms, it creates a need for the preparation of for getting an information on genetics, so that the symptoms according to the diseases can be specified. Medical interventions many times may work in some people, but not in each and every individual. Here we have noted that 40% of drugs are taken but are not proved to be effective in many patients. So when before giving the medication or before prescribing the medication, if the genetic profile of the individual is known, so the metabolizing rate, the drugs, allergic, the adverse effects, this all can be avoided and can be helpful to the patient. Advances in genomics can help the patient precisely and effectively. What are the advantages of personalized medicine? It will reduce the burden of the medicine, as burden of the diseases, as the genetic profile will already specify what kind of diseases a patient can have, what kind of diseases a patient undergoes or can might undergo in future. It also focuses on the prevention. Well, it is said that prevention is better than cure. So by knowing the genetic profile, we can beforehand prevent the diseases that might occur in an individual. It will diminish the duration and severity of illness. The illness severity and duration can be shortened, as uh, uh, the patients are given the drugs as per the trial and error method. If that drug does not is not helpful to the patient, then we go for the another drug. But if the genetic profile is available, then the duration and severity of the illness can be taken care of and the duration can be shortened. Next is reduced healthcare cost, as the trial and error method is not taken place. The healthcare cost will automatically go down. This will help increase the benefits and also reduce the risks of adverse effects and allergies, and thus it improves the efficacy of the drugs. Next, we'll talk about the disadvantages of personalized medicines. There are quite a disadvantages for personalized, like the diagnostic result. As we all know, the personalized medication will totally depend on the diagnostics. Firstly, the medication which we give depends on the biochemical tests. But when we talk about the personalized medications, the biochemical test will be combined with the genetic tests, and then the drugs will be specified to the patient for its diseases. So, if the diagnostic results are incorrect, then it can be a major drawback and disadvantage for the use of personalized medication. Genetic variations are numerous and quantitative. Second is genetic variation. Yes, genetic variations. When we talk about genetics, genes, and coding, then there are a lot of numerous genes and there are a lot of codings that will be responsible for many different things in our body. So, knowing the entire amount of genes as per the Human Genome Project will be very helpful. But as the genetic variations are numerous and quantitative, then it can be proved as a disadvantage if it is not taken care of. Next, personalized medicines are yet not widely available for the personal use or for the public use. They are slowly being developed. People many times do not opt for personalized medicines, as the personalized medications need the diagnosis of the genetic profile, and many of the people are not aware or are feel a risk of privacy, of data management and privacy. What are the future aspects of personalized medicine? When we talk about future aspects of personalized medicine, first, a main point we can take is space medicine in healthcare of the astronauts. It is also an important thing that can be correlated with the personalized medicine. The astronauts, we have seen that astronauts face a lot of problems when they are in space, and they have many medical issues to look upon. So personalized medications can be very helpful for the healthcare of the astronauts and in space medicines. Next, measurement of biomarkers has been used as a tool in personalized medicine to predict the outcome of treatments. Yes, we have seen many biosensors playing, with the help of biomarkers, playing a major role in nowadays diagnostic tools. Early detection of disease at a molecular level. If we improve the personalized medication and diagnostic tests, the diseases can be detected at an early stage and molecular level. So the diagnosis will be earlier and the cure can be easy. Accurate disease diagnosis can be done, and individualized treatment strategy can be understood upon. Conclusion: here we can conclude that the health systems will turn from reactive medicine to proactively understanding and supporting individuals in managing their own health. One example of personalized medicine can be taken as for warfarin. Warfarin is an FDA approved oral anticoagulant drug. It is a highly used anticoagulant drug, but it has a large amount of inter individual variability in pharmacokinetic and pharmacodynamic profile. uh, for the rate of ADR is highest in all the prescribed warfarin patients. With discovery of the polymorphic variants in cytochrome and VQRC1 genotypes, the two genes encode the use of anticoagulant, that is warfarin. With the help of these genotypes, with the help of these genetic profiles in individual patient, it was much helpful to prescribe warfarin for its optimal dose and thus prevent the side effects of warfarin in many of the patients. Not only in the treatment, but yes, this personalized medication can also be helpful for choosing an inclusion or exclusion in the final stages of clinical trials. So personalized medicine also plays a major role in the final stages of clinical trials for inclusion or exclusion. Many companies of India and even abroad are nowadays into using personalized medications for the betterment of the treatment. Thank you. These are the references. Thank you. Next, I would like to call upon another research scholar, that is JVN Anamika Verma, for their presentation.
Namaste to Honorable Advisor Sir and Advisor and CEO Sir, respected Registrar Ma'am, Dean and Director Dr. Dharmendra Ahuja Sir, and I, JVN Anamika Verma. Uh, let's talk upon the topic of nanoparticles, current status and future aspects. Introduction. Nanomedicine is defined as monitoring, repair, construction, and control of human biological system at the molecular level. Because human body is a complex system of interactive molecule, technologies are required to repair the body in a molecular machine technologies. Mainly, the nanomedicines creates a drug delivery system in a particle that ranges in a size from 1 to 100 nanometers. Nanoparticles, yeah, or nanomedicines can be engineered to be biocompatible and biodegradable, making them ideal for drug delivery application. Mainly, it offers significant potential for improving patient outcome across a range of therapeutic areas. This represents the overview of recent advancement, emerging trends in nanomedicines. Now, the history of nanomedicines. In 1980s, the term nano medicines or nanotechnology was coined by Dr. Eric Dexler, and again in 1990s, researchers began to explore the potential applications of medicines that is in the field of nanomedicines. Now, mainly, how and what are the applications of nanomedicines? First application is mainly there are two types of applications that are divided in the nanomedicines. First one is diagnostic, and the second one is therapeutics. The therapeutics is mainly divided into multiple categories that I'm talking about. First one is metal based, second one is lipid based, and the third one is polymer based. Mainly, the diagnostic features represents the targeted drug delivery, imaging, and sensing of the diseases that comes in the body in a various forms. It has the potential to revolutionize the way we treat diseases by providing more efficient and effective therapies with fewer side effects. There are different types of multiple applications are also there. First one is monitoring of diseases, that is mainly for discovering the vaccines and gene therapy, for transplanting the kidney or heart or lungs, for treating the artery diseases, or in the cancer cells, for tissue repairing. Now comes on the nanoparticles in drug delivery. Nanoparticles are basically used to improve the drug delivery and overcome the limitations of traditional drug formulation. They can target specific cells or tissues and have enhanced pharmacokinetic properties. Examples like liposomes, polymeric nanoparticles, and dendrimers. Now, how the pharmacotherapy correlate with the nanomedicines, that it enables a dosage forms formulation that provides a drug directly to the site of action with safe release of patients in a controlled way, that we can also call in a one word, that is a targeted drug delivery system in a controlled manner. Now, what are the future perspectives of nanomedicines? Mainly, nanomedicines have the potential of many areas of medicine. They can be used for vaccine delivery, gene therapy, regenerative medicines. Nanoparticles can also be used for environmental remediation, energy storage, and food safety. Nanoparticles have the potential for working in the vaccine delivery, or mainly in the environmental remediation or energy storage and food safety. Mainly, it also works in the field of engineering, chemistry, and physics, and also works in the drug profile or genetic profile based areas. Now we comes on the last topic, that is a conclusion that nanomedicine is a rapidly growing field that has the potential to in the field of pharmacotherapy. By using nanomedicine, it is impossible to improve the drug efficacy or the targeted drug delivery system in a reduced side effect, and develop that medicine in a controlled manner. Nanomedicines has numerous applications in various medical fields, and expected to have a significant impact on healthcare in the future. Mainly, it comes in the category also comes in the category of personalized medicines or for the patient's outcome. And with continued research and development, nanomedicines could lead to safer, more effective, and more personalized references for and treatment for a wide range of diseases. Now, these are the references. Thank you.
Namaste, Dr. Ankit Bhargav, sir.
Namaste, namaste.
Sir, we are proceeding with the research scholars' presentations. Next, I would like to call upon next research scholar, Anshul Saini, and she'll start the presentation.
Namaste. Honorable Advisor Sir, CEO Sir, respected Sir, Dr. Professor Dharmendra Ahuja Sir, and Mr. Dr. Ankit Bhargav Sir. My topic is virtual reality against virtual reality approach to traditional pain management as an so just a minute. Emerging Trends in Pharmacotherapy and Health Technology International Conference. Topic is virtual reality as an innovative approach to traditional pain management. Now, first introduction. Virtual reality is revolutionizing the field of pain management by offering an innovative and immersive approaches by transporting patients to virtual environments. So, what is the virtual reality? Computer generated environment with sense and object that appears to be real, making the users feel they are immersed in their surrounding. This technology has the potential to reduce the reliance of traditional pain medications with customizable setting and interactive experiences. Virtual reality empowers patients to regain a sense of control over their pain management as virtual reality technology continues to evolve. It roles in transferring traditional pain management approaches in begin increasingly significant. Next. Traditional pain management techniques. There are many techniques: medications, physical therapies, physiological therapies, mind and body techniques, community sports. Traditional pain management techniques encompasses a range of approaches, includes medication, physical therapy, and heat and cold therapy also. Medications such as non-steroidal anti-inflammatory drugs and opioids and commonly used to alleviate pain symptoms. Physical therapy techniques such as exercises, stretching, and manual therapies aim to improve mobility and reduce pain. Heat and cold therapy involves applying heat packs or cold compress to affected areas to provide relief for pain and inflammation. Traditional pain management techniques are often combined to create a personalized treatment plan based on the individual conditions and sensitivity. Severity. Virtual reality as in pain management. So, what is traditional pain management? Pain management approach includes medications, injections, therapy, exercise, and virtual reality is an innovative approach to pain management to the creates immersive virtual environment to distract patients from their pain. By engaging multiple senses, virtual reality effectively reduce the perception of pain and enhancing patient comfort during medical procedures or chronic conditions. Ongoing research and clinical trials are demonstrating the efficacy of virtual reality in managing various types of pain, highlighting its potential as a valuable tool in the field of pain management. Pain management, including medications, pain management, people help chronic, long lasting pain better and improve their quality of life. Methods and materials: first, manual therapy, patients, healthcare setting, patient pericular relationship, and treatment. Virtual reality utilize immersive technology to create stimulated environments and that divert patients' attention from pain. Virtual reality headset and accessories are the primary materials used to deliver the virtual experiences. Interactive games, guides, imaginary and relaxation exercise to engage patients and reduce their perception of pain. research and evidences, extensive research and evidences supports the effectiveness of virtual reality as an innovative approach to traditional pain management. Studies consistently demonstrate the virtual reality interventions effectively reduce pain, perception, and distress during medical procedures. Virtual reality has shown promising results in the managing chronic pain conditions, improving pain intensity, and enhancing physical functioning. The immersive nature of the virtual reality provides distraction, reducing anxiety level, and promoting relaxation during path-related experiences. Studies and success stories. Patients undergoing painful medication procedures such as burn wound care or dental treatments have reported significant pain reduction and decreased anxiety levels when using virtual reality in chronic pain management. So, virtual reality has shown success in improving pain intensity and functional ability. Future direction and conclusion. The future of virtual reality as an innovative approach to traditional pain management appears promising. Ongoing advancement in technology and expects the enhanced and immersive and interactive capabilities of virtual reality allows for the personalized and realistic experiences. Next, in conclusion, virtual reality has emerged as an innovative approach to traditional pain management that has the potential to provide patients with a safe, non-invasive, and effectiveness alternative to traditional pain management techniques. These are the references. Thank you.
Thank you, JV and Anshul Saini, for a wonderful presentation. Next, I would like to welcome Hemant Bhatia ji for the presentation. Namaste, sir. You can please start your presentation.
Ma'am, is it visible?
Sir, your PPT is not visible.
Ma'am,
Sir, the
is it
PPT is.
visible?
Yes, sir. It is visible.
Good afternoon, everyone. My name is Hemant Bhatia. I'm the research scholar in the JV ICETPHT-2023 University. We are going to present my research work, Isolation and Characterization of the Plumbago indica root extracts under the guidance of JV and Professor Dr. Dharmendra Ahuja. My aim and objective, material and methods, results, summary of research work and references. Then we're going to start with the review of literature. These are all the activities performed by the different researchers. Uh, After that, my aim and objective to study the plant material for the identification of the activation. Then after that, to study the plant extraction and phytochemical analysis. Then third part is to study the phytochemical screening and characterization of the novel compounds. Then we use the material and methods collection of the plant material, and after that authentication, we do the pharmacognostic investigation with the physical parameters. Then after verification of the physical parameters, then we do the extraction of the Plumbago indica with the different solvents. Then the preliminary phytochemical test for the whole abstracts and separation and isolation of the pharmacoconstituents with the different techniques. In step of the extraction and phytochemical analysis of the Plumbago indica with different solvents such as chloroform, ethyl acetate, and menthol. we do find that the total phenolic content and total flavonoid content of the extract was determined. Then isolation and characterization we do with the help of the thin layer chromatography, column chromatography, UV visible spectroscopy, FTIR, NMR, mass spectroscopy. Then in the thin layer chromatography, we will find that the methanol, ethyl acetate and chloroform extract was performed on different solvent systems, performed on toluene and methanol is used as the solvent, showed maximum number of spots as shown in the figure under the UV light, visible light and iodine chamber. Then the next in the isolation and characterization is the column chromatography. The fraction obtained from the silica gel column chromatography of the plumbago indica chloroform extract was tested for the detection of various phytocompounds using TLC. TLC of the isolated compounds component were performed and the RF value was compared with the standard F3 fraction was found to be shown the same RF with the standard of plumbagene. Then UV visible as the chromatogram shown that the UV spectra obtained from the isolated fraction F3 of our extract plumbago indica, the peak was observed in the range of 200 to 800 nanometer. The maximum absorption was found to be 408, 266 and 214 nanometer as shown in the figure. Then the FTIR also isolated fraction as in the table to identify the functional group in present in our extraction alcoholic group, carbonyl group, alcohol, alkane and aromatic group. Then NMR spectroscopy is also the isolation and characterization technique. We found out the different groups in present in our extracts. And then after the mass spectrometry, the molecular ion peak M plus of the isolated fractions was observed at 188.048, which is the same fragrant, same as it is the plumbagene is the standard our F3 abstractions. Then summary of our research work: the TLC, UV spectra, FTIR, NMR, all F3 abstraction was found the same RF value with one of the standard, and in UV spectra with the same absorption as the finding F3 fractions with the standard plumbagene. FTIR confirmation that the main functional group alcohol, carbonyl and ester are the present in the sample. The molecular ion peak with the isolated fraction F3 was observed at the 188 correspond to the peak of the plumbagene. That my research work was ongoing for the next task: formulation development of the ambosomes, characterization of the isolated formulation showing and anti-cancer activities. The summary of the research work, and these are the references we have followed it. Thank you.
Thank you, sir, for the presentation. Next, I would like to call JVN Abhishek Sharma, sir, next another research scholar for the presentation. He'll be connecting soon. Namaste, JVN Abhishek Sharma, sir.
Very good afternoon, ma'am.
Good afternoon, sir. Sir, shall I?
Yes, ma'am. Yes, ma'am.
Share this slide? Okay. So you can proceed.
Actually, presentation not visible.
Okay. Just a second.
Okay, sure.
Now it's visible, sir?
Yes, yes.
Okay.
A very good afternoon, respected dean and directors, jury members, special national and international guests, my seniors and my colleagues. Myself, Abhishek Sharma, presenting a topic of role of Medhya Rasayan nootropic drugs in developmental disabilities of children, which is guided by Dr. Professor Dharmendra Ahuja sir. Next. Developmental disabilities are combination of many conditions such as physical impairment, learning impairment, language impairment, and behavior impairment, etc. Development disabilities arises through development period, that is infancy, early childhood, adolescence, middle childhood and adolescence, and many influence of day by day function, and usually last throughout a personal lifetime. A suitable definition has been given by a federal government of United States of America, that is developmental disability is chronic disability that has mental, physical, or both impairment and can be manifested up to 18 years of ages. Next. Next. Medhya, Medhya means intelligence. Medhya means intelligence or power of retention, and Rasayana means rejuvenation therapy. By Rasayana, one can get the excellence of rasa, and apart from the excellence of rasa, the individual is empowered with psychic excellence like sharp memory, etc. In Charak Samhita, mainly four Medh Rasayans are described to for enhancement of the memory, cognition, intelligence, and nerve function. That is, the drugs. Four main drugs are Manduk Parni, Yasti Madhu, Guduchi, and Shank Pushpi. The word nootropic are derived from the Greek word nous, that is, which meaning is mind, and tropin is to turn on. Nootropic drugs are referred as memory enhancer, cognition, intelligence, and nerve tonic. Nootropic drug improve the oxygen supply in the brain by stimulating nerve growth. A recent article elaborate a new potential of Medharasayan for treatment of development and disability in children's. Next. Development disability in children. Developmental disability have a broad definition. It includes a complex group of disorder, intelligence, and speech disabilities. First is cerebral palsy. The cerebral palsy is a form of chronic motor disability which is non-progressive, and results from damage to growing brain before birth, during birth, and after birth. It is one of the three most common lifelong developmental disability. The other two are autism and mental retardedness. The incidence of CP is approximately 2.5 cases per thousand live births worldwide. But in India, it is 3.8% of population, which includes approximately 25 lakh of cerebral palsy children, as per the last statistical information. The incidence of cerebral palsy is higher in premature babies than mature babies, and 15 to 20% of total physical handicapped are due to cerebral palsy in India. For management of cerebral palsy, multidisciplinary approach is necessary, and use of medicine, nootropic herbal drug can give a significant result to control hyper, delayed milestone, and speech disability. Next. Mental retardedness. First was the cerebral palsy, second is mental retardedness. Mental retardedness is defined as significantly sub-average early development period, and concurrent defects in ability functioning. Mental retardedness is second most commonly detected neuropsychiatric disorder among the children and adolescents. Its occurrence among young individuals is about 1 to 2%. Mental retardedness is more common in males, common presentation in speech delay, behavioral disorder, or school performance. An IQ greater than 85 is reflected normal, and individual with an IQ level 70 to 85% are considered borderline. In this case, major sign, nootropic herbal drug are significant in symptoms such as speech delay and school performance. Next. Hyperactive disorder. Attention defects hyperactive disorder is symptom complex characterized by poor ability to attend task or motor, over ability at activity, and impulsiveness. Moderate to severe level of disorder are accomplished by poor school and social performance, resulting in easy distractibility. In this attention defect hyper disorder, also management of multidisciplinary approach is necessary. For the use of medicine, nootropic herbal drug can give a significant result in hyperactivity, in inattention, and emotional difficulties. Next. Next is learning disability. Learning disability or learning disorder are just like an umbrella term for a wide variety of problem related to learning. This is developmental disorder that usually manifests during the period of education and one of the important cause of poor academic performance. In this also case, in all the four cases, the nootropic activity and nootropic drugs or herbal drugs, medicine are important in management of the all four disorders. For management of multidisciplinary approach is necessary, and use of medicine can give a significant result to improve a poor school performance as well. Next. Based on the material mentioned as nootropic herbal medicine in Ayurveda, the mental enhancer medicinal plant such as Manduk Parni, Yasti Madhu, Guduchi, and Shankpushpi are found to be effective on development and disability such as cerebral palsy, mental retardedness, attention defects, and learning disability, and childhood autism. Medicine can be used either in polyherbal preparation or alone. Next. There are four drugs in Charak Samhita which has been described for nootropic activity. The first is Manduk Parni. Manduk Parni plays an important role in improving cognition, and the juice of whole plant is used as cognitive enhancer. A major constituent of Manduk Parni is saponin such as medicosoid, acetocosoid, medicosoids, acetic acid, and terpenic acid. Acetic acid in Manduk Parni has neuroprotective effect both in vitro and in vivo. This was revealed to use glutaric-induced cognitive defect of mice. Manduk Parni act on being brain growth promoter, improve learning and memory, and anti-conversion activity. Centella acetica, it's a biological name of Manduk Parni, owing to increase in the concentration of GABA in brain. Next, second drug is Yastimadu glycylisa glabra. Fine powder of Yastimadu, dried root, is used as medhi property. Its effect is more supportive when used with milk. Active ingredient of Yastimadu is glycyrrhizin, flavonols, phenolic compounds, isoflavones, and glycinic acid, etc. Yastimadu churn is effective for spinal learning and cerebral ischemia. It has free radical scavenger activity, memory strengthening activity, and antioxidant activity. Dried roots of Yastimadu are competent in brain tonic. It increases the circulation of CNS system and help to balance the blood sugar as well. Yastimadu significantly improve in learning and memory of scopolamine induced dementia and have significant action on memory enhancing activity of dementia. Next.
Abhishek sir, I will suggest to sum up the things in a summarized way as we have number of presentations. So
Yes,
if you
yes,
can
yes, sure, sure,
summarize
sure.
the thing.
Yes, sir. Okay, next, let's come to the conclusion part. Next, the herbal nootropic drug Medid Rasayan improve memory, sharpness, concentration, and improve grasping without the side effect, tolerance, or withdrawal. Medid Rasayan help in increasing circulation to the blood, varying the concentration of neurotransmitter, falling brain inflammation, activating the formulation of new brain cells, and defending the brain from free radical damage. Medicine act as different levels such as level of rasa act by stimulating and improving the function of agni and uh, improve circulation of rasa by opening and cleaning of microchannels for improved mental performance. Hence, this is need of present era to explore medicinal plant globally for improving cognitive function and mental performance owing to the minimum adverse effect. Next. Next. Thank you.
Yeah, very nice presentation by Abhishek sir. And means you have highlighted the various things. So, like, can you give it some more idea, like what are the latest technologies? Because we are talking here about health technologies.
Yes.
So, for memory enhancement, what are the latest technology being applied in addition to medicinal era, means what is the health technology advancements? If you can, do you have gone through some latest health technologies in the memory enhancement sector, or you can share some more medicinal plants which are recently being used for memory enhancing?
So there are many plants which are used in memory enhancement, but in Charak Samhita, mainly 4 plants has been described, which has a major role in memory enhancement. That is, which I have told, that is Central Acetica, Mandupani, apne Shank Pushbi. These are the mainly 4 plants which are majorly responsible for that.
If some newer idea can be, because idea is always above all. So if a new idea can come which can merge health technology with knowledge of medicine, in case of memory enhancement, I think it will be a game changer. Do you
Yes, sir.
think
Yes,
so?
sir. Exactly, sir. That is also my point. That is theme. Ki, I am using Tinospora cardifolia and Central Asiatica in a combination.
Yeah.
In a combination that will be produced as a tablet or granules for memory enhancement purpose. Because in the ancient book it is written that only single drugs are available, and that is only juice. I am challenging that ki, we are preparing a tablet for that, for the memory enhancement for combination of the both drugs.
Okay. Yeah. Very nice presentation. Thank
Thank
you.
you, sir. Thank you.
Shilpa ma'am, I'll ask you to proceed further.
Yes, sir. So here we have completed with the research scholars presentations for today's conference. Next, we'll move ahead with a student of masters in pharmacology, faculty of pharmaceutical science. Javian Sarila will next present the next present her presentation.
Namaste, Honorable. Namaste, Honorable Chairperson, Ma'am, Honorable Advisory and CEO, Sir, respected Registrar, Ma'am, all higher authorities, Dean and Director, faculty members, and all my dear JVNs. I, JVN Sarila, pursuing M.Pharm, Pharmacology, Faculty of Pharmaceutical Science. My international conference International conference topic is Emerging Trends in Pharmacotherapy and Health Technology. Sub-theme Core Pharmacotherapy. And my topic is Emerging Trends of Pharmacotherapy in Phytomedicine and their pharmacological effect on human health. Now introduction part. The science of medicines from plants is called phytomedicine. It can also be defined as the herbal medicine with therapeutic and healing properties. Also called as botanical medicine, herbal medicine, herbalism, phytotherapy. Now origin. The word phyto derives from the Greek word meaning plant. Hence, it means the plant-based medicines. How to work? In phytomedicine, plant medicines are selected to stimulate or strengthen the body's own function and immune system. Hence, support the body to restore itself to healing, itself to health. This picture shows how to collect and how to formulate phytomedicines in different doses, like dosage forms, pills, and sprays forms. Now, characteristics of phytomedicines. Phytomedicines are pharmacologically active compounds. Phytomedicines are cheaper other drugs. Phytomedicines are synergistic or antagonistic effects like rhubarb. And rhubarb have healing properties, wound healing properties, anti-inflammatory properties, etc. Phytomedicines are feasible. Phytomedicines are lesser side effects. Phytomedicines have different compounds which is present in active or inactive forms. Now, scopes of herbal medicines. Herbal medicines are widely used in the treatment of articular problems. Articular stands for which is widely used in joint related joint problems. And herbal medicines are widely used to treat gastrointestinal tract disease like stomach disorders, diarrhea, intestinal worms, etc. Herbal medicines or phytomedicines widely used to treat dermatological effects, wounds, warts, pimples, etc. Herbal medicines used to treat metabolic disorders, metabolic disorders like diabetes mellitus, hypertension, hyperlipidemia, etc. Herbal medicines widely used to treat infectious disease like tuberculosis, bacteria related fungal disease like skin disorders, etc. Herbal medicines widely used to treat musculoskeletal disorders like traumatic lesions, undefined muscular pains, inflammations, and phytomedicines used to treat cancer. And last, phytomedicines used to treat other diseases related to UTI infection, respiratory tract, central nervous systems like Parkinson disease. Now, these are the applications of phytomedicines where we use how to use phytomedicines control to diabetes. Diabetes is a common health problem all over the world. Every third person of the total world population suffer from the diabetes. Insulin dysfunction is the main cause of diabetes. It is of two types, type 1st and type 2nd. Traditional phytomedicines has been used to since ancient time in many parts of the world. Plants like Mucuna pruriens, Brassica junica, Momordica charentia, Eugenia, Jambolana have found to have an anti-diabetic property. More than 500 phytodrugs recently discovered have anti-diabetic activity. The principal anti-diabetic plants include Carica papaya, Citrus aurantifolia, Bidens pilosa, Momordica charentia. These are some phytomedicines which is used as a pharmacological effect in our daily lives, like fenugreek, cinnamon, curcuma longa, Momordica charenta, barberry. Now, conclusion. Phytomedicines are one of the most widely used medications all over the world nowadays because they give long and safe effect on human health. The main goal of this study is to treat and overcome the side effect of the medications. Phytomedicines play a great role in the field of pharmacy because of their extract material. The most important thing is that due to phytomedicines, we collect pure and new compounds. Medicinal plants are used directly on or in the form of various doses available in medical stores like pills, powders, spray, etc. And last reference, thank you.
Thank you, Sarila, for the presentation. Next, let us proceed with the students of Bachelors of Pharmacy for their presentations. Firstly, I would like to call upon a group of sixth semester students, sixth semester BPharm students for their presentation. Monica, Khushi Pauja and Shifali, please welcome and give your presentation.
Namaste, Honorable Chairperson Ma'am, Honorable Advisor and CEO Sir, respected Registrar Ma'am, all the higher dignitaries, Dean and Directors, respected faculty members, and my dear JVNs. I, JVN Monica,
I, JVN Sifali Singh,
and I, JVN Khushi Kahuja, pursuing Bachelor's of Pharmacy from the Faculty of Pharmaceutical Sciences. We are here to present the presentation on topic A New Era of Technology in Bringing Digital Pills to the World. Firstly, now I am going to tell you about what is digital pills. Digital pill is a pharmaceutical dosage form that contains ingestible sensor inside the pill. The sensor begins transmitting medical data after it is consumed. Second, how it works. Firstly, administration of drug via oral route. After the pill reaches to the stomach, it interacts with stomach acid, that is HCl. The generation of electric signals. These signals are captured by patch, which are present in arms. Patch function as receiver, which decodes the data about the drug. The receivers send the information to the mobile app. Patient can monitor the drug. World first digital pill. Abilify My Site, the first digital pill that contains antipsychotic activity approved by American Food and Drug Administration FDA. Epiprazole is the drug which has a brand name Abilify My Site. Who invented digital pill? Otsuka Pharmaceutical Co. Limited and Proteus Digital Health both get first granted approval. What are the scope of digital pill? Firstly, the products that are available in the market are tablet, capsule, microchip delivery devices. Second, indications, mental disorders that are anxiety, depression, cancer, infectious disease. We can use digital pills in the treatment of both the disease. Distribution channels. The drugs that are distributed in the market are hospital pharmacies, retail pharmacies, specialty pharmacies. What are the advantages of the digital pill? These are used in the disease detection and abnormalities in human. Small sizes so can easily move through digestive system, accurate and effective. Made of biocompatible material that is silicon, aluminum, copper, does not cause any harm to the body. The future aspect of the digital pills. There is no doubt that digital pills are a game changer for the medical field. However, there is no guarantee that all medication will come in the form of digital pills in the future. Conclusion. Visually examine the digestive tract wirelessly. Current design show the technology is still in the infancy, mainly due to small size requirements. Thank you.
Okay, so nice presentation. Uh, can you uh, say something about latest health technologies which are being used in pharma sectors? Your presentation was good. Yeah.
Sir, Abilify My Site is the drug that is used recently for the monitoring of the digestive system. Epiprazole is the drug.
Yeah. Nice. So kindly proceed further. Ask. Yeah, Shilpa ma'am, are you there?
Yes, sir.
Yeah. So we can proceed further. Okay, nice students. Yeah.
Yes, yes. Thank you, students, for a lovely presentation. Next, we'll move ahead with another presentation that is by the students of second year B Farm, that is fourth semester. I'll like to invite JVN Preeti Gurjar, Manisha Vaishnav, and Bustan Bairwa for their presentation.
Namaste, Honorable Chairperson Ma'am, Honorable Advisor and CEO Sir, respected Registrar Ma'am, all the higher authorities, Dean and Directors, respected faculty members, and my dear JVNs. I, JVN Preeti Gujar,
IJVN Muskan Behra. IJVN Manisha Vaishnav, pursuing Bachelor of Pharmacy from the Faculty of Pharmaceutical Science.
we are here to present our presentation on topic shedding light on the pharmacotherapy of photodermatitis and a comprehensive review of treatment options. Let's start. What do you mean by photodermatitis? Photodermatitis is a condition characterized by inflammation and irritation of the skin caused by exposure to ultraviolet radiations from sunlight or other sources. Hereby, we can say that photo means light and dermatitis means skin inflammation. We can say that skin conditions that result from an abnormal reaction to sunlight or other sources of ultraviolet radiations. Signs and signs and symptoms: blisters or itching, patches, hyperpigmentation. Hyperpigmentation, we can say that having a dark areas on skin, redness, pain and swelling, headache, fever, nausea, skin cancer. Extra symptoms we can see in photodermatitis. Treatment options of photodermatitis: avoiding re-exposure. It means to stay away from the plants that trigger the skin reactions. Second point, avoiding other skin irritants. Avoiding the use of abrasive soaps, detergents, etc. Third point, cold compresses. For relieving the discomfort, we apply a cool wash cloth to the area, reducing sun exposures. Avoiding UV radiations during peak hours from 11 a.m. to 2 a.m. Prescribed medications. Antihistamines. Antihistamines, we can use medicines or help to reduce itching, phototherapy, and oral steroids. In photodermatitis, these are the various options in the treatment.
Different medicines used in the photodermatitis. First, allopathy treatment in hydroxychloroquine, thalidomide, tetracycline, and the gracicolpins. In homeopathic treatment, the gelsemium, natrum muram. In Ayurvedic treatment, triphala, gandak, and chandan. In method and materials. In method and materials, the efficacy and the safety of a particular treatment and the mechanism of the condition. It includes first, participants. Selection of participants who have been diagnosed with the photodermatitis and obtaining the information. Second, treatment interventions. The descriptions of the treatments interventions being studied, including the type of drugs, doses, frequency, and the duration of treatment. Third one is control groups. Selection of a controlling group and the further use of standard treatment of photodermatitis. Fourth is outcome measures. In outcome measures to evaluate the effectiveness and the treatment such as reduction in symptoms, improvement in skin condition, and the quality of life. Next is data collection and analysis. After examine the patients, collect the data such as skin biopsy and the statistical analysis. Next is sample selection. In sample selection, the patient sample is collected. Next, diagnosis and the treatment duration. In diagnosis, A dermatologist using a clinical evaluations and the skin biopsy. In the treatment durations, the duration of treatment could be set for between the period of 3 to 4 weeks. Next is ethical consideration. In ethical consideration, the ethical principles and the ethical values and the moral values of patients. Photodermatitis. Um, we use different basic steps used in the therapy of photodermatitis. First, consult a dermatologist. Second, diagnosed by the doctor and take proper prevention and medicines. Future aspects. In natural and complementary treatments such as herbal remedies, probiotics, and dietary supplements are being used for the treatment of photodermatitis. The NB and UVB continues to serve as the effective and effects with the HBBT serving as the option to improve the patient compliance. The use of systematic corticosteroids will be reserved for the most severe cases. In modification in immunomodulators can help in modify the immune system response by increasing or decreasing the production of antibiotics. In conclusions, photodermatitis is a complex condition that can have a significant impact on the patient's quality of life. While a wide range of treatment options have been developed over the years, there is a currently no universal accepted standard of care for the conditions. Thank you. Thank you, students, for such a great presentation.
So now, same question from you also, students. Like, can you say some? Can you put some highlight on latest health technologies related to pharma?
Sir, related to pharma, the latest technology is phototherapy for treatment of photodermatitis.
Very nice, very nice. Yeah. So now
Thank you.
proceed for the next. Yeah.
Thank you, sir.
Shilpa ma'am, I'll request you to, yeah.
Ji, sir. Thank you, students, for the presentation. It was a great one. Next, we'll move ahead with another group, that is fourth semester students. Students Payal, JVN Payal, JVN Anushka Singh, and JVN Riya Chauhan. I'll invite you for the presentation.
Namaste, Honorable Chairperson Ma'am, Honorable Advisor and CEO Sir, respected Registrar Ma'am, all the higher dignitaries, Dean Directors, faculty members, and my dear JVNs. I, JVN Riya Chauhan, I, JVN Payal Yadvanshi, and I, JVN Anushka Singh, pursuing Bachelor of Pharmacy from the Faculty of Pharmaceutical Science, are here to present our thoughts towards the role of immunotherapy in cancer. The preface includes introduction of the immunotherapy, monoclonal antibodies, checkpoint inhibitors, cancer vaccines, limitations, advantages, future perspectives. Firstly, start with the introduction. In modern era, There are various developing treatments towards every disease. Immunotherapy is one of the developing treatment in cancer. Immunotherapy is a type of cancer treatment that improves the power of immune system to fight cancer cells. Immunotherapy focuses towards boosting the body's natural defense, which recognize and attack cancer cells. Moving further, we discuss about the types of immunotherapy which shares the same goal, that is to destroy the cancer cells. It includes three types which are monoclonal antibodies, checkpoint inhibitors and cancer vaccines. Starting with the first type, monoclonal antibodies. Monoclonal antibodies are the types of immunotherapy that works by targeting specific proteins on the surface of cancer vaccine. For example, transcriptomics, which target the protein called HER7 that is overexpressed in the breast cancer. Second type is checkpoint inhibitor, a type of drug that blocks protein called checkpoint that are made by some types of immune cells such as T cells and cancer cells. It is categorized into three parts approved by US FDA, which are PD-1 inhibitor, PD-L1 inhibitor, and CTLA-4 inhibitor. The third type is cancer vaccine. Cancer vaccine are a form of immunotherapy that can help to educate immune system about what cancer cells look like so that it can recognize them and eliminate them. For example, BCG Live, it is a type of cancer vaccine that treats early stage bladder cancer. Now, discussing about the advantages of immunotherapy, it focuses on improving immune system, which include increasing infiltration of T cells, promoting presentation of tumor antigens, and also helps in reducing the efficacy of immunosuppressive molecules. Here the limitations are everything with benefits has its own disadvantages and limitations. Immunotherapy work on immune system through it depends on one's immune system ability to defend themselves from the cancer cells and their response towards the cells. Till now date, immunotherapy are only introduced for a few type of cancers only, which limits the efficacy of immunotherapy. Any newly introduced medicines or treatments are expensive on their discovery stage. Immunotherapy is on its growth stage, so it can be very expensive, varying between 1,30,000 to $1,45,000. Here the future perspectives. In the next 20 years, there will be more discovery number of T cells which will provide protection against different immune pathologies that will affect the immune system and immunity. These T cells also work on autoimmune disease. That's, thus we conclude that immunotherapy has emerged as a promising approach to cancer treatment, and its role in cancer treatment is continuing to evolve. Further research is needed to fully understand the potential of immunotherapy in the treatment of cancer and to develop more effective and affordable treatment that can benefit all patients. Thank you. Thank you, students, for such a wonderful presentation.
Yeah, one the presentation was very nice, and means as it's a chance for us to interact with you also. So, can you correlate, like the conference theme is pharmacotherapy and health technology. So, how do you correlate pharmacotherapy with health technology? Means, are you getting my point? I mean to say, like, uh, we have kept this topic. So, what do you think? How that pharmacotherapy is correlated with health technology, or do you think that health technologies should be implemented in the pharmacotherapy sector? Will it really increase the value of pharma sector, or you think it should not be integrated with pharma health technology? What's your view? It's not a
Sir, in,
question, it's just to ask your view. Yeah, tell me.
sir, in previous year, we used the chemotherapy in which we target the cancer cell and with the help of UVAs, we kill the cancer cells. But now there is a disadvantage of it which activates the more surrounded cell by the cancer cell. So immunotherapy includes the three types, and the most common type is cancer vaccines, which
You try to speak little louder. Your voice is not. I'm unable to listen. Yeah, tell me.
so in previous year we used the chemotherapies, which
Yeah.
targets the cancer cell, but had the disadvantage that it also activates the surrounded cells by the cancer cells. So further moving in new era, we developed the immunotherapy, which targets the immune system. So we can relate it by we activate our immune system rather than killing the cancer cells in it.
Okay, Shilpa ma'am, we can move forward.
Yes, sir. Thank you, students, for the presentations. It was a great one. Next, the last presentation of first session. It is by fourth semester student Neha Kumari, and I'll invite Neha for starting the presentation.
Thank you, ma'am. Thank you, ma'am. Namaste, Honorable Chairperson, ma'am, Honorable Advisor and CEO, sir, respected Registrar, ma'am, all the higher authorities, Dean and Director, Professor Dr. Ahuja, sir, Dr. Ankit Bhargav, sir, Coordinator, ma'am, respected faculty members, and my dear JVNs. I, JVN Neha Kumari, pursuing Bachelor of Pharmacy from the Faculty of Pharmaceutical Science. I am here to present the presentation on topic Pharmacotherapy of Anxiety Disorder. Now, Now I'm going to tell you about what is now I'm going to tell you about what is anxiety, who is affected by it, types of anxiety disorder, symptoms, and their treatment. What is anxiety? Anxiety include feeling uneasiness, worried, nervousness with physical symptoms of stress. Anxiety is a very common and normal way people react to stress, while many people do not seek help for anxiety, but it can be treated. In my next slide, this figure represents the data of social anxiety disorder. Estimated worldwide prevalence of anxiety disorder is 60.2%, and age onset can be seen as early 11 years. Mind General collect the data and figure out that around 1 in 3 adults affected by social anxiety disorder. 78% people all over the world having lifetime comorbidity with other mental disorder. Now, in this slide, the type of anxiety disorder that would be helpful to diagnose, and for the treatment of anxiety disorder, there are 6 types of anxiety disorder: generalized anxiety disorder, which occur due to chronic worries; panic disorder, which occurs due to overwhelming fear; post-traumatic disorder, which also occur due to stressful experiences; social anxiety disorder, this is the most common, which occurs due to fear of public; phobia, strong fear of thinking and situations. Now, the symptoms of anxiety disorders are dizziness, headache, dry mouth, backache, blurry vision, sweating, stomach, nausea, etc., as shown in this slide. Over worldwide anxiety disorder are treated with various methods. I am discussing about few of them. Firstly, non-biological and psychological therapy. In this, we do not use drugs and medicines. It includes cognitive behavioral therapy, psychoanalysis, supportive counseling, brief psychological therapy, group psychotherapy. Biological and pharmacological therapy. This include drugs and medicines. It also include antidepressant, antihistamine, beta blockers, and antipsychotics. For anxiety disorder, various medical management are used that are antidepressant drugs. And first, antidepressant drug is a first line treatment for anxiety disorder. There are two type of antidepressant, SSRS and SNRS. Both are used for the production of specific neurotransmitters. The example of SSRIs is Leprox and Prozac. Second is bupropion. It is also another type of antidepressant commonly used for the treatment of chronic anxiety. Conclusion: I examined the extensive body of study evidence supporting the use of various drugs classes outside their approved, including second generation antipsychotic and new antidepressant. Finally, I assembled useful and flexible hierarchies for the evidence based sequence of pharmaceutical trials for generalized anxiety disorder, panic disorder, and social anxiety disorder. Thank you.
Thank you, Neha, for the presentation.
Thank you, ma'am.
Yeah, so I think Shilpa ma'am, now student presentations are over.
Yes, sir.
So I think we should declare it lunch now. It's already 12:42. So as per schedule, we will meet after lunch. Just 1 minute. Just 1 minute. I'm just coming. So we will connect at 2 p.m. now.
Yes, sir.
Yeah, students can take their lunch, and after that at 2 p.m. once again we have learned speakers, and they will also be assessing the students as well. So we can call it lunch now. At 2 p.m. we will connect again. Thank you.
Yes. Thank you, sir.
Namaste, Honorable Sir. Uh, Thanks a lot. Am I audible, sir?
Yes, sir. Namaste.
So, as you were there with us in the inaugural session also, and uh, it's a matter of pleasure for us that a renowned dignitary like you is with us. Uh, your brief introduction is means you even don't need any introduction because you are a renowned pharmacologist in Indian scenario also and in international scenario also, and you are heading JSS Mauritius. So it's a matter of pleasure for us to connect with you. And now, as we have entered in the post-lunch session, and we have various brainstorming session from other faculties also, and means as I shared from 12 countries, more than 11 countries, different speakers are going to connect with us from Belgium, from UK, from USA. As you are also from Mauritius. So, sir, I'll request you to please say some blessing words and then please proceed with your presentation, sir.
Thank you, Professor Ahuja. I think this is the excellent platform where from the different countries people come and share their views and see what best can be done for the healthcare sector as COVID has shown us various phases and what at one point of time the entire world was stuck. What is to be done and how to move forward. So in this lines, I think Jyoti Vidyapith and under the leadership of the advisor and CEO and your leadership, I think we are on right track, and we are talking about the emerging trends in pharmacotherapy and the health technology, which is one of the very important aspect of today's scenario, and we should. I feel that with this we should come out with some of the um, keywords or the key points which will be taken up by the participants, as well as some of the recommendations which will be given to the Pharmacy Council of India or the Indian Pharmaceutical Association, and once they take up those recommendations, I think it will be at the national level, and of course when you have some recommendations you can share with the international speakers as well, so they also will be able to take it up at their level as well. I was it was very nice to understand from Professor Singh about the curriculum changes. I'm aware that the PCI was working from quite a few years about some of the curriculum changes which is going to take place. In fact, here also in Mauritius, we have done a certain exercise and did some of the curricular changes for the BPharm and the PharmD program as well. And our BPharm and the PharmD program, it is in first 2 years are in the common track. So the student joins us, and for 2 years they go for the common track, so that the basic idea is to understand the students about the pharmaceutical sciences as well as pharmacy practice, and then after 2 years they choose which field they would like to do. They would like to pursue their career in the pharmacy practice or in the pharmaceutical sciences. So this already we have done it here at the Mauritius campus. So I feel this is the right platform, and I'm sure we are going to have some good outcomes from this particular platform. Thank you, Professor. So, if you allow me, I will take up the presentation, and I would like to show you what we have done specifically with the theme which was given to me.
Yes, sir. Yes, sir. Surely, sir, we will be highly interested to see your presentation. And I would like to share that from Ethiopia, Dr. Nurullah sir has also joined, who will be presenting after your session. So
Sure.
before your presentation, I would say Dr. Nurullah sir also to share some blessing words, and then we will start with the presentation. So I hope it will be fine.
Yeah,
Yes.
absolutely fine.
Yeah.
Good afternoon. Good afternoon, sir. Am I audible, sir?
Yeah, you are audible.
Yeah. Very good. Good afternoon, and first of all, I would like to say heartfelt thanks to the Professor Dr. Dharmendra sir for inviting me and making me a part of this wonderful conference. Really, I am very much honored, sir. Thank you very much, sir. And I want to thank
Honor for
all
us
the
also, sir, to associate with you. Yes, sir.
yeah, I want to thank all the organizers behind this conference for smooth conductance. And hello, sir, Ashish sir also here, and hi, sir. It's a very
So
honor
this
to
is
meet
because
you
of
in this.
digital technology. On same day, 11 country people can
Yeah,
interact
yeah,
with
yeah.
on
It's a
this
great
topic.
honor, sir. Even our college, our university is very much honored here to represent
So it
as
means
a
because
country.
so that's why we have kept the topic health technologies. So
Yes, sir.
this
Yes, sir.
technology should be applied in healthcare sector also. We can
Very much, sir.
do wonders in this
Yes,
sector.
sir. Actually, this as you said, this topic it's very important and needed topic. As you said, the young women budding pharmacists are there, which are believed to be the nation's strength, future strength of a scientific country like India. So from the morning, I am in between. I am just coming and seeing, and I hope it is very encouraging and enthusiastic sessions. I I I can give you confidence, sir, that I will not disappoint this moment moment I'm going. Yes, sir. Sir, Ashish sir can share, and after that I can
Yeah. Thank
give
you,
some
sir. Thank
inputs.
you for your nice words. Now
Pleasure
I'll
is mine,
request,
sir. Pleasure is
yeah,
mine, sir.
I'll request respected Ashish Wadhwani sir to please share the presentation. If
Sure. Just give me a moment. It is. Just give me a moment. I
yeah,
think I'm.
do you need any help from our technical team? Then also you can tell us.
This platform is new, so I'm just trying
Yeah,
to.
StreamYard
Yeah.
first time, sir. For me also, it is first time StreamYard.
Yeah, so I'm just trying to see how the.
That's
Yeah,
it.
I think it's working now. Is my slides visible?
Yes, sir. It's visible.
Okay. Thank you. And again, at the outset, I thank Professor Ahuja for inviting me for this brainstorming session. And the theme which is given to us was recent advancements in the drug design and drug synthesis. So based on this theme, we had a very wonderful work which was done from with my one of my PhD student, where we tried to develop insulin loaded microneedles, and which is a closed loop transdermal delivery system for the management of diabetes. So I thought that this particular topic will fit into the theme about the drug design and the drug synthesis. So I'll just take you to the journey of how this came up and why it is required to look into the alternative therapy than the regular therapy of just giving the insulin to the individual patients, and so far what we have done with this particular process. So this is what is the abstract of what I'm going to talk about, where we are talking about the microneedle technology, a biomedical engineering approach, where what we did was we tried to prepare the microneedles, and these microneedles were loaded with the insulin and star gelatin microneedles. And these microneedles were there were various tests which were done once the microneedles were prepared, and we went through the all sort of in vitro testing, the in vivo testing, and tried to see that what is the result of this microneedles and how the insulin is going to get released. So if you see here, the microneedles were applied to the animals, and then you have this microneedles. The yellow patches, what you see, are the microneedles which are beneath the skin of the animal, and then in this microneedles you have a green color. What you see over here is the insulin which was loaded for the hypoxia responsive polymers, and then this microneedles, and the idea was there are different types of microneedles. If someone is working on the microneedles, they may be knowing that there are hollow type microneedle, polymer based microneedles, dissolving microneedle patches. So what we tried to do was we took up the dissolving microneedle patches, and this microneedle patches, we why it was taken up, because ultimately this microneedle patches will be dissolved and you will have the free waste. So you can see it over here that once the insulin is released, the microneedle patches are dissolved, and the transdermal patch will come out. So this is the pictorial picture about where you have the insulin which is loaded on the hypoxia responsive polymer, and once there is lack of insulin, then it will release the insulin in the body. So this is the concept which we developed, and when we started, we were having no clue that where we are going to lead, but we had a very good concept, and one of my PhD scholar, a young budding woman scientist, she told that let us take up this challenge and see what best we can do it. So just I'll skip some of the slides because of the lack of time, but I'll try to explain you what we have done it. So we know about the diabetes and where it is leading, and India becoming the diabetes hub. And if you talk about the 2040, 642 million people will be affected with the diabetes, and Mauritius is also not far. Mauritius also has young people, are affected with the diabetes. So this is again a projection for the country, like a small country like Ireland, Mauritius. Also, we have a lot of people who are affected with the diabetes. So fact about diabetes, we know that it leads to the leading cause of the death in the world, and the type 2 diabetes is much more common than the type 1, and around 90% of the diabetes worldwide is of the type 2 diabetes. And there are various issues with which once the diabetes is there are various issues with diabetes, and these are some of the recommended therapies. Again, this information, we have it is readily available on various platforms, that you have hyperglycemic therapy, which is done for the type 2 diabetes, where it starts with the monotherapy like metformin, and then it goes to the dual therapy, triple therapy, and then it goes to the combination of injectable therapy, like basal insulin is injected, and sometimes the GLPs or some of the drugs like metformin is also continued for the individual patient. So we are aware that there is issue, and these are some of the pharmacological issues with the type 1 diabetes, and these are some of the current problems which are associated with the insulin therapy. Once the individual is with the insulin, you cannot avoid. You have to take the insulin. There is no other go. So and insulin is the only medication for the diabetes. However, some common problems which are associated with the injectable insulin therapy, if you see, every time you have to take it. So it is the subcutaneous injection, and of course the painful, and leads to the lipo hypertrophy in the patients. Injectable insulins taken with the other diabetic drugs, which tends to risk the side effects. And traditional care for the diabetes, sometimes many of the patients says that, okay, you take the many of the people say that you take the traditional therapy for the diabetes. You take the noni juice, which is well known for the diabetes. You take the moringa juice, which is again a well known for the diabetes. So combining the traditional and the allopathic medicine again makes the patient at risk. Injectable insulin leads to the poor patient compliance and cause of pain and irritation as well. So these were the current problems which were associated. And because of these problems, we thought, why not? We had some papers previously which we saw it that in the anti-cancer therapy, we had some papers that for the cancer therapy also, some of the microneedles were developed. So we thought, why not try and do the artificial pancreas like a closed loop glucose responsive insulin delivery system? Why not develop that particular system and see that whether this system is going to work out for the insulin or not? Because insulin, as we all know, that it is a very sensitive molecule, and it tends to degrade very fast. So the lot of care is taken when the insulin is loaded into the diabetes, and whether it is going to hold insulin loaded into the microneedle, and whether it is going to hold into the microneedle or not. But there were challenges. We tried to overcome those challenges and tried to develop the microneedle patches. Now, when you talk about the microneedle, it is micro scale needles which are assembled on the transdermal patches to overcome the limitation of the injectable insulins. And when it is applied, the hole created by the microneedle will be used to deliver the insulin into the body. These are some of the literatures which are already available. I was talking to you about the cancer therapy. So in 2016, there was a paper that microneedle patch delivers the localized cancer immunotherapy to the melanoma. So this triggered us idea that if in case it is working out with the cancer, why not try for the diabetes therapy as well? So instead of injecting a needle full of the insulin and the hormone that body uses to process the sugar in food, when needed, the patch would be worn. And this patch is, it's a very compact patch which directly you can put it, and it is made up of the polymers or the hyaluronic acid, which is also FDA approved. So all those cares are taken to prepare this particular patch for holding the insulin, and a specific protein which will detect whether the blood sugar level is what is the blood sugar level in the body, and when the blood sugar level gets too high or low. And that is the environment. I'm sure we all know that it is the hypoxia condition. The protein reacts with the glucose, dissolving the pocket, and thus releases the right amount of the insulin, and then it stops. So this was the concept, and based on this concept, this particular microneedle patches were developed. I'm not going to explain about how the insulin is secreted. We are all aware about, as a pharmacologist or the pharmacy students, we learn about this, that how the insulin is released into the body, and how the glucose uptake is taking place in the body. So this process we are well versed about. So new approaches, like there are various new approaches which has come. Glucose responsive membranes came into the picture. Glucose loop insulin delivery came into the picture, where you can just put the patch, and you in the mobile you will be able to see that what is the level of the insulin what you have. So these are different various therapies which has come very recently. And FDA also approved the artificial pancreas, was approved in 2016. FDA grants the breakthrough delivery of closed loop insulin pump also came into the picture. So that was also approved by the FDA in 2019. So based on all these ideas, we thought, why not go with the insulin therapy? And this is what I was talking to you, that these are different kinds of the microneedles which are available. You have hollow, dissolving, hydrogel, and glucose responsive microneedles. Our interest was to take up the dissolving microneedle patches, which we took it, and we tried to prepare the dissolving microneedle patches so that the free waste will be there. So Dr. Zon, again one of our collaborators, he had this concept in 2022, which he published about this. So this particular study, what we did was we tried to fabricate the dissolving microneedle patches by exploring the various combination. We used the various combination. We used starch, we used gelatin, we used sodium carboxymethyl cellulose, and loaded the insulin with it. So we tried to prepare 3 different kinds of patches: star, dissolving microneedle patch, gelatin, and the sodium carboxymethyl cellulose loaded microneedle patch. And this patches, then we try to see that what is the delivery of the insulin, whether it is suitable, stable for the longer duration, cost effective, and easy to use manner. So with this concept, we tried to develop the dissolving microneedle patches. And once the microneedle patches were dissolved, this enables the patients to self-administer the microneedle patches and macromolecules and the drugs painlessly. Further, this microneedle patches, there were various tests which were done. We went for the characterization where we saw about the mechanical strength, in vitro skin penetration studies were done, stability studies was done, in vitro ex vivo and in vivo or in situ experiments were also carried out for this particular microneedle patches, and we could come out with many papers. This girl Vaishali Jana, she was my PhD student. Now she's doing postdoc in US, but she was very enthusiastic in writing the papers. And again, I see and I tell all my students that writing a paper is an art. So you should inculcate that particular art. You should see, you should read a lot of literatures and inculcate those arts and try writing from the starting itself, from when you are in B Farm, from there itself you start writing. So we could come out with many papers and the book chapters on microneedle patches, the way forward for the management of diabetes. We wrote some papers on the tiny microneedles for the retinal disease. One of my group is working again on the retinal disease and the tiny microneedle patches as well. So these are some of the papers which came through this. So we tried to divide this into two parts. We tried to do it with the nano particle which contains the insulin and glucose for the transdermal delivery. These are some of the results. I'll skip some of the results because uh, if I try and explain, it will take a lot of time. So these are some of the studies which were done for this particular
Pardon,
microneedle.
sir. Sir, the slide, next slide is not visible actually. Visible means first slide is visible, but next is not scrolling down.
The slide is not changing.
So you are on which slide?
From the beginning, it was in the first slide.
Oh my God! I have finished 20 slides.
Yeah. Now we can. Actually, we were thinking that you are briefing in that manner.
Briefing, yeah.
No. Okay.
Meanwhile, I would like to interrupt, sir, 1 minute. Dr. Abdul Salam Nazmi, sir, from Oman, from Muscat, has joined with us. So, welcome.
Good afternoon to everyone. Good afternoon.
Yeah. Welcome, sir. Welcome. So, with us from JSS Mauritius, respected Dr. Ashish Wadhwani, sir, is there. From Ethiopia, Dr. Nurullah, sir, is there. And from Kenya, very soon, Harshika Patel, ma'am, is joining for this session. So, sir, session was going on, so we will continue with that. Sir, please.
I'm pleased to meet with you all. Thank you so much.
Now the slides are not visible, sir. Earlier,
just give me a moment, sir. I'm just sharing the screen once again, and do let me know before I start the presentation again. Yeah. Is the first slide visible?
Not now. Not visible, sir. Earlier, the first slide was visible, sir.
It's not visible now?
No. At present, it's not presenting.
Okay. Let me try it again.
If possible, just stop the cam and share, sir. Maybe network issue also. Stop the cam
I'll
and
request
share.
technical team to help us, or you, if you can email us so that I'll just forward it to technical team, the PPT, or means
just 1 minute, just
stop the cam, sir. Try this, sir. Stop the cam and share. Maybe network.
Okay. Now.
Are you? Okay. So now,
is it visible?
PPT has came.
Okay, is it in the full screen?
It's
It
not
is
in the
a
full screen.
It is not in the full screen.
Is it now? Is it in the full screen now?
No, it's not in the full screen.
Mm-hmm. It is. I have from my end. It is in the full screen. I can see it here.
You can once press F5. You can try with that, sir. Now, once again, the slide is also not visible.
Because I have stopped it. This is the same process. Share screen.
Yeah.
When I share screen in Windows, I have the presentation. I share the presentation.
Yeah. Means anyway. Now it's presenting. Now the slides are also moving, sir.
Yeah, slides
Now
moving.
we
Sir.
are on the yes, slides are
Third
moving
slide.
fine. So we can proceed now, sir.
Okay, so I will proceed it. I don't know. I'll proceed it in this way if it is okay with
Yeah.
everyone.
It's fine enough, sir.
Okay. So I spoke about the diabetes, the facts about the diabetes, and what are the different therapies which are there in the diabetes, current problems which are associated with it, and why we went through the microneedle therapy for the development. And I'll not talk about the insulin secretions we know, glucose uptake we are aware about. These are some of the new approaches which has come up, and this is what we were talking about, the types of microneedles which are available, and we try to develop the dissolving microneedle patches so that this dissolving microneedle patches it will automatically get dissolved in the body, and the free waste will be there. So this particular study we tried to do with the three combination of the three microneedle dissolving microneedle patches. We tried with the starch, gelatin, and the sodium carboxymethyl cellulose, and entire idea was to check the efficacy and efficiency of the insulin suitability, stability for the longer duration, cost effective and easy to use manner. And of course, this microneedle enables the patients to have the self administration of the micro and macromolecules. And then we did various studies like characterization in vitro, skin penetration studies, stability studies, in vitro, ex vivo, and in vivo studies also were carried out, and we could publish various papers. This is what I was talking to you about, that various papers have come up from this. We tried in two parts. We did it with the microneedle patches, and we did it with a nanoparticle which combines with the insulin delivery also, where we use the hyaluronic acid powders and try to dissolve this particular microneedle, dissolve this insulin into the and prepare the microneedle patches. So these are some of the studies, some of the results which I'm not going to go in detail about it, but the characterization was done, FTIR studies were done, and the insulin standard curves were established. Stability studies were carried out for this particular dissolving microneedles. Then we went for the in vitro studies. We did the ELISA assays, and we found out what is the specific concentration of the drug which is holding. Bedford is one of the best way of checking. So we did with the Bedford method, and we could publish two good papers from this particular study, where we tried to publish it, the preparation of the enzyme based polymeric biomimic nanoparticle for the controlled release of the insulin, and the other one was again on the glucose responsive release of the insulin. So two papers came out with this, and then the second part we took out was the dissolving microneedle patches for the transdermal delivery, and we prepared, as I was mentioning, that we prepared the dissolving microneedles, which are promising candidates for the facilitating the rapid release of the macromolecules, and risk of diabetes related complications are reduced with the good glycemic control, simple and painless process for the administration of the insulin, increasing the compliance rate. So they are, of course, the polymeric microneedle, microscopic microneedles that encapsulated in the pharmaceuticals with their metrics and offer the simplicity of the use, low cost, and they are fully biocompatible and generate no biohazard, shape, waste as well. So all this minor things were taken care when we designed this particular study, and this study goal was to design, fabricate, and test the array of different combination of the dissolving microneedle patches for the in vitro and in vivo, and this is the process we followed. Fabrication of the dissolving microneedle patches, where we prepared, as I mentioned earlier, that we prepared starch gelatin, carboxymethyl cellulose, and gelatin carboxymethyl cellulose microneedle patches, and then the above gels were further heated in water, and then the gels were cooled down, and micromolds were used for the preparation of the microneedle patches. And then once the conical shape insulin loaded microneedle patches were obtained, we went for the mechanical strength, like how good those particular patches are. So we did FTIR, sterility testing, SEM analysis, confocal penetration analysis, dissolution test, stability, frank dissolution test for the on the rat skin in the ex vivo models and the in vivo models as well. So this is the abstract of what we have done, and you can appreciate these are the I hope it is visible. These are the three different types of dissolving microneedle patches which we could try to develop it, which we had the star gelatin, carboxymethyl cellulose,
Yes.
and carboxymethyl cellulose gelatin microneedle patches. So you can see it here. These are the different microneedle patches which we try to develop it. And these are again some of the mechanical force studies, FTIR, sterility testing was done for this microneedle patches. Scam analysis was done, and we could find a very good result with the stratum corneum, crossing the stratum corneum for the delivery of the drug. In vitro insertion depth experiments were carried out, and the fluorescent microscopy was done with the help of the Fiji Image software, where 750 micrometer depth into the mice skin was observed, and those microneedle patches down into the skin. And then we tried to do the what exactly is the depth experiment in the fluorescence microneedle patches. So these are the results where rhodium B was used, and it was observed under the confocal microscope. The vertical penetration of the microneedles on the skin was observed, and we could get a very good puncture sites, which was made by the one of the microneedle was recorded at the increasing depth of 0 to 600 micrometers as per the presence of the red dye depth test. In vitro, my skin penetration images were also carried out and taken from the confocal microscope. Entrapment efficiency and the stability was also done, and we got somewhere around for the insulin loaded dissolving microneedle patches. We got around 93%. The stability was evaluated at different temperatures, 20 degrees, 4 degrees, 30 degrees, and it was found to be more stable up to 30 days at 20 degrees Celsius. So all these experiments were done. We confirmed it with the LCMS. Sorry, I'm not well, so but still. Okay, so LCMS method as well. Then the stability studies were carried out. These are the result for the LCMS MS studies for the carboxymethyl cellulose, the starch gelatin, and the carboxymethyl cellulose gelatin microneedle patches. Dissolution test was done, and we could found that the release was somewhere around 94 to 96 percentage from this particular patches. The Frank's diffusion study was carried out, which is the ex vivo method, where we found that the CMC gelatin and CMC dissolving microneedle patches had 94 to 96 percentage up to 6 to 7 hours, with complete dissolution within 3 to 4 hours took place. So this was again a very encouraging results what we found it. And then ex vivo experiments images on the French diffusion, the studies on the skin mice was also taken up. The insulin released on the biopsy mice. The studies on the biopsy mice were taken for the in vivo method, and this is how the patches were applied. The microneedle patches were prepared, and the microneedle patches were applied onto the skin. Where if you see the image F is describe about the starch gelatin DMN patch, which doesn't get completely dissolved, it takes longer time and fails to fit to the skin, causing the drug loss. But when you talk about the image A to E image, which describes the patches which were applied, and C and D, where if you see the patch C and D, it is completely dissolved, which is carboxymethyl cellulose, and the carboxymethyl cellulose gelatin patches were completely dissolved. These two patches were completely dissolved in the within 3 to 4 hours in the particular study. Then we went for the histopathological analysis of the study as well, and we could file a patent, a process patent for the fabrication of the transdermal dissolving microneedle patches for the controlled release of insulin. The patent is already there available, and we are in negotiation with one of the leading biotechnology company with for the technology transfer from this particular product. So if we conclude this drug design part of it, like how the delivery part of it, this entire work suggested that the CMC and the CMC gelatin microneedle patch, dissolving microneedle patches have the better potential as compared to the star gelatin microneedle patches, and the hypodermic injections via transdermal injections for the diabetes treatment is possible. And I'm sure when we are going to have a tie-up with one of the leading biotechnology company, we are in the final stage, and I'm very much hopeful that this is going to go for the clinical trials as well. So once we patented, we published a paper on Springer Nature, which came out very well, where you have the fabrication of the CMC gelatin dissolving microneedle patches for the pain-free, effective, and the controlled drug release of the insulin. So technology transfer is in process. We are going to go for the technology transfer. So I of course, it is not a individual's job, and I'm very much thankful to JSS Academy, Higher Education Research, Mysore and Mauritius, JSS College of Pharmacy, UT, my alma mater, where I spent most of my time. It's around 14 years which I have spent at UT campus, and my collaborator, Indian Institute of Technology, where we prepared this microneedle patches at the Indian Institute of Technology, and this is the girl, Dr. Vaishali Jana, who has taken up this work, and very encouraging work which we try to do it. So once again, thank you very much for your patient listening, and I'll be happy to answer some of the questions what you have it. And thanks for the opportunity, Dr. Ahuja.
Thank you, sir. Thank you so much for your such a nice presentation, which is a really innovative idea. And as you have shown that you are, I hope it's under commercialization process, sir.
Yes, it is in the commercialization process, and
It will change the
hopefully we will be
scenario.
able to make it out.
Yeah, our best wishes, and means it will change the scenario. It will be useful for student, means patients, as well as uh, means it will change the health technology scenario, because in the same manner various drugs, route of drug administration or the advanced technology to administer the drug can be uh, think over it and can be done. Because as you have worked on insulin, sir, there are some other diseases also which are prevailing a lot, and alternative methods or less painful methods can be invented for them as well. So it will change the thought process of health technology. So it was so much relevant to our health technology topic, sir, and thanks a lot for sparing your valuable time. And now with us, yes, sir. So now with us, Dr. Nurullah KM from RC University, Ethiopia, College of Health Science is with us. Sir is also, we can say, our pharma fraternity expert. So I'll request Dr. Nurullah sir to now proceed with the presentation.
Thank you, sir. Thank you very much for the slot, sir. Once again. So shall I share
In
the
between,
screen?
if just 1 minute, sir.
Yes, sir.
Harshika Patel, ma'am, are you there?
Hello, sir. Yes, I'm here.
So in between, I would just introduce, sir, one more renowned speaker from Kenya. Harshika Patel, ma'am, has joined with us, Faculty of Pharmacy. So, ma'am will also be sharing her views with us. Dr. Abdul Salam Nazmi sir from Oman, Muscat is there. Dr. Ashish Wadani sir, respected from Mauritius is there. You are there with us. I am from India. So we can say at present also in the screen 767 countries are discussing together, and all are from pharmacy background. So this is also because of this technology only. So yeah, please sir, please. Ma'am, Ashika ma'am, I would like to welcome you for connecting with us. And as the sir's presentation is there, we would be having one blessing message also from you, and then we will be proceeding. But first, I'll request Dr. Narula sir to please start. Sir.
Yes.
Thank you.
Thank you, sir. Thank you, sir. Is my slide visible, sir?
At present, it is not visible, sir.
Yeah, one second. Now, sir?
Not now, sir. Not till now.
Okay, one second.
It takes 2 to 3 minutes lag also it takes. So we can wait for 1 minute after sharing like that.
Is it, sir?
Not now. Not visible, sir. Technical team, can you guide? Can you help us? Ashutosh sir, if you can hear us, can you just guide us? Like, can you please share something like which button we have to press and all?
Yes, sir.
Yeah,
Yes,
I'm
sir.
sharing the
I will help.
slide. I'm sharing the slide.
No, sir. No, sir.
Now, shall I share the slide, or I should share the screen?
Anyhow, because slide sharing will be much better way, but if it is not getting shared, then we can go for screen sharing.
Yeah.
At present, it is not visible, sir.
At present, it is not visible, right?
Now it's visible, sir. Now
Is it
it's
changing,
fine.
sir? Slides changing?
First slide has came.
Is the slide changing?
No, slides are not changing. You can press once F5, sir, so that it will come full screen also.
It's in full screen, sir.
It's getting presented now. We can see the first slide. It is there.
Slide changing, not changing.
Slide changing is not taking place.
Okay. Okay. Now is slide changing?
Yes, now it's changing. Now slide is also changing. Okay. Now it's
Okay.
fine.
Full screen, it is not changing. Maybe like
Okay.
in this,
So we can proceed in this way also.
Yeah, I can proceed in this, sir. Thank you, sir. Thank you.
Yes.
Thank you for the slot, sir, once again. And before entering into this topic, I would like to congratulate Aziz sir for the excellent piece of the work. And we wish it will be getting home as it is going to be passed to the clinical trials. Once again, we pray for that, and it's a very well piece of work, sir. Now, coming to the topic, the theme is recent advancements in drug design and drug synthesis. So today, I thought I would be just more concerned if I can give like artificial intelligence in drug discovery, just an overview, because it can suit to this recent trends. So artificial intelligence, as you all know, that it is booming nowadays. So I can just try to throw some fragrance to the young budding pharmacists, so that their interest towards this drug discovery with artificial intelligence or machine learning can be just facilitated. So before that, I would like to give a disclaimer. So, sir, slide changing, sir.
Yes, sir. Yes, sir.
Yes, sir. So a disclaimer is like I am a medicinal chemist and not a data science or AI platform architect. So just I am just talking about this based upon the experience and the work job what I am doing for past just 10 years. So I will be talking more about based upon the job what I have based upon the what I have learned in the job. So this presentation is purely for education purpose and just to create an awareness so that young budding future scientists may be working in this area. So the in the contents, some of the pictures or some of the articles and the respective authors own their copyrights. And in this presentation, whatever opinion, suggestion, comments regarding this presentation are on my personal capacity only. So today's contents, if you see, just I will be discussing about like drug discovery and development, just a view. We have only short period of time based upon the schedule, just a view, and artificial intelligence in drug discovery overview, and what are the procedures, what is happening in conventional and what is in the modern drug discovery, and some current challenges on AI based drug discovery. So just I will be trying to add some essence. That's it based upon this presentation. So first of all, if you see drug discovery and development, we all know that it is well known that it is an expensive process and it is a complex process. And expensive, you can see like around a drug discovery cost like more than $2.8 billion is estimated currently. And the complex process, on average, it is taking around 15 years and more. So why it is involved means because of the multidisciplinary approaches and challenges in the drug discovery and development leads to this expensive and complex process. So you can see like most drug discovery projects fail to deliver into the clinic due to the poor ligand quality and poor initial target selection. If you say poor ligand quality, it can be like ligand toxicity or at the ligand's efficacy on the allowed dose, it's not happening. So this is one of the major reasons for the drug discovery projects to fail. And in another case, majority of the drug discovery projects fail due to the poor initial target selection. So we choose target, but the target might not be the critical one. So in choosing a target, it should be a critical target. Once you target that, there should not be any bypass systems to do alternate biochemical process other than this target. So these are main reasons why drug discovery projects fail. But as far as even when I was doing my PG and research, I was thinking like designing drugs may be easy. So if it is easy, designing a drug is easy. But when you think efficacy alone, then designing is easy. But remember, efficacy alone is not going to take your drug to the market. There are many challenges or many properties need to be addressed. Otherwise, only efficacy we do. Very good activity, nanomolar activity is there, but we fail to take another additional steps. We end up with failurity. Why? Because we don't consider about the many other properties which are crucial for a drug to enter into a clinical setup. So even today, I personally have some compounds which have nanomolar activity, but I could not take it forward because of other properties which I have challenges in optimizing. So as a young pharmacist, when you are working in drug discovery projects, you need to be much aware that efficacy alone is not going to be your concern. Yes, efficacy is a prime important. The first thing to enter into the stepping stones, but efficacy alone will not help you. Efficacy with that other properties are there which you need to, which if you work, sure your drug can enter into the market. So what are the properties, other properties? You can see some of the properties I am listing here. These are the properties which are very, very essential. Without addressing or without optimizing these properties, your drug discovery project will fail very soon, very soon. So whenever you do it at the starting stage itself, you need to work on these type of properties like potency, selectivity, solubility, bioavailability, clearance of life, that is permeability. Then very importantly, CYP inhibition, because CYP inhibition, as you know, that it induction or inhibition will play a major role in drug interaction. And HERG blockade, that is a voltage potassium voltage blockade, which will lead to the fatal syndrome. So synthesizability, once again, very important. I can design in paper or computer anything, but if I cannot replicate in the lab, it is waste. And very important is toxicity. So these all properties during efficacy or potency itself should be considered. Otherwise, it is going to be a failure project. So what you are going to do? You are going to have a bunch of compounds with all these properties. You can just check which property is satisfied or optimized, or which properties need an optimization without compromising the other properties. So this way you can optimize the compound. Only we use, as far as academic research is concerned, we only concerned about activity. Oh, the drug is active. Okay, we sleep that as if we have invented a drug. So it is not the right one. Once you do, may it be academic research or extramural research, whatever it is, when you are doing a designing work, so you need to consider this, all the additional properties which are very crucial, and you need to give it is not like 4 properties are satisfied and 3 are not like that. You need to try to optimize as much as possible without compromising the other properties. So if you see this graph, you can clearly understand where we are now. So first of all, what you can see is hit compounds. Hit compounds, as I already told, we all are concerned about the efficacy. Yes, the efficacy is there, potency is there, activity is there. Yeah, many compounds end up, but it is not going to be a drug candidate, assured. But if you try to modify something, you will end up in some of the generation of lead compounds. Lead compound, once again, it will be close to some other properties. Yeah, it will be close to the optimized properties, some other properties. But once again, the number will be less when it is lead compound, because you can see the hierarchy there. The lead compounds will be satisfying more than efficacy property. That like that, it can be somewhat stable, somewhat metabolically stable, somehow safety will be there, but still all properties are concerned to become to make a compound to be a drug. So when it is further optimized, your compounds number will be drastically reduced. Finally, you will end up with 1 or 2 drug candidates. You can see that 1 or 2 will be having satisfactory results in all aspects. Yes, it can be like activity more, metabolic stability less, but metabolic stability should be there. It can be more or less, but if there is a range, within that range, if it is there, it can be passing the test for drug candidate. So the concern should be like all property addressing. After many years of initial research, I came to know that yeah, initially when I was doing my postgraduate, like activity, yes, activity. But later we came to know like these are very important, and we are not considering that it is only, we are considering only activity. Why can't a research for a known compound, active compound, why can't you improve the safety or metabolic stability or chemical stability or PK, pharmacokinetic or dynamic property. It can also be a good research in drug designing. So now these are the areas when you are concerning about drug designing, you are going to focus on these properties. Now, when you come into the artificial intelligence, so as you all know nowadays, artificial intelligence is well known to all. But don't forget, artificial intelligence is not new. It is like from since 1950, it is evolving. The main artificial intelligence is what we understand like advanced computer hardware system, robust, very strong data, and problem solving. Just we are human beings and simulating the human brain and solving the problem with the help of computers as well as strong data. Data is very important here. With the strong data, it is going to be simulating the human intelligence. So the meaning is simulating the human intelligence, but at the same time, the artificial intelligence will be far superior than the human intelligence. And very importantly, human intervention is required after the artificial inspired results. That is the very important point to be noted here. So once whatever artificial intelligence is throwing out, that cannot be taken further. So human intervention is required so as to which one to pick from the outcome or which one is not meaningful. So when you see the classification of this artificial intelligence, there are something like reasoning and problem solving, knowledge representation, planning and social intelligence, perception, machine learning, robotics, natural language processing. All this, machine learning is like a subset of artificial intelligence. Then you can see deep learning is there, which is a subset of machine learning. So already we know that CAD tools. I hope like computer-aided drug discovery, we know molecular docking, ligand-based pharmacophore modeling, that this blah blah. All this once again a machine learning. Machine learning once again uses a supervised learning system. But you see, in this you can improvise with the artificial intelligence and make it more efficient. So what up to now we do, like docking, pharmacophore modeling, all these things can be considered as machine learning, but you can add like a conventional machine learning, YAML technique, conventional machine learning. Modern drug designing or drug discovery includes artificial intelligence into it. Artificial intelligence, once again, it can be many applications are there, like big data analytics, etc. You also know about the chat GPT nowadays. If you just chat, it will be giving whatever you want, like that. So incorporation of artificial intelligence in the conventional machine learning can be more efficient and it can speed up the process. This is what I want to highlight here. You can see here artificial intelligence in healthcare and pharmaceutical industry. So it is not only AI is not only for use for research and discovery, for manufacturing, supply chain, clinical development, patient surveillance, post-market surveillance. For this all area already artificial intelligence is already boom. You can see. So for example, wearables are there, like wearable watches, telemedicines. All these under artificial intelligence only. Telemedicine, that wearables like BP monitoring, all these things. Patient is roaming anywhere. It is monitored under these all are artificial intelligence. So artificial intelligence in pharmaceutical industry is already boom, and we have clinical trials, AI-inspired clinical trials, which is approved, which is there. Pharma bots are there, and if you are not surprising, like in silico, AI-inspired in silico drug discovery, one company is there. They discovered a drug purely based upon artificial intelligence, and it has given positive results in the clinical trials. So it is not new, but we seem to be it is new, and many things are there to explore. So I'm just stressing the young pharmacists to be explored in this area and try to knock nook and corner and come up with some extraordinary research, which with the help of the artificial intelligence. Now, coming to the highlights of artificial intelligence in drug discovery, you can see like revolution is happening here, because we have high-end computer models, computer hardwares, and we have multi-omics data. Omics data, once again, we have genomics, proteomics, metabolomics, etc. Many large data are available. So I already told artificial intelligence, strong data, computer, and problem solving. So the revolution has already begun, and high performance computer hardware is there, availability of multi-omics data is there. With this help, now theoretical studies is converted to a real application in multiple disciplines. So when it comes to the data and the biological data, if it is the attention, already pharmaceutical industry has already using the artificial intelligence. Yes, already it is in use in industry, but in academic side we are not using this artificial intelligence because the cost commercially there is no free. Up to now there is very limited free tools in AI based models. It is commercial, which academic research or academic student is cannot afford it. But you see, under the scope, it is like development of freeware tools are in the progress. But for industry, it is nothing for them. Commercial value is nothing, because when they see the cost of conventional wet lab drug discovery, this cost of artificial intelligence models is very negligible. So for them it is nothing. For academic side, it is somewhat challenging to have a commercial product. But near future, open tools are in the progress of development. It will be, hopefully we will be using open tools in the near future. So now when you see AI techniques in the implementation of the drug discovery, drug target prediction, bioavailability prediction, and de novo drug designing, these are some of the implementation already which is in successful manner when it is compared to the conventional ML techniques. Like we already told, like docking, pharmacophore modeling, etc. like that. Comparing to this AI inspired is more efficient, and it gives immense results. Like for example, de novo drug design. We all know about the de novo drug design. It is like designing a drug without even having a scrap or without having a template. So, but the same thing can be done in the conventional drug designing CAD tools, like docking, pharmacophore, like that. But in that case, you need to know the knowledge. You need to have a knowledge of ligand or knowledge of the target. But in case of AI-inspired de novo drug designing, you no need of anything knowledge, all these things. Just based upon the data, it can give you a new drugs which can be explored in a large manner. So whatever already in existence, or usually what you are doing, that can be efficiently done if it is AI is just implemented. So now you see we can see just in a nutshell, we can see what are the processes in the AI inspired drug discovery. Three main processes, like data collection and curation. Then you are going to represent the compound, and you are going to use the AI method, and finally their application in the drug discovery. So data collection and curation in a nutshell, if you see, I already told big data databases are available, but the problem is that can be of poor quality or improper. The need, what we need, maybe not in that proportionality. So what you will do, you will collect and you will curate it, manually curate it, so that it can be further represented. Representation in the sense, as such compound, whatever it is, it should be converted into a computer readable format. For that we use, already we know we are using descriptors, molecular descriptors, 0-dimensional, 1-dimensional, 2-dimensional, 3-dimensional. So for what type of AI method or what type of application, what type of descriptors you use, that can be converted, and you will be using the AI method for the application of the drug discovery. So we will be very fastly can be seeing just the highlight, like high quality data set, the data collection and curation. A high quality data set is a key to applying AI to drug discovery, as I already told, because the data set should be very strong and of utmost quality. So the database can enable the drug discovery to transmit into a big data era to accelerate the drug discovery process. We know some of the databases like PubChem, Drug Bank, and some other databases are also there, which you can take, you can consider. They are all free databases, most probably free databases. You can just go and explore in this. Some of them I will list. I have just shown for representation. After the session, I can share these slides to the organization, so they can just circulate to the participants. So you can see ChemBL database, all are free, which I have represented here. ChemBL is there, ChemDB is there, Coconut is there. So ChemBL, it is like it's a bioactive molecules with the properties, physical, chemical properties are there, genomic data is there. ChemDB, once again, it is a chemical database with the experimentally or predicted. Both properties are there in the ChemDB. Coconut, if you see, it's an excellent database for the natural products. So natural products, around 400,000 unique natural products with their molecular properties. It's available in the Coconut database, and it is freely accessible. Then we have DGI, that is nothing but like a drug genome interaction or druggable gene of multiple sources. It is been listed here. Drug bank, we all know that it is a drug with 3D structures and useful informations. DTC is there, like it is nothing but drug target database. And input is there. Input, it is once again a free database. It's a platform of network pharmacology platform of traditional Chinese medicine. You see, generally we don't search for new drugs. We search for already which is there. Majority of the drugs based upon the effect of the traditional practices. So if you see Chinese traditional Chinese medicines, this database of all the herbs, it contains more than 30,000 compounds from 5,000 odd herbs. It is excellent natural product. Once again, Coconut input can be very largely helpful for those working in the natural product area. Like PubChem is there. Once again, this is already known for all. And cider database, you can see it is once again it is like a database which molecule with this side effect. So it's all our data. So it's believed to be quality data. So you can just take the data, and AI, artificial intelligence, can have access through this. Then it can be solving the problem based upon the feedback. So here, majority of the things are experimental data, except this ChemDB. Sometimes it is having the data which is predicted also. Otherwise, it is experimental data. So the knowledge from the experiment can be more appropriate and of good quality. So now, once you have a data, you need to represent. As I already told, the representation is nothing but computer readable format. You will be converting your molecule into some descriptors. As I told, 0 dimensional, 1, 2, 3 dimensional. You can see 0 means some simple, it is like a molecular formula, molecular weight, something like that properties. And 1D, if you see, means it is some structural formula, functional groups, some fingerprints, even smile notation comes under 1D descriptor. Smile is nothing but a simplified molecular input line entry system. A majority of the drugs can be identified in straight line notation. So it is a very good descriptor under one-dimensional descriptor, which can be used, or which is very largely used in variety of AI techniques, smile notations. So then when it's coming to the 2 and 3D, more information about the molecules you can get, like fingerprint, neural fingerprints, or circular fingerprints, like matrix, 3D, connectivity, neighborhood atoms, its geometry, its topology, its surface area. Likewise, you can have a much more information when you go to 2 and 3D descriptors. So with this, you can have a representation, and you can input into your AI model. So now you can see here the same thing. A simple molecule is just for a simple molecule, you can have a OD that is 0-dimensional descriptor, 1-dimensional, 2-dimensional, 3-dimensional. So some of the AI techniques use which type of descriptor that can be usable, and it will do it's a problem solving technique, and the desired outcome will be, or output result will be there, which will be very, very, very needed for the research. So now once you have a representation, now you will be knowing what common techniques are there for the AI. There are many techniques. believe me, there are many techniques. We don't know many of the techniques because of its commercial nature. Many techniques are there. To be fit for the purpose approach, the selection and application of AI techniques are problem oriented. So what is your problem? Based upon that, you will be fitting to a propose or fitting to a model. Mainly, when you see the learning techniques, there are two types of learning techniques. Even conventional ML technique is useful using this supervised or unsupervised learning. Two types of learning techniques, supervised and unsupervised. Even conventional ML is using this type of learning in the drug discovery. So just we will see what is supervised learning. Supervised learning in the sense just supervising, just input labeled data. You will be you will be inputting the labeled data to train the model. So based upon the trained model or based upon the labeled data, predicting outcomes of new data or the test data will be there. So this is known as supervised learning. AI is one of the AI technique. One among the two technique is supervised. When it comes to the unsupervised learning, it uses unlabeled data. So there is no labeling of data. There is no training like that. Just based upon the unlabeled data, clustering or clustering or dimensions reductions can tell you whether it is fitting that. It is believed that this cluster, if it is doing this thing, the same type of cluster is expected to do that. So in this way, it is unsupervised learning is known as unlabeled data, which will be using the technique like clustering and dimension reduction type. In terms of supervised learning, you will be using like regression. Already we use multiple regression, logistic regression, decision tree, classification, like that. So these are all coming under supervised, that is input labeled data. But in coming to the unsupervised, unlabeled data will be used. Only clustering and dimension reduction can be useful in this type of unlabeled data. So you can see here, as AI techniques, we have the four models like regression, classification, clustering, dimension. So regression classification can come under supervised. You will be inputting the labeled data, but when it comes to clustering and dimension reduction, you will be using unlabeled data. So application, if you see, it is wide variety of application of their pharmaceutical analysis, in toxicity prediction, bioactivity prediction, target identification, de novo designing, clinical designing, nanomedicine, etc., wide variety of application. So in a nutshell, you can see, like as I told, supervised learning, unsupervised learning, regression, classification comes under supervised, clustering and dimension comes under unsupervised. So once again, in regression type, what type of application you can use? You can use drug target identification. There it is regression analysis, especially multiple linear regression. You can use a linear regression, multiple linear regression. You can be used. Adverse drug reaction. It can be adverse drug. Once again, at the regression, you can use decision tree. So you based upon the decision whether it is expected drug ADR is expected or not. Decision tree can be used. Drug interaction can be a logistic regression. You are forecasting drug interaction. So logistic regression can be used. In terms of classification, compound classification, bioactivity prediction, de novo drug designing, molecular drug design. These all things can be done based upon classifying using a support vector machine or fingerprinting or neural fingerprinting, etc., can be used for this type of activity. But when in coming to the unsupervised, we have two types like clustering and dimension reduction. So clustering is I told like a fragment or cluster. Already the data's cluster and your input data's cluster is matching, means it is believed that that property will be maintained. So drug candidate selection and molecular scaffold analysis can be done by clustering. Like you can cluster, making it somewhat fragments and matching. Then when you come to the dimension reduction, so making a large data into a small data which maintained with maintenance of the original information. So QSAR, already we know, like in machine learning we know, deep learning we know, like QSAR can be used. So here dimension reduction can be a AI inspired technique. Principal compound analysis, principal component analysis you can do. So you can make large thing into a small original information, and you can do the mapping chemical spaces. So these are some of the applications which can be useful through the AI inspiration. So now you see, like I'm close to the conclusion. Like, just please be please bear with me. I'm sorry for sincere apologies. Like, you see AI application, we have toxicity bioactivity. Very simple. You have a molecule, just from the data bank you are going to encode it based upon the descriptors, maybe be it Z0D or 1D or 2D, whatever suitable AI technique you will use, and it will be just using and giving the results like toxicity or their non-toxicity. Then likewise, bioactivity you can predict, physiochemical property you can do. Then here are some of the additional AI applications, or advanced AI applications. You see, de novo design, I already told, it is much more different from the conventional de novo designing. So conventional de novo designing, once again I repeat, it uses the knowledge, it requires the knowledge of ligand or the target. But here AI inspired de novo does not require anything. It advances the modern discovery. So just with a molecule, it can do, based upon the strong data, robust data, it can give a candidate drugs. Now here you see interesting target structure prediction. You have a target, only you don't know the template, you don't know the structure, you don't know the folds, only sequence is there. New development is there for a alpha fold. Alpha fold is one of the excellent AI technique, alpha fold. So with that you can predict the structure exactly. It is widely booming, and it is now in the drug discovery. Even the advancement updates are coming to the alpha fold techniques. Deep interaction, both are encoded, and leaving the job to the AI model. It will be giving like binary outcome, like 0, 1, presence, absence, like that it can be giving. Finally, you can have drug target binding affinity, like the same way it is the binding affinity. Once again, deep affinity model is there in AI, which can be utilizing this encoding and application of the AI technique. With this, you can see much more advanced, very advanced, very advanced techniques are available. Like AI in nanomedicine is there, AI in oligosaccharides, oligonucleotides research is there, even much more synergism. Yeah, this I didn't remember to tell. Synergism, deep synergy is there. So AI now started with models are developed for synergism antagonism effects also. So there are widespread applications, and the only challenge. Okay, once we are in the challenges, right? So current challenges, when you see what is the problem in current challenge, I'm not telling that this will be the future challenges. No, it is the current challenge. The first one is poor data quality. So already I told you that the strong good quality is going to work in giving the best results. But you see the quality is once again challenged here. So what is the suggestion is, like, academic institution and pharmaceutical industry should come together to find out the standards in data reporting, and to curate the data, manually curate the data, in order to overcome this current challenge of poor data quality. Because poor data quality once again will end up with failures and false promises. Then second thing, major current challenge is lack of interpretability. So very important challenge. What is this? AI outcome is, it's beyond the human capacity to understand or interpret. So what is the suggestion? What is the suggestion here is the just the AI model should be self-explanatory in order to understand the interpretation. Then finally, availability and accessibility of AI technique-based model. As I already told, no free tools existing now. Some are there which is in development, and more scope is there for near future for free open tool AI methods. Otherwise, it is commercially available, and believe me, already it entered into the industry. Industries are using this. So please be exploring this area, so that as a future scientist or young, you are young buddies, whatever, you can be easily molded. Now, as you cannot mold me anywhere, so you are now young budding pharmacist, you can be easily molded whatever shape you want. So self motivation is required, and whatever you just end up with some failures, please don't regret. Regretting is not at all going to help you. It is bad for the life. So whenever you get failures in your academics or research, don't get, just consider that as a stepping stone and move forward. I just
Thank you,
request
sir.
the
Yeah.
students to have a look on to this emerging technique and and be successful. So
Thanks a
I
lot, sir,
know
for your valuable,
thank you, sir.
such a
Sorry for
nice
the exercise.
presentation, sir. And the databases which you have shared are really very much informative for our students. And means I would request if you can give us that databases list afterwards also.
Yes,
So we
yes,
will
sir, with
definitely
pleasure.
share that to the students. And it was really informative and really so much associated with today's topic. Thanks a lot for sharing your valuable knowledge with us, sir. And
Pleasure is
now,
mine,
as
sir.
as Dr. Salam sir is there and Shika Patel ma'am is there, I request if they can allow us, because due to our timing slots, we have uh, two presentation of our students. If Salam sir will allow, 5 minutes presentations are there, sir. Just they, because they have to show their slides, and we can just for 5 minutes they will present, and we have to review them, because they are insisting that they want to show it to the honorable speakers also. So if you can allow 10 minutes, 5 minutes, two presentation will be there.
It's
Yeah.
fine. Thank you,
Thanks a
Professor
lot.
Dharmendra.
Yeah, yeah. So I'll request Shilpa Thakur ma'am, coordinator FPS, to complete that 2 or 3 remaining 5 minute presentation. Then we will ask Honorable Salam sir to present our valuable speech.
Namaste everyone. Myself JVN Shilpa Thakur, a coordinator, Faculty of Pharmaceutical Science, ICETPHT Women's University. I welcome all of you on this international conference. Uh, for I won't take further time. I'll start with the presentations. First, I would like to call upon 8th semester students group, that is Khushbu, Priyanka, and Radhika, for their presentation on related to the topic of biosensors.
These are the budding pharmacists. They also want to show their caliber to you, sir.
Namaste all. I am Javin Kumar from.
Yeah, students, I'll request you to sum up in 5 minutes, so that because we are lacking in the time. Yeah.
Okay, sir.
You
Namaste
share
all.
your main topic and then.
Okay, sir. Namaste all. I am Javin Kumar, pursuing in B.Pharm 8th semester, Faculty of Pharmaceutical Science.
I am Javelin Ratya Goel.
Myself, Priyanka Chaudhary. Today is my presentation on the topic of research on the development of the portable alcohol biosensor and pharmacotherapy. In this include introduction, history of biosensor, component of biosensor, application of biosensor, working of biosensor, and mobile biosensor for improving AD pharmacotherapy research, and conclusion and then reference. Firstly, we discuss about the introduction. In the introduction, we discuss biosensor. In this include two words, bio and sensor. Bio means biological system and sensor means sense, detect anything and give response. And biosensor include two words, biological system and physiological element. Biological system again divided in two parts, analyte and bioreceptor. These analyte bind with the bioreceptor and produce signal. These signals detect by the help of physiological element on the display, and then say these are those analytical devices which are used to change biological response into electrical signals. Then alcohol biosensor, a device used to determine blood alcohol concentration or to identify viruses or diseases from a brief sample is called an alcohol biosensor. Harmful alcohol use is a serious public health issue. The yearly economic cost of alcohol use is estimated to be 249 billion in the United States, where it is
You
causes.
come to your conclusion part, beta. What's your what you want to actually say with this?
The effectiveness and the reliability of the research on the development of new medication could be greatly enhanced by the mobile biosensor for alcohol consumption detection. Future studies should determine whether it is feasible and acceptable to use more recent years devices for medication testing, integrate alcohol use sensor with other mobile health monitoring devices, and create standardized protocols for using mobile biosensor in medication testing criticism.
Okay, so you want to say that mobile biosensor for alcohol consumption detection can be a new technology like that?
Okay, sir. In the clinical trial, we check the drug efficacy, safety, and dose. So it is necessary we check the alcohol consumption rate for the AIDS treatment. So it is necessary we use the mobile biosensor for the checking of the alcohol consumption rate. So it is directly used in the pharmacotherapy for AIDS.
Okay, very nice idea. So now I'll request, thank you students. I'll request next Shilpa ma'am to proceed for the next presentation.
Yes, thank you, sir.
Thank you,
Yes,
sir.
sir.
Thank you, beta.
Thank you, students, for the presentation. Next, I would like to invite Priyanka and Madhu for the presentation on the topic of food product and technology in nanotechnology.
Yes, beta.
Namaste, Honorable Chairperson Ma'am, Honorable Advisor Sir, CEO Sir, respected Registrar Ma'am, and all higher dignitaries and Dean and Directors, respected faculty members, and my dear trainees. IJVN Priyanka Sharma, IJVN Mathuyago, pursuing B Pharmacy 6 SEM from Faculty of Pharmaceutical Sciences, and we are going to represent our topic on food product and packaging nanotechnology. Now, what is nanotechnology? Nanotechnology is a branch of science and engineering which deals with the designing, producing, and structures by manipulating atoms and molecules at nanoscale. Packaging mainly involves the proper handling, proper maintenance, and stability of quality of food product. Mainly, the traditional food packaging involves the four basic functions, that is protection, isolation, accessibility, and communication. Nanoparticles can modify the physical and mechanical properties of packaging polymers
by improving their strength, durability, flexibility, barrier, and reusing properties. Now, what the classification of nanoparticles? Basically, they are divided into six parts. That is, carbon-based nanoparticles, which contain carbons, which existing as we know that carbon have high stability, good conductivity, low toxicity, and environment friendly. So they are used in
Okay,
bioscience.
so means you come to your main point that what actually you want to say. What's your idea?
The nanotechnology mainly used in the food packaging materials. It increases the shelf life, and hence the shelf life increases the stability. It also improves the biodegradability and bioavailability of any material. We can protect the food particles from the environment, from the prevention from the microorganism by using nanotechnology.
Okay, that's your idea. Like we can use nanotechnology in protection of food material like that.
Yes, protect.
Yeah.
It also improves texture of the food, and hence the taste, reduce the fat and unpleasant odor also.
Okay, okay, nice. So basically, we understood your idea, students. It's a nice idea, and you have prepared well also. I'll request the next Shilpa ma'am to proceed for the next. Thank
Thank
you,
you.
students.
Next, I would invite
Is there anyone left for from day borders after that?
two groups left. One
Okay,
will be
only you
presenting
want.
now and another one. Just two.
Yeah, you complete it fast in
Yeah,
five
yes.
minutes.
Yes. Next, I will invite Anuradha, Lakshmi, and Santosh, 6th semester students, to give a presentation related to the biosensors.
Namaste, Honorable Chairperson Ma'am, Honorable Advisor Sir, and all the higher dignitaries, and my dear JBNs. I JBN Anuradha Kumar. And I JBN Santosh Kumar.
I JVN Lakshmi Goswami.
From B Farm 6th semester from the Faculty of Pharmaceutical Sciences. Our conference topic is emerging trends in pharmacotherapy and health technology. And our title is recent advancement in biosensor as an overview. Then firstly we come on the introduction of biosensors. Biosensors are sensitive and fast devices in which bioelement interacts with the analyte being tested, and the transducer is converts the biological response into a chemical, optical and electrical signal. Biosensors are also known as immunosensors, resonant mirrors, biochips,
Your
chemical.
slides are not visible, beta. Yeah. Now you because we are lacking in the time, you can summarize the things in a short manner. Yes. The main things you want to say.
Is it visible now?
Yeah, it is visible. You can say the main things.
Firstly, introduction. Biosensors are sensitive and fast devices in which bioelement interacts with the analyte being tested, and the transducer is convert the biological response into a chemical, optical and electrical signals.
Yeah, we understood what are biosensors. So you come to main point like
Then we come on the elements of biosensors. First is analyte.
okay, okay. Yeah, these are the elements. So yeah, you want to highlight any main thing.
Then we come on the applications of biosensors.
Biosensors are used for testing purpose in the medical industries. Biosensors are used for environmental monitoring and water treatment, like tracing or detection of waste. Biosensors are used Biosensors are used to detect toxic metabolites in the monitoring of glucose in human body. Blood glucose type of biosensors used.
Then we come
Okay,
on
beta,
the
we understood. Yeah, future
biosensors.
scope you can say.
In the future, the biosensor techniques will explore the different choices to produce diagnostics, precision drugs, and instruments. There should be disruptive improvement in drawing samples from the human being, in accelerating the advancement of personalized medicine in the implantable biosensors may have a considerable effect. Further, to diagnose complex blood DNA mutations before any disease signs in the early stages of development, biosensor chips technology could be inserted into the body.
Yeah, I understood. Very nice, students. So you want to say like biosensor chips can be used by inserting in our body. This is a
Yes.
newer health technology which can be applied. Very nice idea. Now I'll move forward. I'll request Shilpa ma'am to end up with the last today's slot presentation. Then we will proceed with the invited honorable speakers. So
Yes,
the
sir.
next one. And then we will once again have the students' valuable presentation after sir and madam's presentation.
Yes, sir. So last presentation is by Khushi, Priyanka, and Nikita of 6th semester. They are going to present a topic on herbal drug development in respect to ethnopharmacology.
Okay. Students are not visible, yeah.
Yes.
They are now visible.
Namaste, Honorable Chairperson, Ma'am, Honorable Advisor, Sir, CEO, respected Registrar, Ma'am, all the higher authority, Dean and Director, Professor Dharmendra Ahuja, Sir, respected faculty member, and my dear JVN, I JVN Nikita Kumawat,
I JVN Priyanka Chaudhary. I JVN Khushi Jangir, pursuing B Pharmacy, Faculty of Pharmaceutical Science.
we all are here to present herbal drug development in respect to ethnopharmacology. Medicinal herbs as a potential source of remedial aids has attained an important role in health systems all over the world for both humans and animals. Medicinal herbs have been used in one form or another under native system of medicine like Ayurveda, Siddha, and Unani. There
Okay,
are
madam. You show the main slides which you want to highlight.
There are scope of herbal medicine like new leads, molecular biology, genetic engineering, modern herbal formulation, phytochemistry, and plant biology,
Okay,
biotechnology.
you want to say that now the herbal medicine can also be a new emerging trend. I got your point. You come to your conclusion section, then yeah.
The vital aim of ethnopharmacology should be to identify drugs to improve human illness using a thorough analysis of plants supposed to be useful in human culture all through the world.
Okay, so ethnopharmacology will be a new area for the work. You want to say anything more about this, beta?
In ethnopharmacology, we study about the ethnic drugs and the herbs used for the treatment of illness in both human and animals.
Okay. So you are saying that ethnopharmacology can be next emerging trend. Nice. Your presentation was nice. Now, thank you. Thank you for connecting with us.
Thank you so much.
You can disconnect. I'll request Shilpa ma'am to connect.
Yes.
And I'll request respected Dr. Abdul Salam Nazmi sir, who is at present a renowned pharmacologist nationally as well as internationally. Sir is the head acting HOD of Pharmacology, College of Pharmacy, National University of Science and Technology, Muscat, Oman. It's really a matter of proud for us. And thank you, sir, for giving us your valuable time. Actually, we have some our own college timings as well, and we have to manage accordingly. So we just took few students as per their requirement. And thanks a lot for coming here and associating with us for your valuable presentation. So over to respected Dr. Abdul Salam Nazmi sir. After that, we will have Harshika Patel ma'am. Ma'am is from Kenya. I'll be briefing about ma'am also. So I'll request Dr. Abdul Salam Nazmi sir to please bless us with your valuable words and followed by presentation. Yes. Sir.
Uh, Thank you so much, Professor Dharmendra.
Yes, sir.
I really enjoyed these lectures. First of all, thanks a lot for giving this opportunity to me. I'm from Delhi, India,
Yes.
from Jamia Hamdard, and I have been associated with the National University in Muscat for more than 15 years.
Okay,
And
sir.
when I have been hearing Dr. Ashish Wadhwa, Dr. Nurullah, and our really dedicated students, it kept ringing in my mind that we are almost going through all such kind of advancement, but the point is that what is lacking is with our traditional conventional Indian knowledge plethora, we have to club it with artificial intelligence, with biosensor, so that the output is really the way our ancestral physicians and those multi-speciality our legends they had given that assets to us. I would like to know how to uh, upload my PPT there. Present,
At present, we are unable to see it, sir.
present slides. Uh, your computer. Okay, I got it. Computer. Load file.
Now it's presenting, sir.
Fine, fine. Thank
Yes.
you. Thank you so much.
Yes, sir.
After the heavy lecture of Dr. Nurullah, that artificial intelligence, the database, all these recent new technologies involvement in the therapeutics and in medicines, somewhere we have to look back to go for our ancient knowledge and collaboration of this ancient knowledge with our future perspectives. So that is why, and I would really appreciate the way the speakers you have selected from
Thank you, sir.
artificial intelligence to the ancient pharmacotherapy. So my title is Ancient Indian Pharmacotherapy, the role, the people who have contributed, and its role in current therapy of actually like chronic diseases. I had been quite specific in selecting the diabetes mellitus. The contents includes historical background of our ancient pharmacotherapy, early iron periods, Vedic origin, Ayurveda and its clinical branches, Ayurveda principles, and then the role of Ayurveda principles in the management of diabetes mellitus. Early main medical centers, they had been as per the four old civilizations, and wherever these civilizations were, they really started coming out with components which are either plants or the clays or the soils in order to cure, in order to mitigate, in order to decrease whatever the complications and the complaints the people had in that time. Later on, Greece, they started advancing with more better data component like what we have been seeing with a lot of our previous lectures. Established schools information, Nalanda University, and later on Italy and other countries, they started whatever knowledge has been transferred from their ancient people to the younger people. India, early Iron Age, the Vedic Age, which has been between 1500 BC to 600 BC, and very nice sacred holy scriptures, because that time people They were multi-directional. They were blessed with spiritual knowledge. So they gathered the information for all the aspects and they started writing. So these are the oldest available written material, and which are there is a need to keep on exploring them further. Some the most important ones are the Rig Veda, Yajurveda, Samaveda, and Atharveda. And these Atharveda later on, that knowledge is started into further in Charaka and Shustra. Ayurveda, the tradition goes as far as 5000 BC. And while in other countries like Babylonia or the China, they have only 2000 to 3000 data. While in Ayurveda, the data is available in terms of plants, their different kind of components, and different kind of the diseases and their sign and symptoms, and how these preparations have to be molded into the formulations and their usage. The first recorded such a long monograph with diseases and these plants and their different parts has gone back to almost 4500 BC. Initially, all these information, they were compiled, progressed, and recorded by our spiritual leaders, sages. Later on, people from the different aspects of the science, they started coming up and they leave it. So what Ayurveda actually means, the life, Veda means knowledge. So for most important things in the available sciences is the human beings. What good we can provide for the human beings. So a system of medical information that resulted in into two aspects: the nutrition as well as available plants, herbs, or clays, or some other materials for their important aspects. Shastra Karma, that is art of surgery. Charka, Charak, it was Charak Samhita, it was again a compendium of different kind of aspects involved in or utilized in or to be practiced in for the welfare of the human beings to keep the best health. This Shastra, Karma, art of surgery, it again fascinates when we go back and we study what kind of different tools, what kind of different procedures, how they have been having that knowledge, which is could be considered in today's scenario really a big miracle that these people they had. But unfortunately, that information was not carried or progressed forward. That is why we started lacking in these traditional conventional aspects, and other people they progressed and we started adopting their intelligence. So there are different procedures for that. I will not go into that detail. Ayurveda principles, a combination of elements and nature. And the same combination has been later on when I was searching through that in the Greek methodology, or whether it is Aristotle, Hippocrates, Socrates, they all are having different, but it all has, it seems like it has been originated from the older testaments. Pancha Mahabhuta, Vayu, Jal, Akash, Prithvi, Teja, air, water, space, earth, all these combinations at that time, how beautifully these people they derived that correlation and they started using in the welfare of the human beings. There are three basic principles: tridoshas, Vita, Pitta, and Kapha. We are not going to that detail right now, but these are very important aspects from which we can further design and different kind of studies. With the eight clinical branches like medicine, like surgery, ENT, ophthalmology, quite fascinating. They had given their contribution in all the field: pediatrics, obstetrics, toxicology. Toxicology was such a vast, developed field at that time that they had the observation, the clinical trials of the people of the study. What we are seeing nowadays, sorry, nowadays the clinical trials, those people they had studied the people when they came to and they had documented. then psychiatry, then rasayan, regenerating, and sexology, which includes in terms of progeny as well as the better health in terms of reproduction. Ayurveda, now I try to convince and correlate our traditional and conventional medicine with the current scenario. There are large number of 10 most important non-communicable diseases. Among them, again, only 4 diseases: heart diseases, cancer, chronic respiratory diseases, diabetes. More than 40, 50 million people are dying because of these major components. Almost 7 out of 10 deaths, they are involved because of these ailments. These are most important ailments. If Ayurveda is employed, the knowledge to have their input in these important diseases in a systematic way, it will really invite our young generation to these our traditional medicine. Of course, it requires a little more financial inputs. Clinical trials are required. A lot of medicinal plants, their part which are used, are available. The only thing is that we have to study them in a systematic way in order to progress further. 5 main principles in terms of diabetes management. Of course, the diet, exercise, lifestyle modification, these are very important aspect. And it is not that these are always counseled by the doctor, by the pharmacist, by the nurses to the patient, but these are all available in our old traditional testaments. Panchkarma, a particular component to detoxify the body, to detoxify our psychiatry, our stress management. So these things, when we have to use, we use them in a systematic way, it will definitely lead to the establishment of our traditional plethora. Herbal preparation, there are large number of herbal products available which are to be screened further and then employed in terms of with using different technologies. Then yoga, our old traditional, and it has I have been in touch with many our patients here in the university. They are continuously employed these techniques, practicing these techniques, and they are really benefited. So far they are not saying that they are decreasing the doses of, but it is a better management. HbA1c is in what the normal limit. Breathing exercises, different kind of breathing exercise. So these 5 aspects, if they are focused in our traditional system, in our traditional clinics, and we do at the same time some particular clinical trials with good data and with good follow up, we can come out with really a good research. Diet and diabetes, I'm not going into this detail. A big information is available. We are lacking already time. Exercises, really very very important. Exercise, what kind of it is nowadays, with advancement of all these technologies, we are becoming too much lazy, sedentary our life. That is why this is inviting further a lot of these chronic diseases. 30 minutes exercise, especially most important, brisk walking is very very important, and it is highly relaxing in terms of cardiovascular aspects as well. Lifestyle modification, smoking, we have to plan our meal, what we are eating. It is not like going for junk food. What food has been mentioned in our traditional actually the original food, organic food, not going for these all junk food or packaged food. Then we have to take different kind of meditations. We have to take uh, different kind of stress busting components, and of course the spiritual follow up. It will definitely lead to a very good control of Panchkarma. It is really a very nice process. I have been here in touch with people who are continuously, regularly attending the Ayurveda clinic, and they are really, I have not gone to, but they are telling. So from this perspective, we have been planning to have some particular clinical drug trials with that combination of traditional medicines and these techniques which they are undergoing there, to have their effect on the biochemical parameters of these markers of diabetes. Of course, it will involve the expenditure, the money, but it is in pipeline, and soon we may really materialize that. So there are three processes for this: panchkarma, purva karma, pradhan karma, and paschat karma. When we say Purva Karma, it has some processes. Pachan Karma, this our digestive system. It is actually the mother of more than 90% of our complications. So if we start targeting our digestive system, which is lacking in the lacking in the modern technology, they are always just going telling that you go for light food, but we have to go as per the requirement. So when we improve the digestion with herbs and a lot of different, when we have to take the food, what kind of food, and different particular plan, fasting is a part of that also. It will really help in liquefy the fat soluble toxins in the body. Then Sneham Karma, where we are providing a particular, earlier also we are giving the ghee, here medication ghee, in order to increasing doses to aggravate the further liquefaction of the fat soluble contents and their removal from the deeper seated tissues from the body. Then Swedan Karma, a full body bath and massage that will further relieve from the toxins. The second component which is followed are that of Vamanam, then like Virechanam, then and Vasana Nasayam. These all principles are really involved in all the traditional systems wherever they are. In Greek systems also, and in our different kind of Asian systems also. So this therapeutic emesis, vomiting, it clears our GIT, it clears the toxins from the body. Once the GIT is there, then cleaned, other contents from the deeper tissues, they start coming. There are different, one physician from the Iran, his name is Avicenna. He has written one beautiful lines which means that we should go for vomiting once a month. It will help us in keeping our body health in a particular shape. Then purgation, the same way he has suggested that once in a week we should have this purgation, whether it is induced purgation or it is the natural one. We should not rush to the medication, to the doctors. Nowadays, a little diarrhea, something, people start running to the physician, and physicians also, they are so prompt in starting the medication. So these natural procedures, when they are induced by medication, they are really helping a lot. Then enema. Regarding enema, there is a very nice story that Aristotle, once he was walking at the beach road, beach sea, and he saw a swan coming, and he was not able to fly nicely or properly. He was getting it difficult. When he came down, he started taking the sea water by his beak and started putting into his anus. And after doing this many times, that swan has wonderful diarrhea. So the idea came to his mind that I will apply this technique to my people who are having very severe constipation. And when he used it, it was really highly effective. So even nowadays, people, they have started using those techniques to cleanse the body system. So oil enema, it will help in removing lipid soluble toxins and other components. The nasyam, the nasal inhalation, in older system is still now in especially in the Gulf countries, they are very widely using all these different kinds of bukhur or the air purifier components. Then the paschat karma, after going to the third stage, sansarjam karma. Now, after detoxification, what food, which food, how they have to increase, and how long they have to keep on going into that. So the whole plan in is available. Then Rasayan Adil Pragam, a rejuvenating therapy. After starting the good natural food, we start going to improve the immunity, enhancing the general well-being, and then at the end, pacification that is involved with the patients. Herbs, there are plenty of herbs available. A lot of research work is going on, but there is a need to study them systematic way, and we have to use them in a different combinations, and we have to find out standardized quality control measures, and we have to study these medications in the line of the modern clinical trials in the patients. So if all such plan activities are carried out, a lot of these medications we will come to know that they are working better than our common general medications. Then different kind of preparations are available, Vasanta, Chandra Bhavati, etc. But we are not going into that detail. A lot of preparations are available in the market. Yoga techniques, different kinds of yoga techniques are available. So we have to use a combination of diet, exercise, panchkarma. We have to use different kind of medications, traditional conventional medications, and at the same time with the help of yoga and exercises. Breathing exercises, nadi shodhan pranayam. There are a lot of components in breathing exercises. A lot of clinical research is going on, so we have to have a plan. We have to plan such studies in such a way that establish the data for these things. And all of these things, these are not just concised or confined to diabetes. These will remove in the ailments in all of these chronic problems. At the end, I would like to say that we need to employ our old legacy thoroughly, and we have to collaborate in the modern GCP, good clinical practices, to have the data. What to do to make it still useful? Proper guidance for the public, proper research based data for the national, international collaborators, for the drug regulatory agencies, to establish good quality control so that these products, they really flourish, and they will not have the end of the user effect. After 5 years or 10 years, we are bringing one component and then we are ending up having the other complications. A bucket full of patients. Now this is the biggest problem with our pharma patients. They want the medication just like a bullet. And in our traditional, especially whether Ayurveda or other traditional things, we must have the patience. But once it starts working, really it is the long lasting, everlasting. And we need a good follow up throughout our clinical studies. So there is a need to focus, to design studies involving our traditional information for loss of these non-communicable diseases in the way the clinical trials, the modern clinical trials are going on. That will really help in establishing our traditional value. Thank you so much for patience listening. Professor Dharmendra.
Yes, sir. Yes, sir.
Yes, thank you so much, sir.
Yeah, there was some connection issue. Thanks a lot, sir. Thank you for your valuable session, and it's a really motivating for our students what you have shared with them. All female budding pharmacists will really get enriched with the information, and really we can extend a lot of thanks to you for connecting with us and blessing us. Now I'll request thanks a lot, sir. Now I'll request Harshika Patel ma'am. She is from Faculty of Pharmacy, Kenya Methodist University. So Harshika Patel ma'am, if you can, are you hearing me? Yeah.
Yes, yes, I am here. Yes,
Namaste.
how are you? Namaste.
Yeah, fine, fine. So, ma'am is
Yes.
connecting from Kenya to us, and ma'am, from morning, approx 6-7 countries members have connected, and tomorrow also more than 6-7 countries the members will be connected. So,
No, I.
we have tried to make it really brainstorming and really uh, to a next level conference so that real exchange of knowledge can take place. So thanks a lot for joining with us. And now I'll request you to please bless with your valuable words and then please proceed with your presentation, ma'am. Yeah.
Okay. First of all, thank you to invite me as a. Okay, I don't know how to say thanks, but actually it's really great pleasure to hear. First of all, now you see we are hearing different corner of pharmacy. We hear the industrial pharmacy, then okay, the god artificial intelligence, and the Ayurveda, of course, we should not forget. And from his presentation, I really enjoying that presentation actually, the Ayurveda's one, because nowadays even I am also inspiring from that, like meditations, yoga, breathing exercise, and also the legacy, the word he has used. We should not forget that we are a pharmacist. Our roots are there in the Ayurveda. So maybe whatever the scriptures are there, maybe we can use, we have to use that knowledge in the advancement, right? Yes, so let me introduce myself first. uh, my name is Harshika Patel. I'm here teaching pharmacology in pharmacy, medicine, nursing student. Okay, right now I'm not a registered pharmacist here, but in India I'm a registered pharmacist, and I'm teaching in around 5 years. Yes, and I'm here only in Kenya Methodist University in Kenya. So it's a great pleasure. And now let me talk about the Kenya, how we are working here. So here we do not have many industries. And if we go to the any pharmacy, we can highly see the drug which is available is from it's produced in India, and they are bringing here, right, to sell. So each and medicine you can see the manufacturer company is from India, India, India. So now these companies rely on other countries. So it's very, so we are focusing
Ma'am,
mainly on the
your voice
clinical.
is little bit less audible to us. If you can
Oh,
little bit
sorry.
improve.
Is it okay now? I think.
It's little better. Yes, ma'am.
Okay, so maybe we are more focusing on the clinical area compared to the industrial area because we do not have any resources. And also the transport where we are living. Okay, the main campus of KEMU, this Kenya Methodist University, is very far from Nairobi. So you see the major industries are located there, so people cannot move all the time. So that is also a disadvantage. So what I'm doing right now, apart from
Sorry to
teaching.
interrupt you, ma'am. What is the time at present there?
Okay, it is 1:38. It's not, it's just we are behind 2.5 hour from
Okay,
India.
okay. 1:38
Yes,
a.m. or p.m. there?
PM. So we
Okay,
are okay.
p.m. That's
Yes.
why I was, because it is also matter of interest. It's an interesting fact that everyone is managing the time to connect in this time schedule, ma'am.
Yeah, it's true, by
Yes,
the
yes.
way. But
Thanks a
it's
lot.
okay.
Yes.
If you are getting something, then it's okay
You should,
to
yeah.
adjust. Yes. So apart from teaching, I am very much interested in pharmacovigilance. Like we are always checking the prescription pattern, which we can do easily. So we are always doing that kind of research. So when you are doing this, like what kind of prescriptions are going on for particular disease, especially the chronic conditions and adherence, and what kind of factors are influencing on that treatment. So as your theme is also regarding to the pharmacotherapy, so initially I was afraid that what I can speak in formulations, but again I see, okay, you have also pharmacotherapy, then I can speak, right?
Yes.
Like formulations are there, but how to apply that one and how people are using, how the end product is, what you can say, used by the normal people. So here the the nowadays in India I can see the loose drugs, the tablets are almost gone. We are not using much because of this hygiene purpose. But here still people are using that, and we have to teach them how to even dispense that by using spatula or without touching them. So the small pharmacies, they are using this over-the-counter product in very inappropriately when the temperature is not appropriate for certain product. So yes, those are the things we can here we are doing. We are awareing the people, and also here you can see these ethnobotanical plants are many. People don't know the use. Even they don't know the ginger use for the cough. So we have to tell them each and every time. So those are the normal things which we are doing here. But I have also heard your participants, the young generation, and the ideas were so good, right? And I'm just giving my good luck to them. So can I present my topic? It's on the
Yes, yes,
recent.
please, please.
Yeah, so I have to share the slide or screen.
Yeah, you can share, ma'am. If you have any issue, our technical team will help you.
Okay. I have shared already. Okay, it's showing there is a issue in presenting the slide. Let me share the screen. Okay, is it visible? Hello. Hello.
Hello.
Yes, sir. Is it visible and am I audible?
Yes, ma'am. Yes.
Okay, so can I start my presentation?
Yes, yes, ma'am. You can start, please. There was
Okay,
some connection.
okay. Okay, no problem, ma'am. Yes, so it is about the recent advancement in formulation development. And now, as Dr. Salim sir has mentioned about the ethnobotanical thing or Ayurveda things. Now I am teaching medicine student, and one of the topic was the novel drug delivery system. So when I was searching the information about the recent advancement in formulation, it is nothing different, right? There is no difference between these new formulations. Now we do not have any new products, but yes, what we can do for the better compliance to reduce toxicity, we have a new formulations for the same drug. So this formulation is basically it's a chemical compound where we are mixing the active ingredient with the excipients which are non-active in nature and make a very suitable product that patient can easily consume. Right. So the aim of this product formulation is to provide a therapeutic amount of a drug for at the appropriate site, which is a very target delivery by using this formulation in the body to accomplish the promptly and then maintain the desired drug concentration at the site of action with a very minimal side effects. So, okay, it also provides a target delivery system with very less systemic effect. So, if the drug causing so many effect or high amount of systemic toxicity, maybe we can use or we have to formulate in a way that it shows the less toxicity. We will discuss so many examples later in this slide. So, what is the need to develop the novel formulations? And here we have some characteristic, right? Why we need this kind of evolution. So dosing by using the novel formulations, maybe you can decrease the frequencies of the drug or the dosage. And by doing that, we also think about the bioavailability supposed to be not affected or supposed to be improved, right? With the compared to the typical formulation. Then the new formulations if the typical one cause high amount of toxicity, the newer one or advanced technology is showing the less systemic or less side effects, improve the target delivery, what we have just discussed of the active compound in the formulations, improve the stability of active compound and control the release of potent drug. So when you are using, when we are saying the tablet is there, then we also have a release or the control release tablet, or let's say some enteric-coated tablet is there. What is the difference? So yes, definitely enteric-coated have a main good advantages over these typical tablet formulations, right, for particular drug. So to get a several factor to get that new formulation, we have to consider so many other factors like the physical, chemical, and mechanical properties of the cut drug substance, right? It's supposed to be not changed or improved or is not affected by the bodies. So what happened if these factors are affected, maybe it's damage the tissues in the human body and cause problem again. Polymorphism, solubility, pH, and particle size of the drug, which again improve the drug delivery in the human body. Then inactive ingredients or excipient in the formulations, that plays a very major role. And nowadays we are focusing mainly this excipient, how to improve the property, how to improve the drug delivery. So drug is there, it's a generic drug, potency we know. But as even the Dr. Nurullah said, the efficacy we are running behind efficacy, but nobody think about other toxicities. So let's say paclitaxel is there, which is a very good anti-cancer drug, but when we are mixing with a camphor cremophore solution, when we are diluting, it shows high amount of hypersensitivity. And we have a very good novel formulations of paclitaxels is PET paclitaxels or NEP paclitaxels. That one is formulated in a way that the paclitaxels is not cause any kind of hypersensitivity. That reactions are there because of the cremophore solutions, right? So excipients are again is very major component in the formulations of the drug. So drug stability study for better shelf life of the drug. So that is very common, and as we are all the faculties of the pharmaceutical branches, so we know the stability testings are very, very important. And the terminology is there, the shelf life of drug. So if the shelf life is disturbed, maybe the effect, the quality also is disturbed and shows the major toxicities in the human body. Now the patient factors. So this 1, 2, 3, 4, the first 4 factors, if we are not maintaining, then yes, it will cause problem in patient, right? So we have to think about that. Plus, we have to think that drug is metabolized and excreted from the body by using major organ, liver and kidney. Also, the cardiovascular problem nowadays is higher in amount. So those factors, when you are formulating, we have to think, and we can formulate in a way that who have even these conditions, still we can use, right? Okay, so these are the basic formulations which we all knows, like enteral formulation, parenteral and topical. And here is the example: tablet, capsule, liquid, lyophilized material for the parenteral, cream, powder, ointment for the topical. Now, those are the things which is formulated and it is there in the market, right? People knows what kind of materials or the drugs it is, how to use it, right? What kind of disadvantages are there. But the novel drugs, they have even additional importance or characteristic, and they have a different formulation actually. So here, what kind of benefit we can get by changing the formulation. So maybe let's say in a medicine field or in medical field in clinical area, the optimal dose maybe we can acquire at the right time and at the right target. In industrial people, they also get benefit as the artificial intelligence we have just discussed. So you see, before we are doing a lot of laboratory work to just get an active compound, and then we are doing a lot of tests to check the activity, right, to get that efficacy. Nowadays, by the help of this AI, maybe you can summarize your things, everything in one lab computer by sitting in a one corner of your home or maybe in your office. And think about in typical formulations, you have to do everything and it increase the industrial in the formulation cost, right? So it's efficient use of expensive ingredient, reduction in the production cost, that is the main benefits of the industrial area by creating a new formulations or to do advancement, right? Then in a social, like when at the end, who is using this? So it's beneficial to patient, better therapy, improved compliance, and standard of living is automatically improved once we have a good product in the market, right? So now excipient, we should not forget this one, as I have mentioned and give the example of the paclitaxel. So have a vital role to improve the pharmacological parameter of pharmaceutical active ingredients. So that's improve the patient compliance automatically. Now think about, before we have a paracetamol tablet, now we have a paracetamol granules in one sachet, like a Eno. You just mix in a water and drink, and it is available with an orange flavor. So nobody realized that they are drinking actually paracetamol, right? Think about this. We have a mosquito repellent. It was only cream or lotion before. Nowadays, it is available in so many formulations. I have seen even this time in India, they have a sticker for the small kids, and you have to stick on the cloth. Now, when you are roaming, when the kid is going around, the mosquito repellent do the work, and it is harmless, right? So it's advancement in that area. Okay, so excipient. So the history indicates its importance well. Minor exchange in this excipient cause great disaster. So there are so many events are there. I don't want to discuss because of time limit, but it is there. Now here is the various formulations available, right, in the market other than the typical one. So if you are saying tablet, we have a modified release formulation, which gives a sustained and controlled effect, right, in the body. So we have so many polymers, micelles, liposomes, ethosomes, and also nanoparticles. They are playing vital role to formulate the modified release formulation or the tablet or capsules. Other than these, prodrugs, transdermal drug delivery system, OcuSite, insulin jet, micropump, or you can say the controlled delivery system is there. Then the patient-controlled analgesia pump, drug-eluting stunt, gene therapy, and personalized medicines. Those are the different formulations nowadays we have, except these last two, right? Okay, last one. It is a different scenario to treat patient or to give a different kind of pharmacotherapy. So now this one is, maybe if you know everything, you think, okay, what is new in this one? Everything is same what we are learning in the school, right? But you see, even the prodrug, maybe there is some parent drug or the active compound is there, but what is the need to formulate prodrug? So something is in this product, maybe something is good seen a characteristic compared to the parent drug. So as Dr. Nurullah said, that we have to look other than the efficacy, other scenario. Just forget about efficacy. Efficacy you will get, but other things. So it will maybe the degradation by gastric juice, maybe the absorption is very less. So to improve those kind of parameters, we have to look something else. And prodrug is a good example of that. One of the good example, right? We have many more. Now, here is a list of the novel drug delivery system. How you can formulate by using different carriers. So we have a nanosomes, liposomes, neosomes, nanoparticles, nanosphere, microsphere, microparticle, hydroemulsions, then nanosuspension and micelles. So those are the drug carrier where our drug, they are formulated in a way they can stuck inside these particles or the carriers. Right, these molecules are really magical and it's booming nowadays, especially the nanotechnologies, and we all know, we are not unaware, right? So here is there. So novel polymers are biodegradables and biocompatible. So my point was, like, if modified release tablet is there, what is the new thing? So yes, before the polymers, maybe they are not biodegradable or biocompatible. Nowadays, the advancement done in a way that we have a biodegradable product which has a very less side effects once you are consuming, right? Here is the structure of these particles. Now, a small introduction, or what is the benefits of the nanotechnology based formulation. So it's using, we are using nanotechnology. The drug can be targeted to precise location. So target delivery is there, which would make the drug much more effective and reduce chances of possible side effects. That is very common, right? Then more specific drug targeting and delivery, and also we have a reduction in toxicity while maintaining the therapeutic dose, the bioavailability. Now the nanocarriers are there, and we have discussed it before, right? I have some pictures here, like a carbon nanotubules. One of the students, she just presented, right, the carbon molecules, nanoparticles. So yes, it is there in the market. You can see the carbon formulations like used in the treatment of bronchial asthma. And for that, we have a carbon nanotubules. It is there already. Then we have a gold nanoparticles. You can see here the structure and also it is where the drug is bound, right? So cancer chemotherapy is taking this advantage by they are causing this gold nanoparticle form a free radicals generation and shows the cytotoxicity, right? Okay. Now here some more example is called the nanoerythrosome. They are targeting the erythrocyte, RBCs, and use in such particular disease treatment. So nanoerythrosomes are resealed erythrocytes that can carry protein, enzymes, and macromolecules. They are used in the treatment of liver tumor, parasitic disease, and enzyme disease. So they are now the RBCs are targeted and it's become even the drug delivery molecules, right? So many novel formulations with old generic drug with increase the drug effectiveness. So you see the generic drug, the parent drug is the same. The drug is same what we are learning from the beginning. But what is the new thing here is just we are formulating in a different way, right? Okay, so we start with a brief introduction of each formulations, like what is modified release drug formulation and sustain and controlled manner. So let's say talk about first the oral formulation, where we have a one major risk of the typical formulations, like high risk of compliance. Think about the HIV, cancer, diabetes, hypertension patient. They each and every day they are taking pills, and that pills burden maybe affect the pharmacotherapy and decrease the compliance, right? So to modify that formulations, we have a different agent. They shows the sustained and controlled release effect in the body. Maybe it's prolonged than the typical one. So enteric and reverse enteric coated tablet, which delayed the release via pH of the body, right? Then we have also sustained release tablet where we are using matrices, osmotic inserts, right? If maybe you have heard about the OcuSerts or some implants. Now we have a pulsatile release tablet or formulations where we are using beads, mini tablets, and very good example is ODMT, which is oral disintegrated mini tablets or oral disintegrated tablet for the elder one. Mini tablet is our newer formulations. Okay, now this is the type of modified release formulations. So they are using different matrices with a different molecule, and they trap the drug inside these matrices and then apply for the formulation for the treatment, right? So matrices diffusion types, like we have a rigid matrix diffusion, swallowable, which we can swallow. Then reservoir, they work as a reservoir of the drug. Then we have a dissolution matrix type, where we can dissolute by using some kind of what you can say is like you can say amorphous or the crystalline form, right? Dissolution and diffusion control release system. Then we have a penetration and osmotic pressure controlled formulations. We also have a chemically controlled novel drug delivery system, hydrogels, ion exchange resin, control release system. Now here in this ion exchange resin, if you see what is the difference, so now they are adding more and more amounts of resin. So what we have before, yes, it is still there, but they are adding more and more, which are more good, or which are compared to those typical, they have a good characteristic, right, in formulations. So what is sustained release formulation, especially when you are using what happened in ocular system or ocular um, pathology and how they are treating it. So how the pharmacotherapy is really affected by these sustained release new formulations. So in glaucoma, sustained release modality is Allergan's bimatoprost. What is that? In glaucoma, when the people are because the intraocular pressure is so high, so there is a bimatoprost sustained release implants are available, and that is more safe and efficacious, right? And it is under phase 3 clinical trial, but okay, very soon maybe we can see this drug in the market. Then we have a DexiQ, which is a formulations of the dexamethasone intraocular suspension, 9% post cataract inflammation, which is treated by these formulations. We have UTIC, and this is the formulation of fluocinolone acetonide intravitreal implant. So now implant is a different formulations than the normal eye drop or suspension with 0.18 milligram. The non-infectious postural uveic, which is treated by these newer formulations. Dextenza, which is a formulation of dexamethasone ophthalmic insert with 0.4 milligram concentration, and it is widely used in ocular pain following after the surgery, right? Okay, so those are the newer thing, or it is widely used. You can see the OcuCert is also one of them, right? And I have a picture of OcuCert. Actually, I'm teaching a medicine student, and I'm using this picture all the time. So how it is kind of you can put a lens, but put a lens we are using our pupil, right? Here you can see, and it's not visible. So, in a sustained manner and in a controlled manner, the drug is released constantly around the area. So, there is no need for the eye drop each and every time or 2-3 times per day. You insert 1 or 2 times, especially this suspension, and implant is just put there and forget about it. After some time, it gives a sustained release manner, right? So, up to 1 month or 3 months, you need to change it. Otherwise, it's giving good effect. Now the oral formulation, so I have a list of, maybe we all know how they are working, but what is the newer thing or what is the advanced thing in this area is they are formulated with a different polymers or micelles, right? So the carrier molecules or the excipients are different to carry our drug from outside to inside of or at the site of action. So we have immediate release tablet and capsules, modified release tablet and capsules, orally disintegrated tablets. Now the mini tablets are also available for the children or pediatric population. For even 6 months can use this tablet, right? And the old people who have a problem to swallow the drug. So in that two populations, we can use these mini tablets. So two properties were combined, ODT and small size tablet, where you can see the size is 2 to 4 millimeter. We also have a buccal and sublingual tablet that we all know. We are using the nitroglyceride through this route, right? And some hormonal agent. Oral thin films also are used in the practice, but there is some prediction that they are not real drugs, right? They are putting some films in the mouth and use it as a drug. Oral liquids, that is very common, right? Okay. And also some other drug, sorry, like a spray, lozenges, gum, granules, effervescent tablet. So as I have mentioned, the effervescent or granule, like the dispersible tablet of the aspirin or the paracetamol in a granule form. So different activities there. Okay. So here is the example of the prodrug. What is the difference in prodrug and the drug? So prodrug needs a bioactivation by the liver microsomal enzyme system, specifically CYP450, or some enzymatic degradation may convert our drug into the active compound and shows the biological effect. Now the parenteral formulations, the key consideration when you are formulating drug or when you are doing some advancement, the sterilization problem by different foreign particles or microbes, right? The stability is another problem with the parenteral formulations. So the chemical, physical, or extractable or leachable, they change the stability. And when you are saying the stability is changed, maybe the quality or efficacy is also disturbed. Isotonicity, pH, volume of administered of the product, which can damage the cells and cause pain at the site of infection. So make sure you will not you have to maintain this space before you are applying in the practice. Viscosity of the formulations. Okay, why have we have to think about this? Because of we are using syringes, needles, right? So viscosity is again important consideration. Now, route of administration. So we are using the normal conventional route of administration, which is IV, IM, subcutaneous, right? So in IV, we are using injection or infusion, where also we can use, other than solutions, lyophilized powder for the reconstitution. Nothing new. What is new is maybe the different formulation, how we can give other than the injections, right? Which we can, I will show you later with a picture. Then intramuscular, where you can see the effect is rapid or sustained release manner, uh, drug delivery is there. Then the depot preparations are available for this drug. So you can give a drug, it will stay there for a long time, and it's improve actually the patient compliance, right? Subcutaneous injection for antibody and diabetic therapy, diabetes therapy. So we can, by using this one, the advancement in this area is that insulin is the drug which we do not have any oral formulations, right? So by using the parenteral formulations, by using the novel or advanced formulations, the self-medication is possible. So the patient should not go each and every looking for each and every time. They should not, they do not have to look for a physician, right? So the best advantage is the self-medications. Pre-filled syringes are available, especially in life-threatening conditions. So we know the good example is epinephrine, right? In anaphylactic shock. Insulin pump, auto-injector, pen injector are the examples of the formulation. So you see here, it looks so good because it's not a typical injection. It's not a scary, right? Especially the pediatrics or who is taking each and every day, like cancer chemotherapy. You know, the main advantage is the extravasation. The people in diabetes who is taking injection each and every time in subcutaneous region, what happened? Maybe it shows the skin reactions. So to avoid that one, those preparations are really helpful. This bolus injector, we can use even the enzyme or other antibodies, right? Okay, now this one is old formulations, but again, I want to present this one in this platform. You know, the cancer is raised, the number of cancer patient, right? And people are using in higher amount, right? It's called the patient controlled analgesia pump. The patient can control the release of analgesic drug depending on the pain. So we can adjust. So why we are using this kind of pump? However, we are using the patient IV line, right? Still the injection is there, but by using this modality, maybe you can get the sustained and controlled release of the drug. So the fluctuation of the plasma concentration of a drug will be not, it's not there, right? Then where we are using this instrument is in a post-operative pain management, right? And also in the end stage cancer patient where the pain is unbearable, right? The infusion is programmable by the prescriber. The physician is the one who adjusts this pump in patient, and the first response is always observed because it shows the allergic condition. So if everything is okay, then we can just leave. Like, it's so handy actually. It's look like even the scribe where we are scribing what scribe our debit and credit card, right? So this is the example of this patient control analgesia pump, a patient, and it has, maybe we can use fentanyl, morphine, right, bupivacaine. You can see here. Now the nasal formulations and advancement. So can be systemic or local, like required potent drug where effect is very rapid. Local irritation is very common because you are applying locally, right? So local area will get affected first. And the formulation in this system, which we have a solution and suspension, like a nasal spray, dry powder, also peptide delivery, especially the nanoparticles. And I think we have discussed in bronchial asthma, right? Then inhalers are there. Inhalers are very typical formulations, but still it has a good compatibility, right? Or the compliance. Now, this is also one of the very typical formulations, transdermal drug delivery system, where you can see here in this formulations where the drug is entrapped in this system, right? Transdermal patches, and it's released in a slow manner by this orifice in the vestibular region if you are using the scopolamine or the hydrogel for the in the treatment of the burn. So many other drugs are also formulated such kind of preparations. So then you can see that we can get the sustained release effect. So scopolamine, nitroglycerin, nicotine, fentanyls are available. And what are the benefits? So it's avoid the risk of inconvenience associated with parenteral oral route. So scopolamine is a anticholinergic drug, and you can see when you are using this, the selectivity is problem. So you can get so many other systemic effects. So this one causes very local effect. Increase the bioavailability by bypassing the hepatic first pass metabolism, that is all we all know. Bypass the various variation in absorption and metabolism. Continuous drug administration is possible. Reduce the chances of over and underdosing. This is the novel system again, or it is not novel, but it's constantly upgrading, right? From the in these formulations, they are changing the material, or you can say the carrier molecules. So drug-eluting stent, also known as the DES. So the stent can be coated with a drug embedded in a surface polymer. You can see it is available in 3 different generations, where you can see the first generation DES. It is known as a stainless steel scaffolding, or the scaffold is also one of the parameter or the characteristic. And various formulations are available, which we have a paclitaxel eluting coronary stent system, which release paclitaxels or sirolimus in a coronary artery. It's mentioned here at the last point. So in a peripheral tissue or in the peripheral vascular system or coronary arteries. And what is the role of paclitaxel? It has they reduce the epidermal growth, right? So the growth factor is suppressed. Sirolimus is immunosuppressive drug and also have this growth factor inhibiting effect. So by using this stunt, maybe you are decreasing the blocking effect in these arteries and reduce the chances of the stroke, right? Second generation, which is formulated by using cobalt chromium, right? And different polymers are used here. The third generation of DES with biodegradable polymer or entirely bioabsorbable scaffold. So you see each and every time something is improved, right? And it really improve the end effect on patient. Now, this is the gene therapy or the genetic transfer system. What they are doing, if you let's say example, the clinical trials are going on in adenovirus or HIV virus. They are removing the virogenic gene from the virus, and they are trying to insert in the body, right? So what happened? The virulistic effect is almost nullified by using this gene therapy. Sometimes there is another modality, insertion of the therapeutic gene in the body, right? So the adenovirus or HIV, they are under trial for the gene therapy. They are inserting the therapeutic gene in the body, and they are trying to modify the genetic transcription, right, of in this virus. Okay, now this personalized medications. Okay, what is personalized medication? So it is a patient or the evidence-based medications nowadays in Western culture, and I think it in a near future we have to adapt this one. We will adapt this modality, right? If forget about the industry now, when you are going in the hospitals, in the primary health centers, what is going on the top? Nothing. Sometimes the downstairs something is going wrong, right? Or different. We cannot say wrong, but the different scenario is going on. So we had research last year about the cancer chemotherapy and breast cancer. We are just checking the prescription, and we realized what is going on in around the globe. Here they have these one, two, three drugs, and they are playing with these 1, 2, 3 drugs, right? So you see, this personalized medication is important. So here, what is the ultimate goal, right? So they are checking the patient condition and that response from that medications. They are trying, they are managing the condition, or they are using, they are setting the treatment chart, right? So means prescription of specific treatment and therapeutic base suited for an individual. It is also referred to an individualized or individual based therapy based on the patient genotypes, circadian rhythm, biochemical and hematological parameters. The example, which is we all know that patient, there are many variations in the effect, the biological effect in isoniazid in TB, and you know the epidemiology of TB is very high, and isoniazid is a very strong drug in the pharmacotherapy in TB, right? Then succinylcholine, also very good neuromuscular junction blocker. If we are not taking care of this one, and if we are giving inappropriately without checking that the enzyme presence, right? Can we say that presence? If there is a deficiency or atypical enzyme is there, then our drug is not get metabolized and shows the succinyl apnea. Then G6PD deficiency with many drugs, and patient is really suffering from hemolytic anemia. Same way the glycoprotein, and this one malignant hyperthermia, not only with a halothane but also succinylcholine with some genetic variations. The malignant hyperthermia is so common, right? So how to handle that one? By checking the patient response, or you can say the patient condition, then you give medications, right? Okay, the risk factor and disadvantage of this new formulation. So physical, chemical, and microbiological stability is very important. Sometimes oral liquid has dosing error. The cost effectiveness, like liposomal preparations, is very high. So as we know that the good effect is there, the effectiveness is so high with the liposomal preparations. Still, we cannot use, or the patient cannot afford, right? That preparation is a cost effective. So, and also other things like where we are living, the availability of the drug is not possible sometimes. And I have a very good point here. These risk factors or disadvantages are become the target for novel formulation, or they are the target to we are looking to get our new research, right? So yes, those are the risk factor or disadvantage. Even we have a many more, right? This is just a common one. At the end, I would like to thank the whole team, right? The team of this conference, and also the full fraternity of Jyoti Vidyapith, Women's University Jaipur. Also thankful to my family, right? And at the last but not least, Almighty God for giving great strength, right here. Thank you, and my references. I think I am done.
Thank you, ma'am. Thanks a lot for
Yes.
your valuable remarks and valuable presentation. It
Okay.
was really, it was containing so much of knowledge, ma'am. You have shown so much newer technologies, and it will be really helpful for our students also, and whosoever, all the stakeholders who are associated with. Actually, this I am very glad to share that from morning onwards, if we see the technologies, the newer health technologies shared in the platform, is in fact a record in that sense, because such new technologies in single slot from morning, I don't think it's a great combination of all the health technologies which have been shared here. And after this, our students will also be so. First of all, I would like to thank you, ma'am, for sharing. And our student will also be sharing their innovative views for health technologies. And Dr. K.M. Nurullah sir has also shared technologies and newer things which can be applied. So I'll request you, ma'am, if you can spare your 10-15 more minutes to evaluate our students, to have a look of our students' presentations also. I'll request Nurullah sir also. And if you can give any of your remarks to them also, that will be helpful for us, sir. So now we are proceeding for few of our students' presentations. So they will also be sharing the recent advancements in health technologies. So pharmacotherapy and health technology. So please be connected with us, respected Harshika Patel ma'am and respected Dr. Narula sir. So if any suggestion is there, please share to them. I'll request JVN Shilpa Thakur ma'am to proceed with the student presentation. Shilpa ma'am.
Yes, sir. Thank you. Thank you, everyone. Now let's start. Let's again begin with the presentations of students for Bachelor's of Pharmacy. First, I would like to invite the students Aditi, Deepesh, Deepika, and Aima of 8th semester Bachelor of Pharmacy for providing a presentation on 3D bioprinting and metaverse.
Namaste, Honorable Professor Dr. Dharmendra Ahuja sir, Director ma'am and all the dignitaries present here. I am JVN Aditi.
I am Jaipur. I am Jaipur. Alma Good.
We are here to present our topic, that is 3D bioprinting and the metaverse, a game changer in healthcare. Moving forward, let's get an intro of the word metaverse. It is a development which stands out above all the other developments of extended reality. And for the
Please share your
healthcare
PPT, students. Please share your PPT.
Just yes, sir. Just.
So metaverse is a development which stands out above all other developments of extended reality, and for the healthcare world, 3D bioprinting is one such creation, which we can refer as the metaverse of healthcare. Although extended reality is also of very importance in healthcare industry, let's get a look at what is 3D bioprinting. It is a technology which enables us to create a uh, model of normal tissues. So it's a three-step process in which first we create a model, then step by step using bioinks the tissues are connected, and in the third step it is left for some times for mature or their growth. What is future specs and difficulties in 3D bioprinting? Printing tissue and organs that are individual to a patient and can be utilized for transplantation or repair. Creating organoid chips that can be used for pharmacokinetic and drug. Ensuring the printed cells integration, development and survival within the host tissue or organ. Enhancing the printing processes, resolution and accuracy to produce delicate details and structures. Role in drug discovery. To study pharmacokinetic and pharmacodynamic effects of drug. Researching in the medication action mechanism and drug resistance in many diseases. By recreating the body's 3D tissue structure through 3D bioprinting, we can grow cells in the same way as they are found in the body. What are the challenges 3D bioprinting might face? Choosing appropriate bioinks, ensuring the ethical norms, efficacy and safety of bioprinted items for use in clinical setting, monitoring the printed cells functionality and vitality both during and after bioprinting processes. Human scale tissue and organs can be printed. However, this requires a lot of cells, vascularization and bioreactors. Brain-computer interfaces.
PCI or smart pens are technology that enables direct brain to external communication with a machine, usually a computer or a prosthetic limb. Despite of using normal neuromuscular output, it acquires signal, analyzes it, and translates it into command that are relayed to output devices that carry out desired actions. There are various applications of BCI such as a wheelchair which might be operated by neural signals of a patient suffering from paralysis or any stroke, etc. And other applications of it as rehabilitation neural circuit testing, P300 factors-based healthcare control systems. Limitations of PCI. They may result in long-term issues, surgical injuries, and other negative effects such as scarring, infections, hemorrhage, inflammation, or device failure. They may bring up moral concern relating to human dignity, identification, privacy, security, consent, and responsibility. Moving forward to conclusion, BCI and 3D bioprinting are both interdisciplinary fields that require collaboration and innovation from various disciplines, such as neuroscience, engineering, biology, medicine, ethics, and law. BCI and 3D bioprinting can benefit from each other's advantages and challenges as they both involve the interaction between living and artificial systems. PCI and 3D bioprinting can also complement each other in some applications, such as creating neural interfaces for bioprinted organs or tissue. However, they need to overcome various social, ethical, and other barriers. Thank you.
Yeah, thank you, Beta. Your presentation was really nice, and you have shared that computer brain interface and 3D bioprinting technology. So these all are newer and innovative things which are coming. I really appreciate your efforts that you have seen. You have searched the so innovative things. So thank you. If any any input from Dr. Nurullah sir or Arshika Patel ma'am, if they can or if they can add anything for the students' motivation, it will be good for us.
Yeah, thank you, sir. Thank you, sir. Actually, it was a really nice presentation. Actually, the area, especially bioprinting, which is once again it is a booming area. Difficulties are there. We agree with that, but if there is a difficulty, then there is some one day success is there. Yeah, there is a success. So really nice presentation. I appreciate the thing. Just to presenting sense, if you collect something and do, it is not going to help. As you are young and budding, please follow what to be done. Really, there are many ethical issues involved in this area, and really there is much scope in this area. So not to present and stay away. Please continue to do something. One day you will be succeeding in this area in innovative manner. Thank you.
Very nice. Dr. Harshika Patel ma'am, if you can uh, say some motivation or or if you want to suggest them something, then we will, otherwise we will proceed for, yeah, please tell me.
No, sir, it's a good work. Just keep going. Actually, my idea is not there, but yes, I can say the idea is so innovative.
Yes. Yeah, thank you, ma'am.
Thank you.
So, yeah, so Shilpa ma'am, please proceed for the next presentation.
Yes, sir. Next, I would like to invite sixth semester students. They will present a presentation on another recent topic, that is nutrigenomics. So I will invite Ananya, Seema, and Priya for the presentation.
Namaste, Dean and Director FPS, Dr. Dharmendra Ahuja sir, all higher dignitaries, IJVN Ananya Anand, and IJVN Priya Kumari, IJVN Simayana. Today we are presenting our topic, a review on the concept of nutrigenomics on International Conference on Emerging Trends of Pharmacotherapy and Health Technology. Nutrigenomics, branch of nutritional genomics in which study the effect of food and food constituents on gene expression. Gene expression is the process by which a gene gets turned on a cell to make RNA and protein. It also determines individual nutrition based on genetic of person and also correlation between diet and chronic diseases. The four basic pillars of the nutrigenomics are improper diet, dietary chemicals, genetic makeup, Diet regulation. Nutragenetics. Nutragenetics is the coordination of individual response of various dietary nutrients. According to nutragenetics, it's shown in the given figure, that is figure first, that is a food interaction. And according to this figure, this is shown that your genes affect how our body responds to food, that is nutragenetics, and what you eat affect how your genes behave, that is nutragenomics. And according to figure second, it is shown that how environmental changes and behavior will influence the gene. Goals of nutrigenomics. The goals of nutrigenomics is information on nutrigenomic research like public awareness for eating and lifestyle. Second, how it helps people live longer and healthier. Interaction with DNA and structure that changes the DNA. Nutrigenomics with diseases. Nutrigenomics, improper nutritional intake cause genetic factor on various diseases like cardiovascular, in which low saturated fat, high fibers plant will reduce heart disease. Second, obesity. Obesity is the dietary intake and less spending. Obesity can be controlled by taking vegetables, plant oils, protein. Type 2 diabetes mellitus. Some food like resveratrol, quercetin, etc. Interact with DNA and show protective effect on type 2 diabetes mellitus. Cancer. Excess intake of calories can enhance cancer risks, such as component like calcium, zinc, vitamin, which control cancer. Anti-aging. Proper dietary intake will make you younger. What are the future aspects of the nutrigenomics? Future aspects. It have diverse use in omic technology. Omic technology is the detection of gene and biomarkers. Biomarkers is the used to see how well body respond to the treatment of disease. It is very young and quickly growing sector that is acting on personalized medicine for the discovery of various genetic variant for disease that have genetic predisposition that help to improve dietary advice. Conclusion. Conclusion, in the growth of human nutrition and food nutrigenomics is tremendous area and widely increased area of science. In this, by genomics, nutritional element and gene are grown widely. It is now possible to better understand how food affect the genetic code, how organisms react to this interference, and how lifestyle and food will affect the body. These are some references. Thank you, sir.
Can you come to your topic part? Just
Yes.
first slide.
Yes.
Okay. Okay. Nice. So you are basically highlighting the nutrigenomics, no?
Yes, sir.
Yeah, this is also a innovative thing, and it can be worked a lot.
Yes.
So yeah, means Dr. Nurullah sir is there, Dr. Hashika Patel ma'am is there.
Yes, yes,
Yeah.
yeah. Once again, a very good area. I once again congratulate. Just can I just as a reviewing purpose, I want to just know how much you worked on this. Can you tell me exactly what are the key factors which will have an impact on this nutrigenomics? What are the
Uh,
important factors which can be addressed or which cannot be addressed in regards to the nutrigenomics?
so mainly it is in research field for the public awareness. That
Okay.
how lifestyles can change our gene and how eating style will affect our gene, which can cause some diseases like cancer that I told.
Okay. Can poverty have a role in this?
Sorry, sir.
Poverty. Food can change, but a person not having a food to eat can also
Poverty.
have an impact.
If a
Poverty,
person is poor,
malnutrition also can have a impact. Food can have a direct impact, but poor people without having a good food can also have an indirect impact. So that is what I was expecting. And once again, ethnic. ethnic changes, genes not same all over the world. So the different types of ethnic changes can have a different impact on this nutrigenomics. That is once again very important factor to be noted before understanding the concept. So poverty, malnutrition, gene, ethnic, these are all important factors. Just I want to just as a review, I want to ask how much you depth in this topic.
Your
Thank you, sir.
remark is quite correct, sir. Yes, sir. Yes.
Thank you. Thank you.
So, okay, student, you have tried to go for a innovative topic. That's good. Okay. So we can proceed and next, Shilpa ma'am, please.
Yes, sir. Next, I would like to invite Aarti and Anshu, 8th semester B.Pharm students, on a topic of diabetic neuropathy in the 21st century.
Yes, please start. Please introduce yourself and then share the PPT.
Namaste to the Professor Dr. Dharmendra Ahuja and the coordinate ma'am. I am Jaipur Nana here to represent my presentation on the topic of diabetic neuropathy. It is a type of nerve damage that can occur if you have diabetes. Diabetic neuropathy are the most prevalent chronic complications of diabetes. These heterogeneous group of conditions affects
So
different
that
parts.
is okay, beta. You are sharing diabetic neuropathy, but what actually we are mainly highlighting the emerging trends. So
Yes, sir.
have you seen any latest advancement in this area? Please highlight that.
Yes, sir. Sir, in 20, sir, nanoparticles. Sir, in modern era, there are several tests like filament testing, sensory testing, nerve conduction test, which prevent the nerve damage. And
Okay,
yes, sir.
nice, nice.
And sir, there are two types of treatment: non-pharmacological and the pharmacological. In non-pharmacological treatment, like nutritional therapy, proper diet, regular exercises, stop smoking and drinking, and sir, pharmacological treatments like different drugs and the surgeries. That's like antidepressant and serotonin drugs. Sir, we also change our lifestyle, like to eat healthy foods, regular exercises, and so its conclusion is peripheral neuropathy is a serious complication of diabetes. This form of neuropathy carries a high risk of pain, tropic changes, and autonomic dysfunctions. Diabetes is a slow killer with no non curable treatments. Different types of nerve damages cause different symptoms. Symptoms can range from pain and numbness in your feet to problem with the function of your internal organs. And future future scope of neuropathic diabetes, like diabetes has become one of the largest global healthcare problems of the 21st century. The number of people with diabetes worldwide is predicted to double between 2000 and 2030, reaching a pandemic level of 366 million people. Diabetic polyneuropathy, which has a lifetime prevalence of approx 50%, is the most common diabetic complications. Thank you, sir.
Okay, we understood your point. It was means you were trying to highlight the newer identification technologies for diabetic neuropathy. Means your concentration was in that sense. It was on the emerging trends. Nice. Silpa ma'am, can we proceed for next one?
Yes, sir.
Thank you.
Next, Anjali, Radha, and Parul, students of 6th semester, Bachelor of Pharmacy, I invite them to give a presentation on gene cataract. Namaste. All the higher authority and respected Professor Dr. Dharmendra Ahuja sir, Dean Director from the Faculty of Pharmaceutical Science, IJBN Anjali Sharma, pursuing Bachelor of Pharmacy from the Faculty of Pharmaceutical Science, IJBN Pal from the Faculty of Pharmaceutical Science, IJBN Radharani from the Faculty of Pharmaceutical Science. First of all, thank you for giving me this opportunity to present here. We are here to present we are here to present the presentation on topic is current development and trends of pharmacotherapy in gene cataract. Now I am going to discuss about gene cataract, its causes, diagnosis, medication and surgery of cataract. I will discuss about what is the cataract. Cataract is a clouding of the normally clear lens of the eye. Those people who are suffering from cataract see through clouding lens. The region behind of clouding vision of each cataract that cause in difficulty to read, drive a car, especially at night, and facing problem to the see the expression of friends' faces. Most of the cataract develop slowly and do not disturb your eyesight early on, but with time, cataract will eventually interfere with your vision. Causes of cataract. Now I will discuss about causes of cataract. These are many causes including in cataracts like age, trauma, infection, inflammation, surgical, drugs, etc. Now, I will discuss about diagnosis of cataract. Recent advancements are available over the worldwide for the diagnosis of cataract, like refraction and visual acuity test, slit lamp exam, retinal exam, optical coherence tomography, regular eye checkup using torchlight, etc. Various medicines are available in the market for the treatment of gene cataracts that are discussed below. Example, ciprofloxacin ophthalmic, moxifloxacin, basifloxacin, levofloxacin, gatifloxacin, erythromycin, etc. Now I will discuss about surgery of cataracts. In the surgery of cataracts, various steps are including that first steps are incision is made. Second steps are emulsification. Emulsification is the process that breaks up cloudy lens. Third steps are intraocular. Intraocular lens is implicated. Fourth step is the final step in which the incision heals on its own. Now I will discuss about future prospect of cataract, in which ORS, its mean opti-wave refractive analysis, that is used by a surgeon for the treatment of cataract. In this ORA is a method of refractive measurement in the operating room that is increase optimal lens power. The demand of this increase day by day and very effective in future. Second is optical coherence tomography. OCT is an emerging technology for the performing high resolution cross section image. OCT is a non invasive imaging test that uses light waves to take cross section picture of your retina. Last slide is conclusion. Opacification can be avoided by using medically prescribed substance, including vitamins, supplements, diet, antioxidant, and gene therapy. Thank you.
Okay, So it was nice presentation, students. Now we can proceed further.
Next, thank you, students, for the presentation. Next, I will invite Shagufta and Mahima for a presentation on the topic of diabetes gangrene. They are from 8th semester Bachelor of Pharmacy.
Namaste, Professor Dr. Dharmen Ahuja sir, Dean and Director of Faculty of Pharmaceutical Science, all the higher dignitaries present here. I, JVN Shagufta Nath, student of pharmacy from Department of Pharmaceutical Science, 8th semester.
And I, JBN Mahima Sharma, student of Pharmaceutical Science from 8th semester.
Today, I am here to explain my presentation on the topic, the pitfall of diabetes gangrene, advancement in pharmacotherapy. So firstly, I want to explain what is diabetes. Blood glucose level increases, that is the condition called hyperglycemia, is known as diabetes. Now I am talking about gangrene. Gangrene is a death of body tissue, mainly due to the lack of blood supply. The body parts that are affected due to gangrene are toe, fingers, arms, leg, muscles, and internal organs. This is the dramatic diagram how the gangrene is formed in our foot. There are different types of gangrene, diabetes gangrene, fournier gangrene, gas gangrene, dry gangrene, bad gangrene, internal gangrene. So basically in this slide, I want to explain fournier gangrene and gas gangrene. Fournier gangrene is caused mainly due to genetical organs. Treatment of fournier gangrenes. Firstly, surgical debridement, HBOT therapy, and vacuum assisted closure. This is gas gangrene. A grammatical diagram of gas gangrene. Gas gangrene is the damage of the body tissue. The bubble formation is formed in our soft tissue. Various species of Clostridium that causes gangrene and infection. Mainly, Clostridium perfringens causes diabetes gangrene of gas. There are various treatments, amputation, HBOT, various antibiotics are available, and surgical debridement. Diagnosis of diabetes gangrene. There are various imaging tests like X-rays, CT scans, MRI, various blood tests, and surgery. At last, I want to explain the future perspective. Pharmacological management may be necessary if the patient still has a high risk of developing diabetes and cardiovascular disease, even after making sufficient lifestyle changes. Currently, the best strategy is for the doctor to spend enough time encouraging the patients for successful lifestyle changes. So, at last, I want to explain the precautions. Precautions: control diabetes, control cholesterol level, daily exercise, and take plenty of fluids. Thank you.
Okay, thank you, students. You have shared a very valuable information on the latest emerging trends. So it was nice. I'll request Shilpa ma'am to proceed further as we are lacking in time also,
Yes, sir.
and ask them to summarize the thing in a summarized manner.
Yes, sir. Next, I would like to invite 6th semester students Bhavya and Tanu for their presentation on emerging trends in treatment of hepatitis B.
Namaste, all higher dignitaries presented over here. Dean and Director of APS, Professor Dr. Dharmendra Ahuja sir, and Coordinator ma'am. I, JPN Bhavya, pursuing B Pharm 6th semester from the Faculty of Pharmaceutical Sciences. I present here to present my topic, emerging trends in the treatment of hepatitis B with modern medicines. Hepatitis B. The hepatitis B virus is the cause of the liver illness known as hepatitis B. It is transferred through perinatal transmissions from infected mother to newborn as well as by contact with infectious blood or other body fluids such as semen or vaginal secretion during sexual activity. Its common symptoms of hepatitis B infections: loss of appetite, mild nausea and vomiting, stomach pain, Pale or light colored stool, dark tea color urine, yellow eyes, skin called jaundice, bloated or swallowed stomach. Diagnosis. Your healthcare provider will examine you and look for signs of liver damage such as yellowish skin or belly pain. Tests that can help diagnose hepatitis B or its complications are blood test and liver ultrasounds and many more. Treatment. There are lots of treatment of hepatitis B, but mainly antiviral medications. These drugs are taken by mouth as orally. Your provider may recommend combining two of these medications or taking one of these medications with interferon to improve treatment response. Interferon injections. Interferon alpha 2b is a man made version of a substance produced by the body to fight infections. It is used mainly for young people with hepatitis B who wish to avoid long term treatment or women who might want to get pregnant within a few years after completion of a finite course of therapy. Last one is liver transplant. If your liver has been severely damaged, a liver transplant may be an option. During a liver transplant, a surgeon remove your damaged liver and replace with a healthy liver. There is future perspective. With just S protein as the mutant, HBV may avoid HB immunization. The efficacy of third generation HB vaccination, including pre S protein in addition to S protein, should be assessed in order to prevent infections and spread of HBV with S mutation. Many nations have not yet adopted UV. It is essential to promote UV in these nations if we are to completely eradicate HBV infections. Conclusion. According to my research, even though disease knowledge is the key to lowering the disease burden, hepatitis B is a serious public health issue in India since a fully recovery is not achievable with the medication now on the market. The goal is long term suppression of the virus by protective therapy, which can itself result in subpar adherence to the treatment and therapy costs that are prohibited. In the end, this is what cause inadequate disease control, infection progressions, and disseminations. At last, references, and thank you. That's all.
Okay, beta. Uh, nice view sharing. Now I'll request Silpa ma'am to proceed further. Thank you,
Yes.
students.
Next, I would invite Ishika and Rashi of 8th semester. Sorry, Ishika and Shrishti of 8th semester to give a presentation on psychiatric disorders and schizophrenia.
Namaste, all the higher dignities and Dean and Director of FPS, Dr. Professor Dr. Dharmendra Ahuja sir, Coordinator ma'am, and all the guests present here. I, JV Nishika Singh, student of B Farm 8 SEM, and
I, JV Srishti Srivastava.
we are going to present on the topic psychiatric disorders in adults and management of positive symptoms of schizophrenia. What is schizophrenia? Schizophrenia is a mental disorder which is characterized by continuous or relapsing episodes of psychosis. Mainly, it is caused by any stress or any social problem, poverty, physical health, etc. Uh, the symptoms of schizophrenia are delusion, hallucination, negative symptoms, abnormal motor behavior, and disorganized thinking. Now, treatment of schizophrenia.
Even after the symptoms of schizophrenia have faded, treatment is still necessary for life. And pharmacological treatment, there are first generation antipsychotics and second generation antipsychotics. Management of symptoms, physical exam, test and screening, psychiatric evaluation, and diagnostic criteria for schizophrenia. Diagnosis of schizophrenia.
Mainly, there is no objective of diagnostic test of schizophrenia. The diagnosis is based on the observed behavior, psychiatric history of family, and etc.
Future perspective. In future schizophrenia research, the focus of therapeutic study will move away from schizophrenia as a disease entirely onto a specific domains of pathology, promoting the development of targeted drug therapies. 50% of people with schizophrenia recover or improve to the point they can work and live on their own.
25% are better but need help from a strong support network to get by. 50% are not better. Conclusion. Schizophrenia is a very serious illness. Often people don't realize how serious this illness is. Sometimes people will make fun of it. Schizophrenia is caused by having excess dopamine. A lot of homeless people suffer from schizophrenia. Luckily, a cure has been developed for a disease. Up until 2003, there was no cure for schizophrenia. There are references. Thank you.
Thank you.
Yeah, okay, thank you. Nice sharing of the knowledge.
Thank you,
There,
students.
I think students have disconnected. Yeah. So I'll request Shilpa ma'am to please proceed for the next one.
Yes, sir. Thank you, students. Next, I would invite Ayushi and Nandini for presenting a presentation on pharmacotherapies for COVID-19.
Namaste, all the higher dignitaries, Dean and Director, Professor Dr. Dharmendra Ahuja sir, respected faculty members, and my dear JBNs. I, JBN Ayushi Jain, pursuing Bachelor of Pharmacy.
And I, JBN Nandini Sharma.
We are here to present the presentation on topic Emerging Pharmacotherapies for COVID-19. Contents Introduction, Management Guideline, Clinical and Clinical Evidence of Drug Therapies, Immune-Based Therapies, and Conclusion. Introduction. First discovered human case of COVID-19 in Wuhan city. It is respiratory disease caused by SARS-CoV-2. Most prevalent presenting symptoms are fever, cough, weakness. Pharmacological therapies for COVID-19 can be separated into two sections based on the pathogenesis of the disease. Management guidelines, supportive care such as additional oxygen, mechanical ventilator support when necessary. WHO and CDC advise people with respiratory infection to cover their mouth and nose while sneezing and coughing, and to avoid direct contact with those who have acute respiratory infection. Guidelines on clinical management of COVID-19 released on 30 March 2020 by the Indian Ministry of Health and Family Welfare. Now we
Your
are
slide
discussing.
is not visible, beta.
Sir, now it is visible. Is it visible?
Yes, yes, visible.
Okay, sir. Now
Now it's
I will discuss about preclinical and clinical evidence of drug therapies. Remdesivir, chloroquine and hydroxyquinine, lopinavir, ivermectin, convalescent plasma, and drugs acting against pro-inflammatory factors. Intercolin first, intercolin second. Um
no, you come
immune.
to main. What are the recent advancements you share that basically?
In order to certify, prevent the morbidity, death, and spread of COVID-19, a number of drugs have to be repurposed. Remdesivir has produced the best result and may currently be a useful tool for lowering COVID-19 mortality. COVID-19 treatment may benefit with immune-based therapy using corticosteroids and anti-SARS-CoV-2 monoclonal antibodies. References and thank you, sir.
Okay, thank you. Nice. Your thought is towards the COVID treatment guidelines. It was nice. Now I'll request Shilpa ma'am to proceed for next one.
Yes. Now, let us proceed. It is the last presentation of today's today's day of international conference, and I would like to invite student of 8th semester B.Pharm Shivani Kriti to give a presentation on genome editing.
Yes. Please introduce yourself and then share your slide.
Namaste, all the higher authority, Dean and Director, Professor Dr. Ahuja,
Professor Dr. Dharmendra Ahuja sir, and respected faculty members and my dear JVNs. I, JVN Shivani Kriti, pursuing Bachelor of Pharmacy from the Faculty of Pharmaceutical Science. I am here to present the presentation on topic biological breakthrough in genome editing CRISPR-Cas9 technology, a blessing or a distressing development. Introduction. CRISPR-Cas9 is a unique technology that enables genetic and medical researchers to edit part of genome by removing, adding, or altering section of DNA sequence. The CRISPR-Cas9 system discovery. Using CRISPR, the bacteria snipe our part of the virus DNA and keep a bit of it behind to help them recognize and defend against the virus next time it attacks. Understanding the process, how CRISPR works. The Cas9 protein from a complex with guide RNA in a cell. Second, this complex attached to a matching genomic DNA sequence. And third, the Cas9 RNA complex cut the double strands of the DNA. Fourth, programmed DNA may be inserted at the cut. Application of Cas9. CRISPR-Cas9 has a lot of potential as a tool for treating a range of medical conditions that have a genetic components, including cancer, hepatitis B, and even high cholesterol. Carrying out gene editing is germline cell currently illegal in the India and the most other countries. What is the future of CRISPR-Cas9? It is likely to be many years before CRISPR-Cas9 is used routinely in humans. The use of Cas9 enzyme that will only cut a single strand of the target DNA and rather than the double strand. This means that two Cas9 enzymes or two guide RNA have to be the same place of the cut to be made. Conclusion. CRISPR-Cas9 is a RNA guided targeted genome editing tool which allows researchers to do gene knockout, insertion, and deletion in cell lines and animals. Thank you.
Okay, so uh, means can you summarize like what you have just shared? So how it works toward emerging trends?
Sorry, sir.
What is the latest thing in your PPT? What is new?
Sir, understanding the process.
Okay.
How CRISPR works, sir.
Okay. So, and the CRISPR itself, it's a newer technology, no? So,
Yes, sir.
I will thank once again Dr. Nurullah KM sir, who has associated with us and stayed with us for the students' motivation, because sir, your presence is motivating to our students. At present, just now Harshika Patel ma'am has disconnected, so ma'am was also connected with us. So it's a motivation for all of us, and now I think all panelists have disconnected. So I would like to thank once again, and now I am closing today's day, and it was really nice. Different speaker from 6 countries have communicated today, from Ethiopia, from Oman, from Kenya, from Mauritius, from number of other countries, from Malaysia, different speaker connected. From India also, renowned speaker from All India Institute of Medical Science and other renowned institution connected. And once again, I would like to thank uh, Honorable Advisor and CEO Vedant Garg sir for giving us opportunity to assemble these dignitaries, to bring together these dignitaries on a single platform and giving us opportunity to motivate our students also. And I will also thank respected registrar ma'am for giving us the opportunity. So once again, thanks to all the dignitaries associated with us. all the speakers, all the stakeholders, all the students, technical team. Although tomorrow is one more day, tomorrow is the ending day of the session, means this international conference. So tomorrow morning, once again, we will be connecting with you. For today's session, we are just signing off. So thank you. Thanks a lot. Namaste.
Thank you, sir. Thank you.